Oatmeal that hydrates and moisturizes your dog's skin for a healthier and manageable coat. Vitamin E is an antioxidant that protects and repairs the skin and generally prevents it from dryness. And guava extract has a natural antibacterial property to maintain healthier and germ-free skin that prevents your pet's excessive loss of hair. Pappy Oatmeal Hair Regrowth Shampoo is enriched with oatmeal that hydrates and moisturizes your dog's skin. Aloe vera extract that prevents your pet's hair loss. It also soothes dog's skin to prevent itching. Andiroba oil has been used as an anti-inflammatory property that helps our pet's coat and skin, leaving them a softer and healthier manageable skin and coat. Pappy Oatmeal Insect Control Shampoo gives a long-lasting relief in controlling external parasites such as ticks, mites, and fleas. It contains oatmeal that hydrates and moisturizes.
Good morning, STEM colleagues, partners, and fellow veterinary professionals. I'm Dr. Mary Ann Navales Mirasol, and it is both an honor and a pleasure to be your master of ceremony for the day 2 of our 5th Veterinary Forum course. After an engaging first day of learning and collaboration yesterday, we are all set for another enriching lineup of case studies, clinical insights, and expert discussion that push the boundaries of veterinary practice in the Philippines. So to officially start our day, let us first acknowledge the presence of God with a prayer.
Panginoon, Kami po'y sumasa inyo sa mga oras na ito upang magpasalamat sa pagkakataon at mapagpakumbabang hilingin ang inyong gabay at karunungan sa pagsimula ng makabuluhang programa para sa aming bayan. Panginoon, kalooban ninyo kami nawa ng sapat na lakas at pagpalain ang bawat isang naparito na siyang bumubuo ng mahalagang hakbang na ito. Dalangin namin na magsilbi itong daan tungo sa mas epektibo at progresibong paglilingkod sa publiko. Itinataas po namin ang lahat ng ito sa ngalan ng inyong banal na presensya. Amen.
Good morning again. Let's take our seat. First, I would like to acknowledge the presence of our committee, our dear speakers and presenters, our sponsor, VetMate, and each of you who continues to support this forum with your dedication and passion for animal health. So to open the program, may I call on Doc Eugene Kumo for our announcements and acknowledgement regarding our next schedule for the next few months. Doc Eugene.
Thank you very much, Dr. Marianne. First and foremost, I would like to say thank you very much to our sponsor, especially the VetMate Pharma Corporation. And also thank you very much for the Philippine Veterinary Medical Association as our CPD providers. So my task this morning is to give you a glimpse of what will be happening within the PCCP for the next few months. So next month, June, it will be the culmination of all the sacrifices of these applicants. So it will be a conferment. There will be a conferment on June alongside with the VPAP annual conference. And also we are inviting everyone, those who are in the Zoom and here in the venue to attend the VPAP. Some PCCP diplomates and fellows will be presenting also during this conference. So this is the whole activity for June. And for August, we will be attending the Pet Summit. PCCP is one of the sponsors for this event. And comes October 28, 29, and 30, we will launch our first ever postgraduate conference or scientific conference at the SMX Aura Taguig City. So for those who are interested for this conference, so this is our ads. So please contact some of your companies, some of your distributors of many veterinary products. So this is our ticket for that conference. And the topics for the conference includes hepatobiliary and exocrine pancreatic disorders. This is on the day 1. On the day 2, we have urinary systems. And on day 3, we have hematology and artificial intelligence. So I am inviting everyone to take note these dates for the conference. So we will also be sending some invitation for you to send abstract for this said conference. So to end this year's PCCP activities, we will be also posting some invitations for our year-end party. So please wait for further announcements, and we promise that there will be more to come for the Philippine College of Canine Practitioners. Thank you very much.
Yes, thank you so much, Doc Eugene. So much events that we need to anticipate also and wait for it. Now, to open the program, may I call on, also let's give a warm welcome valued partner. We also thank VetMate for their continued support in bringing us closer to smarter integrated veterinary services. So let's give a warm of applause to Dr. Dennis Bernabe for today's activity, day 2. Doc Den?
Good morning sa lahat ng mga nasa online, lahat na nandito. So I would like to thank Pengle Restaurant para dito sa venue natin. Then syempre, gusto kong thank you sa lahat ng bumubuo ng PCCP para do sa joint project na to. Then dapat pala hindi pala ako nagte-thank you. Welcome pala to. So yun, welcome ulit sa day 2. Hopefully kahapon, medyo ang ganda ng mga topics kahapon. So, sana na-appreciate natin. Then, syempre, yun nga sabi ko kanina, nag-chat ako doon sa online, sa mga nasa online. So, yung mga hindi nakapag-fill up kahapon ng mga questionnaires, saka yung evaluation ng mga speakers. So, i-repost naman ulit ngayon para maipasa na sa final para maano natin yung sa CPD points. Then syempre, thank you sa lahat ng mga nag-attend. Please continue supporting VetMate Pharma Corporation sa mga products. So, yun, marami kaming mga lalabas na mga products. Then yung mga na-stop natin, hopefully by this year makabalik. So, thank you.
Thank you so much, Doc Dennis and VetMate. So now, let's dive in. Very interesting topic. We do have 8 presenters with 8 very interesting and innovative topics for today. Before we begin with our Day 2 lecture series, we are privileged to have our first presenter. He is highly accomplished veterinarian and entrepreneur. The owner of Whistler Animal Clinic in San Jose City, Nueva Ecija, and co-owner of the 2 other veterinary clinics. Currently, he serves as the president of the Nueva Ecija Veterinary Medical Association, NIVMA, a proud alumnus of the Central Luzon State University. He graduated with a degree of Doctor of Veterinary Science and Medicine, DVSM, in 1995, and Bachelor of Science in Animal Husbandry in 1993. His exemplary contribution have earned him a recognition. He is a silver awardee in business entrepreneurship in CLSU 10 Outstanding Graduate Award Program 2019. Beyond veterinary practice, he is the CEO and major shareholder of Agritop Corporation, a veterinary importation and distribution company. He also shares his expertise as a part-time faculty member at the College of Veterinary Science and Medicine in Luzon State University, where he mentors future veterinarians. His career is a testament to his passion for veterinary medicine, dedication to entrepreneurship, and commitment to leadership, making him a respectable figure in his field. Our presenter for today, he will be presenting a fascinating case titled Surgical Correction of Type 2 Atresia ani with Rectovaginal Fistula in a British Short-Hair Kitten. Let us now welcome Dr. Joey T. Tariga to the Verta floor. Doc?
Thank you very much for that great introduction, Doc Mirasol. To all my batchmates, diplomates, fellows, and online listener, good morning po sa inyong lahat. Today, I'm going to present one of my case encountered in my clinic, titled Surgical Correction of Type 2 Atresia ani with Rectovaginal Fistula in a 2-month-old British Shorthair Kitten. So, dito po ba dito sa Penglay, have you encountered na yung case na mayroong atresia ani and with rectovaginal fistula? So, wala pa. So, when I submitted the case report in PCCFP, so nung namili sila, tinanong ko yung sarili ko, why this case report? So, upon doing some research, yung atresia ani and with rectovaginal fistula sa cat is very rare na nangyayari. So, let me start with my presentation with this patient signalment. So, this patient is 2 months old female, British short hair, weighing 800 kilos. So, the name is Kippy. So, very millennial yung name niya, no? Kippy. So, this is a referral client from my former vet. So, itinawag sa kanya. So, the history provided was there's a difficulty in defecation. So, may dyschezia yung pusa. Next is, ang sabi is, there's diarrhea. So, palagi daw lusaw yung dumi. So, there's soft water stool. And then, compared to litter bats, siya yung pinamaliit. So, Kippy is the smallest in the bats. And kung mapapansin nyo, compared dun sa bats din niya, kakaiba siya kasi yung coat niya is rough. Hindi siya yung katulad ng iba na glowing yung coat ng cats. Aside from that, the kitten is playful, active, and still with appetite. So yung complaint lang is merong difficulty in defecation and soft water stool. So, dahil phone in lang yon, tinawag. So, suspect nila baka daw meron lang protozoa or something. So, I asked them to bring the cat in the clinic for clinical and physical examination. So, upon examination, so there's no visible anal opening. So, no patent anus. So, as you can see here, meron lang dent. So, sometimes it is called anal dimple. Next is, there's a fecal matter discharge exiting to the vulva. So, yung, sorry. So, there is a fecal matter exiting to the vulva. So, dahil wala siyang anal opening, it is possible that there's a connection between the vagina and the rectum. So, there's an abnormal connection. Next is, if you will notice this one, bulging yung perineal region. So, And once you palpate it, there's a palpable fecal accumulation on that area. So pagka pinindot nyo, so may lumalabas na poop. Then, as you can notice also, there is a swollen vulva. This is due to the fecal matter discharges exiting to the vulva. So nagkaroon na siya ng vulvovaginitis. So sa lab test, there's no significant increase or decrease. So normal naman yung mga lab test niya. So then my diagnosis as initial diagnosis, dahil there's no patent anal opening, so may atresia ani siya. Then, dahil there's a fecal matter discharge exiting to the vulva, kaya meron siyang possible na may rectovaginal fistula. So, nung nagpa-practice tayo before, pagka walang butas, yung puwet, ang tawag natin is atresia ani na lang. Palagi atresia ani. So, may definitive diagnosis after the surgery, nadagdagan lang ng category type E, yung atresia ani. So, it is considered as type 2 atresia ani with rectovaginal fistula. So, for the treatment, so surgical operation, kasi type 2 siya. So, I will explain later bakit surgical operation. So, the objective of the treatment is to create a functional anal opening and correct closure of the vaginal fistulous tract. And the surgical term for that is anoplasty. So, it is a surgical procedure performed to reconstruct, repair, or modify the anatomy of the anus. So, kahapon, sabi nga ni Doc M, pag nasa academe ka, you need to explain step by step and even some of the terminologies. So, let us take a quick review of the atresia ani and rectovaginal fistula. So, atresia ani is a congenital defect. So, developmental defect siya. So, may developmental errors that leads into anomaly, resulting in anal canal closure or abnormal routing of feces. So, dahil developmental defect siya or anomaly, so, i-review rin natin yung embryogenesis ng anorectum. Para maintindihan natin kung, usually kasi, when I explain to the client, pagka merong dinadala, so in-explain ko, tinatanong nila, Doc, saan po nakuha yan? So, better na i-review natin yung kung saan yung pathogenesis or kung paano itong atresia ani and rectovaginal fistula. So, balik tayo sa pag-aaral. So, the important anatomical structure here is the cloaca and the urorectal septum, cloacal membrane, primitive hindgut, and allantois. We all know that the cloaca is the precursor, or this will give rise the urinary system, digestive system, and reproductive system. So, ito namang urorectal septum, ang function niyan is it will grow caudally to divide the cloaca. So, madidivide siya into dorsal and ventral position. So, doon anorectal canal and the urogenital sinus. So, ito na yung urorectal septum. So, dinivide niya. So, here, meron na yung anal membrane, then urogenital membrane. So, during this stage, sa feline kasi, yung organogenesis, nag-start yan ng, meron yung sa ibang references, 11, yung iba 13 nagsisimula, up to 22 days. Then after that is yung fetal development na. So, according to some literature, pag any disruption during the organogenesis, so magkakaroon ng anomaly dun sa organ. But pagka na-form naman na yung mga organs at nagkaroon ng any teratogenic effect or any disruption, ang maapektuhan doon is yung function. So, since dun sa Atriciani is during organogenesis, any disruption na pwedeng mag-effect dun sa pag-grow ng urorectal septum to divide the cloaca will lead to fistulous tract. And if the anal membrane will not rupture, so magkakaroon ng atresia ani. So ano ba yung mga causes para magkaroon ng disruption dun sa during embryogenesis? So one is yung genetics. So considered siya na hereditary. So pagka yung mga signaling pathways na apektuhan katulad ng mga SHH, yung WNT, so pagka yung signal is naapektuhan na hindi nag-signal na ito mag-grow caudally, so magkakaroon ng anomaly. Then, yung environmental factors. During organogenesis, na-expose siya sa toxin or some trauma. Ngari, buntis, tinadyakan. So, possible na mag-lead sa anomaly dito. So, any disruption dun sa panong cloaca and urorectal septum lead to the problem for the anorectum and other, for example, the urinary system and the reproductive system. Next is, ito, yung prevalence ng Atriciani. So, I mentioned a while ago that this is a rare case. So, usually, nung nagpa-practice tayo sa, ano din kasi ka sa livestock eh. Sa swine, maraming cases ng Atriciani. So, alam ko lang noon, Atriciani lang yun. Basta, pag walang butas, Atriciani. So, around 70 to 80% ng mga reported case on Atriciani is sa livestock. Swine, cattle, goats. But in companion animals, pag around nasa 20 to 30%. So, it is rarely described in dogs and much more less frequently reported in cats. So, mas prone pa yung dogs dun sa cats. And pagka naapektuhan naman yung cats, it is more common in female cats than in male cats. When I browse some reference, parang isa lang yung nakita ko dun sa male cats. And ano pa siya, yung hermaphrodite, yung cats. Next is, so sabi ko nga kanina, yung initial diagnosis ko is Atriciani. So marami palang type yung Atriciani. So alam lang natin Atriciani pagka merong meron siyang rectovaginal fistula. So there are 4 types have been described in dogs and cats by Aronson in 2003. So meron yung type 1, type 2, type 3, and type 4. So, punta tayo doon sa type 1. Sa type 1, may patent anus siya. So, doon lang sa end ng rectum, merong naging stenotic. So, may stricture. So, hindi pa rin makakadaan yung feces passing through this stenotic part. So, patent yung anus. So, possible na merong makikita kang lumalabas na konti-konti. But, hindi siya capable na exit ng mga big stool. So, that's why siguro, if you notice, meron mga client tayo na pagka tumawag sa atin na, Doc, yung isang aso ko or yung isang kuting ko is bloated siya. Nakaka-poop ba? Hindi ko po alam kasi dinidilaan naman nung mother palagi. So, check lang nila kung parang hindi po nakaka-poop, so bloated yung ano. So, po pwedeng possible na meron pa lang, hindi lang nadidetect, and ito pala yung isang cause nung mga puppy or kitten na bloated. So, yung type 1 is patent yung anus, meron stenosis. So, each type ay merong procedure kung paano i-deal yung treatment. Then in Atriciani type 2, so persistent of a complete anal membrane. So may anal membrane in combination with the rectum ending as a blind pouch. So ito yung rectum, may blind pouch. Cranial to the membrane. So yung distance ng rectum o yung blind pouch dun sa anal membrane, usually around less than 1 centimeter. So, hindi patent yan kasi meron ng parang discontinuity nung rectum dun sa may anal membrane. Then, for the Atriciani type 3, meron ng presence of imperforated anus with the rectum terminating further cranially. So, napansin ko nung nire-review ko yung mga literature, so parang kinategorize lang nila is sa distance nung rectal pouch dun sa anal membrane. So, pagka etong rectal pouch is more than 1 centimeter away from the anal membrane, then yung type niya is type 3 na. So, pagka less than 1 centimeter, that is type 2. Yung type 1, patent yung anus. So, yun lang yung difference nung tatlo. Then, next is yung type 4. So, ito, much complicated na. Pagka yung blind pouch is inside the pelvic canal, tapos may discontinuity of the cranial rectum, so Ito na yung type 4. Minsan, umaabot na yung rectum or yung rectal pouch dun sa abdominal cavity na. So, sobrang layo na dun sa anal membrane. So, pagka ikaw nag-o-opera ng ganun, tas anoplasty lang yung ginawa mo, wala. So, most of the type, including type 1 up to type 4, sometimes associated with another anomaly, which is the rectovaginal fistula. But minsan, single lang naman na puro atriciani. But there's yung associated na, kunyari, yung mostly type 2, type 3 is often associated with rectovaginal fistula, according to some literature. So, yung rectovaginal fistula, katulad nung pinakita kong presenting sign nung cat, is merong fecal discharge sa vulva. So, yung rectovaginal fistula is abnormal connection between the rectum and the vagina. So, dahil sarado yung dito, hindi siya patent doon. So, parang nagkaroon ng diversion kung saan lalabas yung stool or yung feces. So, next is general surgical consideration. So, I remember that Doc Paul Cardenio asked me about the some surgical consideration. Kung po pwede daw bang ipagpaliban yung surgery during yung patandain mo na yung hayop. So, dito inilagay ko. So, there's, for age and health status, usually, piniperform to ng 6 to 8 weeks if the kitten is stable. But how about yung 1 week, 2 weeks, and bloated na? So sa 1 week, hindi mo pa manonotice na yung aso or yung pusa is meron ng atriciani. So in 2 weeks to 1 month, doon na mag-start. Meron lang yung siguro yung na-overfeeding, tapos talagang hindi niya ma-excrete yung fecal debris. So, doon na nag-start na mag-show ng sign. So, pagka gano'n na yung pinakita, then you need to operate kahit na less than 6 to 8 weeks pa siya. Then, severity of clinical sign. So, merong persistent straining, bloating, or inability to pass stool. So, kailangan na yung urgent intervention. I think last 1 month, one of my former student called me na meron siyang case ng atriciani. So, atriciani lang siya. So, bata pa parang 3 weeks. So, kailangan na raw bang operahan? So, tinanong ko if how's your assessment with dun sa patient. So, ayun nga, mayroong persistent straining, tapos may bloating na. Tapos, in pain yung aso. So, you need to operate the animal. Then, presence of secondary complication. So, if you found out that there's a megacolon, peritonitis, or severe infection, so it requires emergency surgery. Then, meron naman akong isang case sa aso. Ito yung sinabi ko kay Doc Paul nun. Ito yung picture niya nung kapapanganak. Kasi sinies ko yun eh. Tapos nakita namin na may yung dito, medyo malaki yung butas, pero this is the opening for the reproductive, dito yung vagina niya. Tapos yung you will notice yung anal dimple dito sa part na to. So meron siyang rectovaginal fistula. Kaya lang, this dog, yung puppy na to, medyo malaki yung fistulous tract na nakakonekta doon. So, due to financial constraint, ayaw naman pa-opera nung may-ari. Pero sabi ko, my advice is that if you happen to observe these clinical signs, you need to decide na ipa-surgery yung aso. Then, 3 years after, buhay pa yung aso. So, without any surgical intervention, pwede naman pala yun. So, it depends on your assessment na, yun nga, pagka lumitaw na itong mga clinical signs na to and secondary complication, then you need to operate. But if not, tapos enough naman pala yung kanyang fistulous tract, pwede pala mag-survive ng ganong katagal. Dalawa yan eh. Yung isa naman heat stroke and eto hanggang ngayon buhay pa. So, next. Ako na-reformat pala yun. Wait lang po. So yung, dun pala pagdating sa ganon, pwede mo ipagpaliban yung surgery depending dun sa assessment mo dun sa aso. Kaya lang, yung aso na yun, babae siya, di ba? They cannot use it on breeding. Saka dapat hindi mo naman na-breed dahil meron nga anomaly. Pero sabi niya po, pwede bang pa-stud kasi nag-heat. So, possible kasi magkaroon ng complication dun sa reproductive tract or dun sa urinary system. Pwedeng pumasok yung infection. So, magkakaroon ng is it descending or ascending infection. So, pupunta dun sa So, medyo na-reformat yung So, for type 1 Atresia ani, usually, ina-assess yun. Dahil di ba sabi ko, there's a patent anus, kaya lang stenotic yung end part. So, start mo na nila yung treatment nun sa balloon dilatation. So, si Doc Olive na na niya kung paano yung balloon dilatation. So, meron siyang butas naman, kaya lang magkaroon lang ng stricture doon. So, we use poly catheter. So, insert mo yon, tapos lalagyan mo ng hangin. Ang kunan is parang, kunyari ito yung butas. So, nilagay dito, ibubuka niya yung masikip na butas doon. So, parang papangawitin mo yon. So, i-ano mo ng mga ilang oras, tapos tanggalin, ulitin mo ulit, tapos hanggang sa masanay yung stenotic part na yon na lumaki yung butas. So, yung balloon dilatation, ginagamit din kasi yon pagka nag-PPU kayo na nagkaroon ng stricture. So, insert nyo yung balloon, yung polycatheter, then, yan. Okay? So, for the patient preparation, so ito na si Kipi. So, the perineal area was aseptically prepared. So, anesthesia, premedicated, and anesthetized with appropriate protocols. So, nagbigay kami ng atropine sulfate at 0.044 mg per kilogram, then tiletamine sulacipam at 7 mg per kilogram as induction. And maintenance, for the maintenance, is 1% isoflurane. So, the surgical procedure very easy lang yung surgical procedure ng ano. So, positioning is ventral recumbency. And usually naglalagay kami doon sa caudal part ng towel para lang ma-elevate yung caudal part. So, for the easy view during surgery. Then, a cruciate incision was made around the anal dimple. Pero kung meron kayong electroscalpel blade, better na yun yung gamitin nyo. So, mas mabilis kasing maggawa ng elliptical incision or circular incision. Kaya lang, inano ko yung cruciate incision, kunyari wala kayong yung electroscalpel. Ako kasi pagka nahirapan ako magawa ng elliptical incision, nagiging serrated yung part pagka iniwa mong gano'n, tapos then yung sumunod, hindi na magkatapat. So, I found this much yung better kung nagagawa ka ng elliptical incision. So, yung triangular flap, ikakat mo lang para makapag-create ka ng elliptical incision. Then, blunt and sharp dissection to expose the rectal blind pouch. Since this case is type 2, madali lang na-locate yung rectal pouch. Ay, nawala. Ayan. So, yung rectal pouch was identified and dissected free from surrounding tissue. Kasi kailangan mong i-mobilize yung rectal pouch para mahila mo. Then, identification of fistula. Since yung case ko is yung fistulous tract is big enough that you can insert hemostat forceps. So, when I inserted the hemostat forceps, then that is the guide when you for identifying the rectal pouch. Next is incision of the rectal pouch. Before incising the rectal pouch, naglagay muna ako ng stay suture dun sa 12 o'clock position. This is just to prevent na wag bumalik o mahila yung ano. So, naglagay muna ako doon. Then, once na you incise the rectal pouch, yung mga fecal debris magsisimula ng lumabas. So, you need to evacuate all the fecal matter doon sa part na yon hanggang wala ka na makikita. Kasi ang hirap magtahi na may lumalabas na poop. So, mako-contaminate lang lalo yung area. So, for the fistula closure, so ligation and suturing of the fistula to prevent recurrence. So, ang ginawa ko dito is, from dun sa fistula, kung mapapansin nyo, ayaw na mag-zoom, no? Ayan. So, dun sa may second figure, kinat ko yung fistula. So, when you incise the rectal pouch, dapat hanggang doon na sa may edge ng fistula. So, kailangan mo i-ligate yun, tapos yung incision up to yung doon sa may butas sa fistula. Para pag itinahi mo yung edge ng rectal pouch doon sa skin, na-close na din wala ng fistula doon. So, pati yung sa may connection doon sa vagina, matatakpan. So, rectal lumen was retracted. So, At that time, we used the 4O polyglactin synthetic absorbable suture. So, simple interrupted lang, starting at the 12 o'clock position, 3, 6, and 9. So, for the post-operative care, yung antibiotics, coamoxiclav, at 13.75 milligram per kilogram. So, yung analgesics, for 3 days, gumamit kami ng meloxicam. Para to avoid the straining, we use stool softener, lactulose at 0.5 ml per kilogram for 5 days. And para ma-normalize yung kanang intestine, so we use gastrokinetics at 0.4 milligram per kilogram. So we advise the owner also to watch the diet and daily perineal hygiene. So dun sa post-surgical result, kitten successfully defecate through the new anal opening, no fecal material passing through the vulva, and normal defecation patterns and complete healing within 2 weeks. So let us have some review of some of related literature. So the gold standard in diagnosing this for the typing of the atresia is vaginography. So usually kailangan yung contrast vaginography para you can easily identify ano bang type tong i-deal ko. Kasi kung type 4 yon, medyo mahirapan ka kasi malayo. Mamaya nasa abdominal part na o dun sa end ng pelvic region. And pwede rin gamitin yung CT scan. So in one study na ginawa sa Korea, so nag-CT scan sila. So medyo mas detailed yung kanilang image. So this one is type 3 atresia with rectovaginal fistula. But kahit na CT scan yung ginamit nila, ang problem is during the operation, hindi nila nakita yung fistulous tract dahil sobrang liit daw or limited yung view during surgery. So there are other surgical methods na they put a finger plane syringe para daw ma-minimize yung complication related to tension. So na pwede mag-cause ng wound dehiscence and stenosis. So ito sa Korea din. And before, what they did, for example, nag-open kayo, then sobrang layo nung rectal pouch and meron siyang rectovaginal fistula. They also utilize yung fistulous tract, yung mag-extend nila yung incision up to the vagina, kaya merong episioplasty. So, i-utilize nila tong fistulous tract. So, magpa-flap sila. Yun yung i-susuture doon sa skin. So, parang yung fistulous tract, doon na rin lalabas yung, then, i-close lahat to. So, meron mga complicated case. Katulad nito, meron siyang rectocutaneous fistula. So, etong tawag dito, yung perineal region is nasira dahil doon lumabas yung mga poop. So, what they did is nag-colostomy muna sila sa lateral. Inilagay yung para lang temporary excretion ng feces. So, ito nakatahi doon sa lateral side. Then, nung okay na yung perineal region, another operation was performed. Nagkaroon sila ng colonic anastomosis and anoplasty. So, laking hirap nung patient, ano? So, ito yung treatment algorithm na sinasabi ko. Pagka type 1 siya, so magkakaroon ng balloon dilatation. Pagka effective, so okay na yon. But, kung nag-balloon dilatation ka na tapos nagkakaroon ng recurrence, then do the anoplasty. For type 2 and type 3, diretso sa anoplasty. But if there are some complication katulad ng colonic distension and megacolon, then you need to correct the colonic distension and megacolon. For type 2, 3 with rectovaginal fistula, so anoplasty and fistula excision. So dun sa breed predisposition, laging natanong. Okay. Sabi ko nga, dahil rare to, dun sa mga study, inconclusive pa rin yung mga data. So, hindi mo masasabing dahil doon is mataas yung case sa Persian or dun sa domestic short hair. So, meron ng predisposition. So, until now, continuous pa rin yung kanilang study para ma-establish yung data. Okay, that's all. Thank you very much for listening.
Wow! Thank you so much, Doc Joey. Atresia-ani is really a rare case, Doc, but we are having common cases in our practice, and actually with your presentation now, at least we got some more insights how we manage more proper and also new knowledge from what you presented. So we do have some questions here, Doc. First question, is there a breed or species predilection of Atresia-ani?
Sakto po yung last slide is for the breed predisposition, yun po, hindi pa establish yung mga data regarding that. But dun sa retrospective study na yun, dun sa 192 cats with Atresia-ani, karamihan dun is Persian. Kaya lang, they said that it is still inconclusive kasi konti lang yung numbers ng animal. It will not represent the So wala pa po. Kaya lang po yung for example yung I don't know how to pronounce the Manx cat dahil meron silang dun sa lumbar, meron silang problema dun sa spinal cord. It is open that parang lagi na lang siya associated na pagka nagkaroon ng problem yon, parang complication na lang yung Atresia-ani.
But between dogs and cats, more common in cats, is it?
Dogs.
For dogs. All right. Thank you so much, Doc. What is the possible cause of embryological or congenital defect that leads to this kind of case, Atresia-ani?
Ayun po, during the organogenesis dun sa cloaca, pagka nagkaroon ng disruption dun sa yung cloaca and the urorectal septum, the urorectal septum fails to grow caudally, and then it may lead to fistulous tract or Atresia-ani.
Okay. And another question, Doc. What is the maximum age ng cat na pwedeng hindi i-surgery with rectovaginal fistula? Pag hindi ito sinurgery, what is the possible lifespan?
It depends on the assessment. For example, naglitawan na yung sign na yung binanggit ko kanina, meron na siyang bloating. So that needs for emergency surgery. But if the cats show no sign of, for example, bloating and other complication, katulad nung sa aso kayo na hanggang ngayon, up to now, buhay pa siya. So, kasi one of the reason lang naman doon is dapat normally makapag-defecate yung animals. So, pagka magkakaroon ng continuous yung defecation at hindi magkakaroon ng complication, so, mabubuhay ng maayos yung cat. Kaya lang, later on, possible na magkaroon ng complication sa urinary system or reproductive system.
Yes. Okay. In Atresia ani types 2, 3, and 4, and the fistula, how do you remove the fecal matter before surgery to reduce wound contamination?
So, for type 2, 3, and 4 with rectovaginal fistula, usually they insert a catheter in the fistulous tract, then just like the ordinary yung enema, so doon nila pinadat.
Okay. Thank you, Doc. And another question, why did you use gastrokinetic after the surgery? Hindi po ba mas mag-straining ang patient?
Usually, sa mga reference naman and sa literature, ginagamit yung gastrokinetics just to normalize yung normal tone ng intestine. Hindi siya mag-strain kasi meron din siyang stools opener. So pagka nag-contract yun, tapos meron din naman siyang tawag dito, yung analgesic. So wala po naging problema doon kasi ang pagbibigay lang ng gastrokinetic is to parang atone the normal movement of the intestine.
All right, Doc. Thank you. And what is the best way to prevent closing of the new rectal opening?
For the closing and stricture. Dun sa isang reference, dun sa Korea, so naglagay sila ng syringe plunger. But pagka maayos naman yung pagka-surgery mo, well-placed yung mucosa dun sa skin, so far wala namang ng stricture. So kung magkaroon man ng stricture, so you need to monitor kasi for 7 days hanggang mag-normalize yung defecation. So kung merong stricture doon, then you do the balloon dilatation na lang para mag-open uli yung rectum.
Okay, by balloon dilatation. Okay, Doc. Another question from online. Doc, how did you convince the owner to go through this surgery? Since this procedure is somehow risky because of the age of the patient.
So, nag-start na kasing mag-show ng sign yung cats. So, napansin nung owner na rant na nga yung then nagkakaroon ng dyschezia. So, difficulty pa lang sa defecation. Pero once na magkaroon na ng tenesmus and nagkaroon ng tawag dito, bloating and other yung gas distension, yun yung sinabi ko na tuloy-tuloy na yan, napapunta na doon. So kasi meron ng meron na siyang dyschezia, tapos unti-unti meron ng fecal accumulation doon. So parang may financial constraint lang yung owner kasi nag-refuse siyang ipa-x-ray. So kung papa-x-ray yun, possible na meron ng constipation yung hayop. So in-explain na lang naman kasi napapalpate naman doon na meron ng mga hard fecal matter on that part. So sabi ko, pag hindi sinergery ito, then magpa-progress yung ibang complication.
Okay, Doc. In relation with that question, Doc, regarding the owner, how do you deal with some pet owner who refuse to do surgery despite surgical recommendation? And what is your next recommendation then? Is euthanasia an option?
For those client na they refuse to do the surgery, in-explain ko lahat nung possible outcome na pwedeng mangyari doon sa hayop. So, from that time na nag-progress na yung worst outcome at ayaw yung pa-opera, so yung surgery kasi baka late na rin. Ang mangyayari doon is yung hayop is mauwi na lang sa so magiging painful yung kanyang yung mga susunod na scenario. For euthanasia kasi I seldom recommended euthanasia not unless na yung tawag dito yung sobrang ano na nung hayop. Ako sa clinic meron kami mga euthanasia pero all my vets are doing that. Pero personally, ako, yung mawain kasi marami akong alagang hayop. So, last option yung euthanasia.
Yeah, last resort. And we always really wanted to see the quality of life of our
Yes.
patient. So, yes, Doc. Another question. Have you ever heard of the case where the fistula is reversed, wherein the anus is present, but the vagina opening is missing?
I have not yet encountered that. Usually, meron tinatawag na persistent cloaca. Yun. All the openings are directed into one opening, but in the vagina. But for the anus and the vagina is closed,
Haven't done
haven't done.
Okay. Doc, question po. Hindi po ba mas favorable ang presence na vaginal fistula since nalilesen po ang build-up ng feces sa colon? Therefore, you can delay the surgery so the patient will be big and old enough for the procedure as compared to po sa absence ng fistula na wala po talagang lalabasan ang feces and would cause chronic megacolon po?
As I mentioned dun sa presentation, it depends on your assessment. Pagka naglitawan na kasi yung complication, that needs for emergency surgery. And kung wala namang complication, pwede mo extend yung up to the time na magkaroon na ng edad yung hayop.
Okay.
Depende pa rin po sa assessment.
Yeah, thank you so much, Doc Joey. That will be our last question. All right. Let's go to our second presenter. And our second presenter for today will be introduced by my partner, Doc Chris Lau.
Dr. Maria Lavinia Perez is a general practitioner with over 15 years of experience in small animal practice. A graduate of Aklan State University, School of Veterinary Medicine in 2009, she passed the veterinary licensure examination the same year. Dr. Perez began her career in Metro Manila, working at an animal hospital for almost 4 years where she gained valuable experience. In 2013, she returned to Iloilo and co-founded a veterinary clinic with her college friends. By 2018, she established South Tales Veterinary Clinic, Inc. in partnership with her partner and her brother. Dr. Perez is dedicated to the well-being of her patients, continuously updating her knowledge through local and international workshops and conferences. As a speaker and mentor, she shares her expertise with veterinary students and junior colleagues, fostering a collaborative environment for professional growth. Her passion for veterinary surgery gathered to join the Philippine College of Veterinary Surgeons companion animal as an associate member. Outside of her work, she is a loving fur mom to Chicken, her Lhasa Apso, and Nix, her adopted black cat. Please welcome Dr. Maria Lavinia Perez.
Good morning, everyone. So, before I start my presentation, I would like to thank PCCP for allowing me today to discuss my clinical case together with my batchmates. And I'll be discussing a challenging but rewarding case involving a 7-year-old female mixed breed dog, which was diagnosed with an extrahepatic biliary obstruction. So this presentation will walk you through the diagnostic journey, the surgical decision-making, and outcome of this rare but complex condition. Let's begin. So this is my title for this morning. So resolving the blockage, cervical intervention for extrahepatic biliary obstruction in a 7-year-old female mixed breed dog. So let's begin by understanding what extrahepatic biliary obstruction is and why timely surgical intervention is crucial for affected patients. So, so extrahepatic biliary obstruction, so by the name itself, so this disease involves the biliary system. So, as a quick review of our normal anatomy of the extrahepatic biliary system, so we have 4. So we have the hepatic ducts. So this connects the liver to our gallbladder. And then we have the common bile ducts. So this connects the gallbladder to our small intestines, particularly in the duodenum of our patient. And then the next part of the gallbladder or the biliary system is the cystic duct. So the cystic duct connects the neck of the gallbladder to the common bile duct. And then the most important part of the organ is the gallbladder. So so the gallbladder also has 3 parts. So we have the fundus, this is the most distal part. And we have the body and the neck. So wala lang yung body. Okay, so the normal or medium-sized breed of dogs can accommodate approximately 15 ml of bile. So just imagine if it's smaller, so it may just contain less than 10 ml of bile. Okay, so for extrahepatic biliary obstruction, so So it is caused by 2 major factors. So it's either caused by intraluminal common bile duct diseases or extraluminal compression. So in dogs, extraluminal compression is the most common cause of EHBO. So we have here the following diseases that can cause the extraluminal obstruction, such as pancreatitis, neoplasia or the pancreatic cancer or liver cancer, diaphragmatic hernia, and congenital abnormalities. So due to the close anatomic relationship of the pancreas to the common bile duct, so pancreatitis actually is the most common cause of EHBO in dogs. So on the other hand, the other cause is the intraluminal pathology or the intraluminal obstruction. So this is the least common, but it includes the following. So we have the cholelithiasis or the gallbladder stones, the cholelithiasis or the common bile duct stones or the stones found in the common bile duct. So this is one of the cause of the blockage. And then biliary sludge or inspissated bile, and tumor. So my discussion for today actually will be focusing on this type of obstruction, the biliary sludge or the intraluminal obstruction. So this is a rare case, but yeah, unfortunately, na-encounter namin siya sa clinic. So this is honestly my first patient. My first patient that time. Yeah, this case was diagnosed 2021. So actually, this is the case of my junior vet that time. And then I was the one who did the surgical procedure. We were the one. So she's my assistant surgeon and I am the lead surgeon. Okay, and then for the common clinical signs of EHBO or extrahepatic biliary obstruction, we have the following. So there's lethargy, there's vomiting, there's fever, and then there's anorexia, and there's rapid development of ecterus. So as you can see, these signs are all non-specific. So you can observe these signs in numerous abdominal conditions or diseases. So we have a wide array. So kung i-enumerate natin lahat, so baka matapos na yung time ko. So anyway, so we'll just go through with my presentation. So yung point lang naman dito is, hindi tayo matatapos sa common clinical signs. So hindi pwedeng, Doc, ano na yung next, ano na yung gamot? So ma'am, wait lang po. So we have to investigate further. We have to do some diagnostic tests to confirm if what's causing the jaundice, what's causing the lethargy, the vomiting of the patient. So especially this one. So we have to concentrate with the rapid development of ecterus. Okay, and then, yun. So as a clinician, so I have a question. Ako muna yung magtatanong bago nyo ako gisahin. So how do you approach an ecteric patient during physical examination? Ano yung ginagawa natin first? Unahin ko si Doc Paul. Doc Paul, ano yung ginagawa mo kapag ecteric yung patient? 10 daw yung tanong niya eh. Yun. Yes, na ecteric. Okay, yeah. So first, physical exam. So we have to really, check our patient if lahat ba merong ecterus, kasi baka mamaya isang part lang yung gums lang pala. So mamaya dumi lang or something. So you have to check all the mucous membranes, the white part of the body, especially the sclera, the inner pinna, so the abdominal area. So you have to check all those things. So to dig further, so this is your clinical approach. So you have to check, you have to, tama naman si Doc Paul, so physical examination. So may libre kang, Doc, siomai. So, yeah, so we have to check, we have to do thorough history taking. So we have to check the patients thoroughly. We have to do physical examination properly from head to head to tail. And then we have to do recommend laboratory tests to check our patients, so especially the CBC and the blood chemistry. And then imaging, if that is available, or if you doesn't have any imaging machines, you can refer to the nearest veterinary clinic that is capable to do the imaging. And then the specific advanced testing. So let's dive further with those things that I have mentioned. So for the history taking, you need to check, or you need to ask your client the onset and the duration of ecterus. So you have to check kung kailan lang. So lagi tayo, di ba, nagtatanong sa clients natin, ma'am, kailan lang to? Tapos sagutin tayo, kahapon lang yan, Doc, pero dilaw na sila. So, ayun. So we have to check kung acute ba siya or chronic ba siya, kung days na siya, weeks, or months na siyang naninilaw. So you have to check those things kasi it will give you, or it will give you an idea kung tawag dito, it will narrow down your differential diagnosis along the way. And then the other one is you have to check the appetite, if there's vomiting, lethargy, and weight loss. So the diet is also significant. So you have to check it upon history taking. Kasi marami tayong patients, especially dito sa Pilipinas or sa Iloilo, particularly sa amin, marami pa rin talaga yung nagbibigay ng table food. So diet is really very important in this particular case. So you have to check also, or you have to ask them if they have noticed the color of the urine of their patient. And then you have to check kasi kung masyadong dark or dark yellow yung urine, pwedeng nag-indicate na siya ng bilirubinuria. So the other one is you have to check for the color of the feces of your patient. So tanungin nyo na lang din, so anong kulay po? So bahala na kung bigyan ka nila ng picture or image na yon. Mahilig naman tayo sa mga gross na mga bagay yung mga veterinaryo. So magpakitaan na ng picture. So that is very common, and we do appreciate those clients na nagbibigay ng picture. So minsan kahit may mga hindi na dapat nakikita natin. So yon, ito kapag they have if you can suspect if the patient has an acolic feces or white feces, so wala na siyang kulay. So yan, you may consider the obstructive case. So exposure to toxin. So maraming patients tayo na toxicity pala yung isang cause din ng kanilang pagkaroon ng jaundice. So especially example with the xylitol, zinc, sagupam. And then for the medication and supplements, you have to ask them also what's they're giving at home. Alam naman nating lahat na yung mga for parents minsan sobrang love nila yung patient nila. Minsan they tend to do home medication. So yung mga tawag dito, they before going to the veterinarian, itatry din muna nila. So minsan may mga medications pala na bawal. So like paracetamol toxicity, it's really common in our practice. So may mga cases talaga na, Doc, binigyan ko na ng biogesic kasi nilalagnat. Yon. Okay, so for the travel history, so you have to check, and then the environment of the client, of the owner. So tatanong natin kung marami mang daga, if you are suspecting for leptospirosis, so tingnan din natin. Kasi lalo na sa mga urban area, so marami talagang cases ng ganyan. So you have to check on that. So the vaccination, deworming, and other preventatives must be checked as well. So para ma-rule out din natin yung mga possible viral diseases and other tick-borne diseases or parasite-related diseases na nagkukos ng ecterus or jaundice. Okay, for the physical examination, so as mentioned by Doc Paul, so you have to check thoroughly your patients, kung merong yellowing na yung membrane, yung sclera, yung inner pinna ng ears, and then you have to check also the hydration status of your patient. Yun, kasi kung may dehydration na and everything, so at least you can recommend kung baka kailangan ng i-rehydrate. And then we have to check as well, so abdominal palpation, so hindi lang tingin-tingin, hawak-hawak din. So, yeah, so we have to palpate the abdomen. So if you're suspecting for hepatobiliary disease, you have to palpate the liver size, if there's pain upon palpation, and then if there's a certain mass that is not, that should not be there. So ma-feel nyo yun sa palpation. So, but of course, it needs skills also, and you have to do it more, we have to practice it more often, especially if during physical exam, kasi paano natin ma-differentiate yung normal sa abnormal, so kaya yun. And then, petechiation or ecchymosis, you have to check also kasi kung may mga hemolysis, this is really very common. So, nagkakaroon ng petechial hemorrhages yung skin, especially yung mga thin part ng body ng patient, yung mga abdominal area, you have to check on those signs. So, of course, you have to check also if the patient is pale or has an ecteric mucous membrane, so it may suggest an anemia. So for the laboratory test, you have to check, these are the tests that you need, that you want to recommend to your patient. So you may recommend this one. So if hindi available lahat, so actually sa amin hindi naman to available lahat. So we just primarily do actually yung first two muna, yung CBC to check for anemia, signs of hemolysis or inflammation. And you have to check as well for the serum biochemistry profile to evaluate the liver function of your patient. So especially the ALT, the ALP, the GGT, and the albumin and cholesterol levels. So for the urinalysis, you want to check if there's bilirubinuria, and then there's bilirubin crystals, the specific gravity of your patients, and the hematuria. So the COMS test and the bile acid test, so this is just based on the on my references, pero hindi pa namin to talaga din nagagawa. So I don't know kung meron na ba dito ang nagko-COMS test? Wala pa. Or yung sa bile acids. Parang meron na yung mga bagong machines, pero sa amin hindi pa nga dumadating yung ano namin. Okay, so for the imaging, so the next one that you can recommend, so after analyzing all the tests and everything, you may also consider imaging kasi hindi naman lahat napapalpate, so hindi siya makikita by our naked eye. So kailangan natin ng aid ng mga machines to check on our patients further. So may check, evaluate the liver size of your patient and the texture, check the gallbladder for any sludge, for any stones or biliary mucocele. You may check if the common bile duct is dilated, the pancreas, lymph nodes, masses, and the free fluid or peritonitis. So with the thoracic radiograph, you may also consider this one if you're suspecting for cancerous or neoplasia from your patient. So for the specific or advanced testing, so you may check as well kasi lalo na kung nakakita tayo ng patient na ecteric, di ba, commonly talaga i-include natin yung, baka leptospirosis. So you may consider also doing serology or PCR if you have. So unfortunately, wala pa kami. So sana i-sponsor kami. So tapos yung FNA or biopsy of liver or lymph nodes, and then exploratory laparotomy or biliary contrast studies. So if EHBO is suspected and imaging is inconclusive. So itong sa exploratory laparotomy and contrast studies, sa contrast studies pala I mean, so this is very common na in human. So yun yung ERCP. So they insert something to check if may mga blockages doon. So it's an minimally invasive na diagnostic procedure na ginagawa, especially sa may mga suspect ng pancreatitis. So ginagawa na siya. So sa atin, parang unfortunately, parang hindi pa talaga ganun ka-common. Okay, and then for the ecterus, so yun, after checking all those things that I have mentioned, so we have to determine or to check if the ecterus kung saan nanggagaling. So yung mga bagay o yung mga things na diniscuss ko from the previous slides will help us dig further if the ecterus kung saan nga talaga siya nanggagaling. So we have 3 categories. So we have to answer the key question kung saan siya. So if it's prehepatic or hemolytic lang siya or through rapid distraction lang ba siya ng RBCs due to some infections, toxins, so yon. And then hepatic or intrahepatic, so the liver primarily is affected. So kung meron siyang direct insult sa liver, especially yung leptospirosis, toxins pwede pa rin, and then yung infectious canine hepatitis pwede din, and yung mga liver tumor. And then the last one, the post-hepatic ecterus or the post-hepatic jaundice. So yeah, dito tayo actually mag-concentrate kasi ito po yung aking tawag dito pinaka-topic for today. So yan, to help us to help us categorize the ecterus. So hindi lang siya masyadong clear, but I can give you the clear copy, pero nandyan din lang siya sa Google. So yon. So we have to determine kung prehepatic, intrahepatic siya or posthepatic. So, yung natin dito, pinaka-guide talaga is, we will do talaga muna yung pinaka-basic na test. So, we have to do CBC. So, yung CBC, it will give us an initial, assessment or initial, initial idea kung ano yung nangyayari. So, based on the related studies, so yung RBC, once nakita mo daw yung hematocrit na it's less than 20%, meaning to say the anemia of your patient is already severe, and then there's already a regenerative anemia or RBC regeneration, and there's normal or mildly increased liver enzymes, so you may consider your case as a prehepatic ecterus. So you have to dig further yung mga possible cause ng prehepatic ecterus, such as yung mga immune-mediated hemolytic anemia, yung oxidant-induced or toxin-induced, and yung mga infections including yung mga babisya, so they tend to destroy the red blood cells of our patient, and RBC defects, so may mga congenital anomalies yung RBC. So Yung dito na side, yung sa may tawag dito yung prehepatic ecterus, so they can be managed by giving medications. So for immune-mediated hemolytic anemia, you may give some immunosuppressants. So antimicrobial or antibiotics for infectious diseases, and also antioxidants for the oxidant-induced jaundice. So on the other hand, we have to also to discuss this one. Ito, so for the extrahepatic and intrahepatic jaundice, you have to check if your patient has a mild anemia. So yung pinaka-marker lang natin dito is yung hematocrit. So if the hematocrit is more than 20%, so meaning there's a mild anemia or no anemia at all. So parang kumbaga normal pa yung hematocrit level ng patient, and then may moderate to severely increased na liver or hepatobiliary enzymes. So pwede ka nang mag-suspect. Before that, you may undergo imaging. So a while ago, we have discussed that already. So if may mga suspicion ka na may abnormality yung mga bile ducts and the gallbladder, so you may consider already a post-hepatic ecterus. So kung normal naman, so pwede siya talagang intrahepatic or nasa liver yung problem natin. So, okay. So the main goals of surgery are to confirm the underlying disease process, establish a patent biliary system, and minimize perioperative complications. So for the objectives, we have to determine the cause of the EHBO or extrahepatic biliary obstruction. So to describe the importance of serum biochemistry monitoring in correlation with clinical signs and findings of the exploratory laparotomy to have a definitive diagnosis. And third, to evaluate the efficacy of cholecystotomy, supportive medications, and dietary management for your patients with EHBO. So this is the case. So this is Torbo. She's a 7-year-old intact female mixed breed dog. So she was brought to us and for a second opinion. And the following complaints was given to us by owner or was relayed to us by owner. She's having lethargy at home. She's anorexic. She has intermittent vomiting, and generalized ecterus was observed by the owner. So upon history checking, the patient has been vomiting already and has lethargy for a couple of days, and she was checked and was treated already as hepatic disease from previous veterinarian prior coming to our clinic. So that's approximately 4 days, but according to the owner, the condition has no improvement. So kaya sila nag-second opinion. So the diet of the patient is table food mixed with dog food, and the vaccinations and other preventatives were updated, and no history of trauma or toxin exposure was mentioned by owner upon history taking. So during the physical examination, so generally, if you can see, the body weight of the patient is 2.3 kilograms. So Torbo, by the way, is a mix of Chihuahua and Mini Pinscher. So cute talaga siya. So maliit lang siya. So, but unfortunately, her body condition score is already 3/9 kasi nga few days na talaga siyang nagkakasakit. And then the capillary refill time is more than 3 seconds. So it indicates dehydration or anemia, and mucous membrane is pale and dicteric. And then the temperature is 39.5, so it's already high normal or pa-fever na siya. And then the dehydration is 5%. So after taking the history and having the physical examination, since the owner was not able to provide the previous tests, so medyo nangarag na si owner, so we just started instead. So usually sa clinic namin, even meron ng results, lalo na kung medyo parang hindi siya, tawag dito, parang hindi siya reliable ba? So, hindi. Marami na kasi ngayon. So, aminin natin, marami na talagang machine. So, may mga cases talaga na we do recommend kung kaya naman ng owner na i-repeat para lang meron tayong baseline sa ating diagnosis. Kasi second opinion na nga ito. So, hindi naman pwedeng papalpak pa tayo. at competitive tayo. Char, hindi. So, yun. So, yung complete blood count ng patient, pinapatawa ko lang kayo, parang inaantok na kayo. May free coffee po sa likod. So, yung complete blood count ng patient, so ito yun, yung day 0, so September 6, 2021 yun. So, we have here hematocrit and hemoglobin of the patient. So, as you can see, mild pa yung anemia niya, so 26.6%, and then the hemoglobin is 9.1, so compared with the normal values. So the leukocytosis and granulocytosis is also noted, so medyo mataas na po noon, and then the platelet is 128. So this time, we have recommended to do the screening for blood parasites since may anemia nga, may infection na, and then mababa pa yung platelet. But the owner refused to do the blood parasite screening. So, hindi ko na lang siyang muna pinilit kasi parang mas gusto ko yung blood chem over the blood parasite screening. So, ginaw natin, and then we do the blood chemistry. So, these are the results. So, yun. So the patient's blood chemistry, so as you can see, meron tayong, highlight ko lang dito yung ALT, ALKP, GGT, and total bilirubin, but if you can observe, there's hypocalcemia and there's hypoalbuminemia. So commonly, hypocalcemia and hypoalbuminemia is related also to liver disease. So since, di ba, yung liver, siya yung isa sa nag-help din sa absorption ng yung, nawala ako. Dito muna tayo sa ALT. So, yung ALT, ALKP, GGT, and total bilirubin. So, as you can see here, the ALKP is really extremely elevated. So, masyado siyang, mataas from the normal. So, from 212 na high normal values, nag-1,804 siya. So, it's almost 8-fold from the normal. And then the GGT from 0 to 11 na normal, tumaas siya ng 30. And then the total bilirubin is 5.5. So definitely, yun nga, mataas talaga yung bilirubin kasi naninilaw na yung ating pasyente. So the ALT here is just mildly elevated. And then, yun naalala ko na, yung sa calcium. So nagkakaroon ng hypocalcemia yung mga pasyente na merong hepatobiliary disease because yun nga, hindi na masyadong nagkakaroon ng absorption yung intestines dahil nga nagkakaroon sila ng mga biliary obstruction. So, kailangan natin ng bile for proper absorption, especially yung mga certain nutrients and minerals, and especially yung calcium. So, yun. And then, yung sa albumin din, so the liver is the one who synthesize or yun, nagsisecrete ng albumin. And then, the other one. So, after having the blood chemistry profile of the patient, so we recommended imaging. So, para ma-check lang further kung ano yung nangyayari sa loob. And then, we have to, since meron ngang hepatobiliary enzyme increased na yung patient, so primarily, nagsususpect na tayo that there's really something wrong within the liver and the gallbladder. So, that time, 2021, we don't have an ultrasound machine yet in our clinic. So fortunately, ngayon meron na. So that time, we just referred the abdominal ultrasonography. And the results came out inconclusive for any abnormality in the abdominal organs. So wala silang may nakita. So in short, medyo sumakit yung ulo natin. Kasi walang nakita. So, yun lang yung sa atin, no? Kasi we are happy kung merong abnormality, pero pag wala, poproblemahin na natin yun. So, we have to dig further and we have to correlate. We have to go back to our clinical science and our laboratory test to help us with our diagnosis. So, yun. Meron tayong out of those results, we have the following differential diagnosis. So, immune-mediated hemolytic anemia. So, pwede pa rin natin siya i-consider. And then vector-borne diseases, since hindi natin siya na-rule out sa first kasi yun nga, hindi pa nagpumayag si owner, so dyan muna siya. Leptospirosis, extrahepatic biliary disease, and pyometra. So remember, Torbo is an intact female dog, so she's already 7 years old, and alam naman natin na 4 years and up or 5 years and up na intact na female patient, they tend to have mga pyometra or infection sa uterus. So nilagay natin siya plus yung elevated niya na white blood cell count as well. So though negative siya sa ultrasound, no? So pero yan, for the sake, char. Hindi, next. So, for the initial medication, so ito yung ating unang binigay. So, we rehydrate the patient because the patient was initially dehydrated siya. And then, we gave antibiotics, hematinics, B-complex since the patient is already anemic, and we give liver tonics and hepatoprotectants and H2 blocker. So after 2 days or 1 to 2 days of observation, so medyo nag-improve konti. So quiet lang si patient, pero hindi na siya ganun ka-lethargic. So kapag we approach her sa cage or sa cage niya, so medyo alert na siya. And then fortunately, kumain na siya ng konti. So dapat bawal to. So ito, chicken liver, high fat siya, di ba? So we are suspecting for hepatobiliary disease, but for the sake lang na ma-check kung may appetite nga siya. So nag-refuse kasi siya with the prescription diet. So we tried to give hepatic. So we tried, usually when our patient is not eating, we try to offer other options kasi yun nga, minsan meron talaga, lalo na sa part ni Torbo, kumakain siya ng table food at home. So kumain siya pero yun, medyo fair lang. And then no vomiting na so far, normal na yung urination and defecation, jaundice is still apparent, and then may slight abdominal distension siya that time. So, after this one, 2 days after hospitalization, we have observed na during physical examination, nakita namin na sobrang putla niya. So, we recommended again to run a CBC just to check kasi yun nga, dahil sa sobrang pale na yung mucous membrane niya, we repeated the CBC. So, the hematocrit of the patient unfortunately fall or nagwent down siya from 26 to 19.9%. So, yun, naging anemic na siya or hindi na mild yung anemia niya. And then the hemoglobin as well, it went down from 9.1 to 6.4. And then if you can see here the RBC count, yung WBC count and the granulocytes, it elevated. So we have already given antibiotics, but the patient is not responding. So 2 things, either hindi nag-work yung antibiotics or baka may iba pa tayong talagang problem na hindi na-address. And then the platelet of the patient, although mababa pa siya, pero umakyat siya ng konti from 128 to 145. So this time, nirecommend na talaga namin yung vector-borne diseases screening. And unfortunately, pero ano lang to, antibody test, so nag-negative naman yung patient. So naputol yung slide ko. So negative siya with blood parasitism, pero yun na nga, as sabi nga ni Doc Reyna, PCR is the gold standard. So hindi natin ito masasabi na 100% negative. Pero yeah, doon na lang muna tayo maniwala. So yun. So for the third day of hospitalization as well, so nag-recommend na lang din kami to check further. So nag-repeat tayo ng blood chemistry niya. So fortunately pumapayag naman si owner kasi we are really, invested with the case kasi second opinion na nga siya. So we have to do monitoring as frequent as possible para makita natin kung nagre-respond ba si patient or not. So as you can see here, the ALKP and the ALKP went down just a little. So despite of giving the medication, so nasa 1,804 siya previously, 1,727 lang siya units per liter. And then the bilirubin, yung GGT hindi talaga siya gumalaho. So from 30 pa rin siya. And the total bilirubin from 5.5 naging 4.6. So ganun pa rin yung calcium and albumin. Consistently mababa pa rin sila. And then for the after this test, at this point, we have modified We have modified the treatment plan of the patient as hepatobiliary disease. So, nag-modify kami. So, these are the medications. So, we give ampicillin, metronidazole to treat both aerobic and anaerobic infections, ursodeoxycholic acid, vitamin E, and some E as antioxidants. And we do blood transfusion na. So, nag-recommend na kami kasi sobrang putla na nga ng pasyente. And then, 3 days post-transfusion, so recently we do 24-hour monitoring of the blood cells, but of the red blood cells of the patient or the hematocrit and hemoglobin. But that time, since the owner is having, parang may financial constraints then, so we do the CBC after 3 days. So the hematocrit has improved already after the blood transfusion from 19.9 to 33.8%, and the hemoglobin from 6.4 naging 11 na siya. So malayo pa sa normal, but yun, at least nag-improve siya. But unfortunately, the white blood cell count and the granulocytes, it went up further. So mas dumoble pa siya from the previous test. And then, dito na kami nag-suspect that the patient, wait lang. So, yung sa blood chemistry, so sa blood chemistry naman, ayun, so mas tumaas pa siya lalo. So, 3rd day post-transfusion, yung ALKP niya and GGT niya especially, sobrang dramatic na talaga yung pag-increase. So, at this point, medyo nag-worry na kami. Excited ito masyado. So, we are already suspecting that the patient is having hepatobiliary obstruction. So the GGT and ALKP, we have to remember that they are cholestatic enzymes. So once there's an obstruction, pwede talaga silang tumaas dramatically. So at this point, we have already talked to the owner. We discussed the plan to open turbo to do an exploratory laparotomy. So we wanted to check on the liver, especially in the gallbladder, if there's any obstruction. So fortunately, pumayag naman sila and we performed the surgery the following day. So ito pala po yung aming anesthesia monitoring sheet and surgical protocol. So 2021 wala pa po kaming tawag dito, digital po na monitoring, pero fortunately meron na ngayon. So pero i-share ko lang po na yon, ito yung ginamit namin. So that time, we just used, wala pa rin kaming gas anesthesia that time. So we just used ang pinagbabawal na technique. Hindi. Yung atropine, azolithiol, and yun na muna. Injectable anesthesia yung ginamit namin. So, during exploratory laparotomy, so, ito yung mga findings natin. So, the hepatic parenchyma is normal, and then the gallbladder has a distension. So upon checking, and then we suspected for pyometra as well, but fortunately the uterus are all normal, and then the rest of the abdominal organs were all normal. So yung next na ginawa natin, we tried to open the gallbladder. So medyo mahirap itong part na ito kasi remember Turbo is just a 2.1 kilogram na dog. Masyado siyang maliit. So medyo nahirapan tayong i-dig or i-view yung kanyang gallbladder, but through the aid of tawag dito, naitawid naman. So we placed muna before incising. This is just a reference photo kasi unfortunately we were not able to take the actual photo. Ang bilis na mga pangyayari. So ito yung stay suture. So to facilitate manipulation and to prevent spillage of the bile to the adjacent organ. So merong dalawa. So yun. So during the cholecystotomy, so we did a small incision. So parang lang din siya, your urinary bladder, o paano mo siya i-approach yung pag-remove ng gallbladder stone, urinary bladder stone. So maggawa tayo ng incision doon sa may between the stay suture. So as reference niyan, dito yung banda. And then the incision was then enlarged with an iris scissor. So dahil sobrang liit nga, so we have to do an incision here using the iris scissor para hindi tayo mag-cause ng more trauma or damage dun sa organ. So upon checking, the biliary sludge was there. So actually, sobrang puno to. So meaning to say, parang almost 100% talaga niya is marami na talagang sludge. And then we removed the sludge and cleaned the gallbladder with the warm saline. And then the gallbladder was then closed with a double layer inverting suture with using 4O monofilament absorbable suture. So ideally, may na-miss out tayo dito. So, dapat, according to some journals, research, and to other surgeons, dapat i-check muna natin yung patency ng common bile duct and the cystic ducts before natin siya i-close. Kasi, Doc, paano naman yun kapag meron palang blockage doon? Unfortunately, sa sobrang liit ng patient, nahirapan talaga kami. So, we just do massive na lang na irrigation talaga and more prayer na wala talagang nagla-lodge doon. So, I really have to be honest kasi yun nga yung na-miss out din natin. So, let's say if prayer works. So, sa next slide, so ito pala, ayan, ito yung actual, pero naka-black and white na po kasi ito, so hindi ko na mabalik siya sa ano. So, this is my assistant holding the stay sutures, yun. Tapos, we try to open up the gallbladder using, yun nga, yung iris scissor, and then we remove all the gallbladder sludge. So, iso-shorten ko na lang kasi I have 5 minutes na lang. So, yung biliary sludge, ito po yun. So, mukha siyang nag-harden ha, pero pag tinouch mo siya, parang siyang sand-like talaga. Yun. So, may picture ako sa next slide. So, yun nga, through the exploratory laparotomy, we have determined our definitive diagnosis, which is extrahepatic biliary disease nga yung case due to biliary sludge and cholecystitis. So, during post-surgery observation, we have observed that the patient's appetite has improved. She is already more alert and responsive, and milder jaundice was noticed. And she was discharged 2 days after her surgery. So, remember, more than a week na si Torbo sa amin. So, since we observed na malakas naman na siya and okay na din yung appetite niya, so discharge na siya namin with take-home medications. So, we gave amoxiclav, metronidazole, SAM-E, and pinakontinue lang namin yung orthodeoxycholic acid just to increase the fluidity of the bile and low-fat diet as well. So, check up na lang siya namin after 2 weeks and for repeat blood chemistry. So, pero sa mga cases na ito, parang yun, mas maganda siguro kung mas earlier, like a week after yung follow-up, no, para ma-check natin. So, 2 weeks after surgery, ito na siya. So, as you can see, this is the incision site. So, medyo mahaba siya. Medyo milder na yung kanyang jaundice. And then, ito lang po yung i-highlight ko dito sa presentation na the biochemistry profile, the improvement from the pre-surgery and post-surgery, so especially with the ALKP. So, from 1,767 pre-surgery, it went down to 439 almost 2 weeks later, and it went down a little pa sa 266. So, hindi pa siya normal, pero at least, di ba, hindi na siya 8-fold. And then, the GGT as well, ito yung pinakamasaya kasi from 48, naging 5 na siya. So, normal na. And then, the ALT, ito lang, merong regenerative, possibly dito sa liver kasi yun nga, nagre-recover pa yung patient natin from the infection. So, update from the client. So, unfortunately, the patient was not able to come back na kasi nag-abroad yung kliyente na to. So, nagpapadala lang yung family nila ng video. So, ito na si Torbo 2 months after the surgery. So, she's more playful na. So, she's the black and white one. And then, nagpe-play na siya with the other dogs at home. So, this is really important kasi kung hindi na nakakapunta yung client natin, we have to have an extra effort to, ask them, kumustahin natin sila kung kamusta sila sa bahay para mag-gauge din natin kung tama ba yung mga pinagagawa natin, ma-assess natin yung mga sarili natin if we're doing the right thing. Okay? And then, the other one, so 10 months post-surgery, ito na siya, hindi pa rin sila nakabalik. So, tingin ko, nahirapan talaga si ma'am sa kanilang bills and everything. So, yun, hindi na sila bumalik. So, pero nagko-communicate kami. So, meron silang other dogs, marami kaming patients, even Doc O, she handles the other patients of the owner. So, yun, nag-ano lang kami online, ko-communicate kasi abroad siya and then yung family lang yung nagdadala. So, yun, happy dog na ulit si Torbo, and then, ito po, 3 years post-surgery, just recently this year, okay po, tawag dito, bumalik na siya. So, actually, hindi siya bumalik. Para lang ma-check ko siya ulit, I try to communicate with the owner. Sabi ko sa owner, ma'am, ililibre ko na yung test para bumalik lang sila. So, ito po yun. So, fortunately, I am happy to share na Yun, normal na yung ALT, ALKP, GGT, and total bilirubin ng patient. And eto na po siya. Yun, medyo haggard lang si doktora dyan, pero happy na rin si Torbo at happy na rin yung veterinaryo. So, yun. And then for the discussion, so I have to make it fast na lang to wrap this up. So, abnormalities in laboratory tests are common in patients with EHBO. So, this include leukocytosis, hyperbilirubinemia, increased ALP, increased ALT, and increased GGT. So, these were all noted in Torbo's test. So the clinician should keep in mind, while increased liver enzymes values are common in cases of EHBO, they are not specific for biliary obstruction. So further diagnostic test procedure must be performed, such as ultrasound or exploratory laparotomy. So balikan lang natin very quick yung algorithmic approach natin for Torbo's case. So yun, based dun sa kay Scherding na algorithm, so dito na lang tayo mag-concentrate. So yun, what if walang abnormal, inconclusive yung findings ng ultrasound. So, hindi naman pwedeng magsa-stop na lang tayo doon. But, yun, we have to dig further. So, correlating all the clinical signs and the all laboratory test results. So, we did exploratory laparotomy and we have checked the presence of, 75% to 100% gallbladder sludge. And then, na-confirm natin yung extrahepatic cholestasis and nakapagawa tayo ng surgical interventions such as cholecystomy or removal of the biliary sludge or the severe biliary sludge. So, ExploLab is a crucial diagnostic procedure for identifying the underlying cause of EHBO, particularly when ultrasonography results are inconclusive as observed in Torbo's case. So, intraluminal obstruction, though less common, can result from cholelithiasis and common bile duct stones or biliary sludge, according to Miller and Bennett. And in Torbo's case, biliary sludge confirmed the diagnosis of HBO. So for the ultrasonography of biliary sludge, so just as for reference lang po, bali yon. So kung meron na, or recently I have a case actually na nagkaroon na kami ng ultrasound, so nakikita ko na yung mga bagay na ito. So sila ni Mizutani et al., nagkaroon sila ng category. So we have here ABC, so for the mild, moderate, and severe. So merong a 25% accumulation of gallbladder sludge dito sa mild, and there's 50% accumulation sa moderate, and there's 75 to 100% accumulation of sludge sa letter C. So ito yung actually yung kay Torbo na case na gusto ko sanang makita sa gallbladder. So ito yung gallbladder sludge, gross na photo. So skip ko na lang siguro. So sa medication, so ito nga yung medication. So we treat both aerobic and anaerobic infections, so with metronidazole and ampicillin, choleretics such as UDCA, antioxidants such as SAM-E and vitamin E, and hepatic protectant. So for the conclusion, in this case, the extrahepatic biliary obstruction was ultimately attributed to an intraluminal blockage caused by severe biliary sludge. So a multimodal diagnostic approach integrating clinical evaluation, laboratory data, and surgical findings is essential for accurately diagnosing and effectively managing complex hepatobiliary conditions. So this case contributes that cholecystomy, when performed promptly and appropriately, can be effective surgical intervention with the aid of supportive medications and dietary modifications for relieving EHBO. So the limitation of this study, yun nga po yung aking kaninang sinabi, na hindi natin na-cannulate to check for the patency of the common bile duct through the small intestine. So, sa future na mga gagawin, so, we need to do that kahit mahirap. And then further studies with ultrasonographic findings of the gallbladder sludges is recommended. Urinalysis must be routinely performed. So, dito hindi namin nagawa kay Torbo. So, then the chemical analysis of the biliary sludge to determine its chemical composition. So, before I end my presentation, so let me gaya-gaya din kasi ako, so may pa-quote din si Doktora. So, do not fear the unknown. So, it is the place where breakthroughs happen. So, in veterinary medicine, many surgical breakthroughs and life-saving interventions begin with a brave step into uncertainty. So, thank you so much for listening.
Wow! That's great. Torbo, so happy. So, really, happy pets, happy vets. Okay, for the EHBO, it's really also a rare case like the first presenter. And we need to have sharp medical eye, keen history taking and diagnosis. Just what Dr. Perez says, that skills is very important. Thorough checking is apt and important also to rule it out. Since una mong tinanong si Doc Paul, so Doc Paul will ask you first.
Gantihan na ito.
Thank you, Doctor. I think you learned a lot about the case ni Turbo. And I would understand that may limitations tayo with the diagnostics. But what would be your comment, or would you agree with me that this case could have been diagnosed on day one?
Yes, definitely. Doc.
Ano yung mga should have been done differently in your clinic or sa approach dito nang sa ganun, mas naging, sabi mo, mas better kung prompt yung intervention.
Yes, I agree with you, Doc. Kasi actually, I have a case just this last year and then until now, minamanage ko din. So, kaso lang, the thing is, yun nga, second opinion na siya and 4 days na din siyang na-treat with other veterinarian. So, yun nga. So, the learning from, tama din po kayo, I agree na, yeah, pwede natin siyang na-manage by giving all the medications and everything. But then, yun nga, since the progressive rise of the hepatobiliary enzymes really was evident, so kaya tayo nag-opt na i-open up just to, to confirm also na there's really something obstructing the gallbladder. So, pwede kasi siyang ma-manage based on literature, usually kung mga 50% pa lang yung accumulation. So, siguro din yun nga, dahil medyo na-delay tayo, so nagkaroon na siya ng build-up doon sa kanyang gallbladder. So, yun.
Okay. Doctora, we do have one question also here from Doc Olivia.
Hi, Doc Lavin.
Hi po.
Oo, your case is very interesting, no? Nag-abdominal surgery din kasi ako. So, I would like to know what size of catheter are you planning to use in the future? And then the size of the suture, because the gallbladder is so small.
Yes po.
And then, siyempre, if-flash mo siya, do you use a combination of sodium chloride plus anti-hemorrhage, for example?
Yeah, thank you, Doc, for your question. So, with the size of the cannula, so since yun nga, hindi ko pa siya nagawa, Doc, but based on literature, they suggest 3.5 to 5 FR na French catheter para po ma-check natin. And then, for the suture size naman, yun, as smaller as possible. So, 4 O's to 5 O's yung gagamitin natin kasi, yun nga, sobrang liit siya. So, it depends also sa breed kasi, yun nga, kung mga bigger than yung mga dog, so you can use, mga 3 O's. Yes.
Thank you so much. Yeah, Dr. Coloyan.
Doctora, my question is, what could be the probable pros and cons if you subject an animal into cholecystectomy?
Yun. Interesting question, Doc. So, yung cholecystectomy. So, Doc, I have to be honest. The initial plan that we have prior to doing surgery is really cholecystectomy. So, kaso lang, yun nga, sobrang nahirapan kaming ma-visualize talaga yung cystic ducts, especially. So, yung sa cholecystectomy kasi, siguro sa pros muna. So, yun. So, syempre, mas maganda, since the gallbladder naman, yung animal, just like sa human, mabubuhay naman without the gallbladder. So, it's really good to go, lalo na kung you are skilled enough to do the procedure and you are confident enough na mariremove mo talaga yung gallbladder properly. So, the cons, if ever, may mga cases kasi I have read a lot of literature na hindi nila na-remove properly. So, instead, na doon lang sila dapat sa may neck lang talaga sila ng gallbladder i-incise, doon sila nag-incise below, sa cystic duct. So, nagkaroon ng blockage yung flow ng bile from the liver to the small intestines. So, yun yung pwedeng maging cons talaga. And then, siguro yung yung time din ng pag-surgery. So, we have to remember na yung gallbladder is really, pwede siyang mag-rupture. So, as to with siguro the prognosis din. So, once na malala talaga, lalo na kung nagkaroon na ng spillage ng bile sa peritoneum, so you can have a poor prognosis. Did I answer your question, Doc? Okay. Ay, yes po. Doc Don.
Doc
May tanong
Don.
po si Doc Don.
Okay, I need to run. This is exercise. Yes, Doc.
I have 3 questions. Yung first one, what are the several factors para magkaroon ng biliary sludge? Number 2, what are the long-term complications ng surgery? And number 3, what can you say about the vitamin K1 for the jaundice?
Okay. Good question, Doc. So for the first one muna, so tawag dito yung mga factors that can tawag dito trigger the biliary sludge formation. Number 1, as according to literature, pwede talagang mag-contribute yung diet kasi parang na-overwork natin yung liver to produce more bile para i-emulsify or i-digest yung kinakain ng patient. But then hindi talaga siya ganun ka-established, pero meron silang mga suspicion na ganun. And then there are also few breeds na parang pwede ma-predisposed, pero hindi pa din ganun ka-solid or ka-conclusive din yung kanilang baseline. So mga golden retriever na mention nila, miniature schnauzer, pwede din sila. Yun. And then, ang second question mo, Doc? Yung long-term na complication. So far, kasi kung nagawa mo naman properly yung procedure, and then hindi mo nga, yun nga, yung sa cholecystotomy kasi, it's like parang nag-ano ka lang din, nag-urinary bladder opening ka. So you have to make sure that everything is clean and septic as possible. And then the proper use of medications, to control infections and everything. So right now, I don't have an idea kasi yun nga, this is my first case pa naman and yung sa mga complications I cannot talaga. And then the third one, ano nga, Doc? Yung sa vitamin K1, yun nga, nagkakaroon kasi ng, actually dapat nagbibigay. Kasi pwede siyang mag-cause talaga ng, tawag dito, ng bleeding, especially na kailangan talaga natin, di ba, yung ADEC, yung vitamin A, D, E, key, kailangan natin ng fats for proper absorption. So, kailangan natin supposedly yan ibigay. So, yun din pala yung isang naging limitation ng study. So, hindi ko siya nabigyan. So, that is one of the reason as well na sinususpect ko why the anemia was really progressive that time. So, buti na lang na transfusion namin. So, given the fact, kung babalik ako ulit sa surgery, I will be using definitely vitamin K1. Thank you for the smart question, Doc.
Okay. For the last question, Doc, I just want to read the online question. Hello, Doc. Related po ba sa diet yung pag-form ng sludge and may dietary restrictions po ba to prevent it? And about what anesthetic also for considerations must be taken into account po when operating on a dog with EHBO and compromised liver function.
Yeah. Okay, so yun po. Bali, as I've mentioned sa tanong ni Doc Don kanina regarding the diet, so we have to modify. So there are a lot of commercially available na ngayon na diet na low in fat, mga tawag dito controlled na yung mga component nila. So you may opt for that one. So sa kay Torbo, prescription diet siya for a couple of months, and then nag-maintain na lang sila sa good quality dog food after that kasi medyo namahala na rin yung owner. And then yung second, Doc.
For the anesthesia, Doc, consideration ng anesthesia when operating and compromised liver function with the EHBO patient.
Yes po. So for the anesthesia naman, sa aming, as I've mentioned, we used just Zolitil that time, injectable anesthetics, but ngayon, kung papipiliin ako, so we have to really go with the safest one, the isoflurane or gas anesthesia. Kasi the procedure, matagal siya. Sumukha lang siyang madali sa video, pero grabe, medyo nahirapan din talaga kami kasi lalo na sobrang liit nga ng patient. Tapos, i-visualize mo pa yung urinary yung gallbladder na sobrang liit and everything. So, when we did the surgery, napaka-poor naman natin, wala pa kaming surgical lamp. So marami kami mga nagpe-flash ng cellphone and everything. Pero meron naman na ngayon. Fortunately, nabiyayaan na kami. So yon. So ano lang siguro, yon po. Bali yung naging challenge.
Yeah, so many questions still here since your topic is really interesting, Doc. Now, for those who wanted to ask Dr. Lavinia, you can message her directly and ask her the question. So let's proceed with our next presenter. Thank you, Doc. Dr. Chris Lau will introduce our third presenter for today.
Dr. John Dexter Presto is a dedicated veterinary professional with extensive expertise in small animal medicine and surgery. He earned his Doctor of Veterinary Medicine degree from the University of Southern Mindanao in April 2008 and successfully passed the Veterinary Board Licensure examination the same year. Since then, Dr. Presto has specialized in small animal practice, focusing on surgery with particular expertise in soft tissue and orthopedic procedures. His passion for advancing veterinary medicine has led him to join advanced surgery seminars and joint replacement workshops in these specialized areas, acquiring his knowledge and sharing his skills with fellow practitioners. In 2018, Dr. Presto earned a prestigious postgraduate certificate in surgery from continuing veterinary education at Sydney University, further solidifying his expertise in veterinary surgery. He is currently pursuing a master's degree with Improve International and the International School of Veterinary Postgraduate Studies in collaboration with Harper Adams University, which awards globally recognized postgraduate veterinary qualifications. Dr. Presto's commitment to professional growth and his contributions to veterinary education reflects his dedication to delivering the highest standards of care and advancing the field of veterinary medicine. Please welcome Dr. John Dexter Presto.
ka mo, Doc, wait lang. diagnosis, treatment, and outcomes. So the learning objectives of this topic will be to describe the pathogenesis of the patella luxation, briefly describe the MPL grading scheme, and to discuss the clinical presentation of patella luxation, and how to diagnose patella luxation and the techniques, and how to manage it. So for the brief introduction, patella luxation occurs when the patella or the kneecap deviates from its original or normal position with the trochlear groove or the femur, most often shifting on the medial side on the young dogs or the small dogs, small breed ones, and it can occur in both the medial direction, which can be far more common in small or toy breed dogs. So how to diagnose MPL? This requires a thorough clinical examination supported by diagnostic imaging to assess the severity and underlying anatomical abnormalities. So the early onset of MPL highlights the importance of prompt diagnosis and intervention to mitigate progressive joint damage and improve quality of life. So the treatment options that we have now is ranging from conservative management for mild cases to surgical intervention for more advanced cases. So the surgical procedure includes trochleoplasty, tibial tuberosity transposition, soft tissue reconstruction, which aims to restore patella stability and normalize limb mechanics. So this three surgical procedure will be discussed later. So when a patient will be presented in our practice, so normally we will observe the patient on the table. This is a case that I have. So when you place it in the table, so it is reluctant to stand up and it's hard to get up. So this is considered as low-grade lameness. So other clinical presentation includes intermittent non-weight bearing or skipping gait or bunny hop, which is more common. The incidental patella can feel the luxation but no clinical signs, especially in very small dogs like Chihuahua and Pomeranians. And limb angulation or anatomical malformations, which will give us a chronic non-weight bearing clinical signs. So, yeah. So, patella luxation pathogenesis is actually really poor to understood. And that's not surprising because there is not one single skeletal abnormality that consistently results in medial patella luxation. Instead, we see a variety of different skeletal abnormalities that all contribute to displacement of quadriceps group, dismal alignment of quadriceps or extensor mechanism. Generally speaking, patella luxation is considered a congenital malalignment of the quadriceps mechanism. The quadriceps mechanism, which is these muscles, starts with the origin of the quadriceps groups on the pelvis of the proximal femur. It's displaced on the muscle belly, so that the sesamoid bone will be malaligned to the trochlea itself. Essentially, if the patella then luxates out of the trochlea, it resolves to the extensor mechanism of the stifle itself. The big quadriceps group is the only extensor of the stifle. This is important if you're going to kick a football. But if in dogs, the extensor mechanism is particularly important to maintain weight bearing, so resisting gravity. Without it, it results in significant lameness of our patients. So it can be, the abnormality will be proximal femur and distal femur. So on proximal femur, we can see changes of angle of inclination and changes in angle of version. On the distal femur, we will see varus and valgus. So varus is yung sakang, and the valgus will be the deformity. Torsional deformity of the distal femur and the shallow trochlea. So to further appreciate that on the images and radiographs, so the angle of the femur, as you can see, is not straight here, and on the imaging for the CT scan, ito po yung nangyayari sa femur at saka sa tibia. So on distally, the alignment of the tibial tuberosity is not straight as well. So the effects of luxation. Effects of luxation could be asymptomatic. There would be lameness, skipping gait, pain secondary to osteoarthritis, crouch gait, and non-weight-bearing lameness. So in some cases, we see dogs that are completely asymptomatic. It may be an incidental finding sa mga vaccination natin. So we have to carefully examine the dog or the patient carefully, and then we can observe them mostly during on the table and when they are free roaming around on the consultation rooms. So we have those opportunities to observe the gait of the patient. So we have 4 grading systems of the MPL, which is founded by Singleton in 1969. Grade 1 is the in patella, which is the trochlea where is the normally found and barely can move out. Grade 2 is the patella the patella can be shifted out and can be normally go back in. So it can go out, but it can go back in. So grade 3 is more advanced. So it is out in. So the patella is out, and then you can push it in, but it goes out. And the grade 4 is the most severe, which is the patella is out and of the groove, and it cannot go back to the patellar groove. So as you can see, this grade 4 has no trochlear notch, and the patella cannot go back in. So usually what I do for clinical examination, I would be examine the dog during the standing position and see it from behind, and then you can see and appreciate that there's muscle atrophy on the left side of the limb of the hind limb of this dog. And then I would also palpate the symmetry and appreciate the effusion or edema on the medial buttress and thickening of the stifle, which suggests synovitis or inflammation. So you have to check the patella position as well, and you have to appreciate whether there's patella alta. Patella alta is a condition where the patella is proximal of the trochlea and is easier to luxate. So the next procedure would be gait assessment after feeling the patient. Gait assessment, so for this case, this is my case. This dog has a grade 4 lameness of the right hind leg, so you can notice that there is internal rotation of the right hind leg. And then for this one, this dog has a border collie which has a low-grade lameness with an external rotation, narrow stance of the leg bilaterally with pelvic sway, which suggests hip dysplasia and possible stifle disease. So on gait assessment, we can appreciate the pelvic, stifle, and hock movement. So after we have achieved what we have on the gait assessment, so actually I would like to appreciate as well and lay my hands on how does it feel. So you have to check the range of motion for each patient. And also you have to see this patient walks with 4 legs at the start and intermittently carries the left leg, and offloading some weight of the front leg increased speed in walking and running. So those were the things that we have to appreciate during our examination. So apart from that, we need to check as well whether there's any neurological deficits. So brief neurological assessment to rule out other causes of lameness, proprioception assessment, and support of the weight, flexor reflexes and patellar reflexes. We have to rule this one out so that we can completely treat the patient and without other complications. So hip assessment and stifle assessment is also done. We can do the Bardens and Ortolani test, cranial cruciate ligament assessment, and also direct tests such as cranial drawer test and indirect tests such as tibial compression test. So on this test, a clunk or grinding of the hip joint or stifle, which suggests laxity. So cranial cruciate assessment or ACL rupture, stifle, palpation for edema and inflammation. So when it comes to palpating the patella, I think there are 2 real forces that you can apply to the patella. The first is medially directed force, and this is typically what we do to luxate the patella. So, however, it's important to recognize that it's not the force of the animal experiences in each and every day. So, an alternative to perform the test is through perform of internal rotation. So, this is as much a natural force to apply on the hip, particularly when the animal are cornering and turning. If we look the next slide. Okay, so after we do a gait assessment while the patient is awake, we can do the assessment also in under sedation. On this case, I'm trying to do the manipulation of the stifle joint to see whether there's an ACL rupture. So as you can see on this patient, it has a patella luxation and a cranial cruciate ligament rupture. So the stifle is unstable. So to appreciate further of what I'm discussing earlier, so when you internally rotate the hop, the patella will be going in and out. So you can observe that. So let's play that again. Okay, so what are the advantage of a sedation and patient with while examining the patient while awake and examining the patient while it's sedated? So there are advantage. So physical examination under sedation, dito po natin mafe-feel yung patient na meron pang tension yung muscles on or may tone pa yung muscles while they are awake. And then if they are under sedation, doon ma-appreciate natin yung full range of motion ng pasyente. It will influence the patella assessment as well. So after we have done the assessment while awake and under sedation, so we'll need to do the radiographs. Usually, if the initial assessment po natin is ma-feel na natin yung patella is naglo-luxate, pwede na po tayong mag-proceed sa radiographs or radiographic workup. But then again, usually what we do in our practice, nagtitake po kami ng radiographs under general anesthesia or deep plane of sedation so that we can take a good x-rays and proper x-rays. So usually orthogonal views, lateral, and podocranial view. So you can observe the limb alignment and appreciate the other diseases just like osteoarthritis and joint effusion and worst case scenario neoplasia. So why orthogonal views? So we always do orthogonal views for our x-rays to measure distal femoral valves or angle of deformity of the femur, if there is any. The positioning of the x-ray is very important. And in advanced cases, we need to do CT scans to check the limb alignment and to understand the torsion of the bone itself. So for the treatment, usually, as we have said earlier, based on the Singleton assessment or grading system, generally I operate on cases from grade 2 if it's clinical. Grade 3 and 4 is definitely for surgery. So decision making entirely depends on the history, physical exam, and diagnostic imaging. So from the history itself, if let's say why the patient or the client came to our practice, it's because of the lameness. So when you have isolated or localized the pain or the cause of the lameness already, then you can go directly to your diagnostic imaging. Okay. The next procedure would be the surgical procedure on how we correct this disease. So there are times na one or two lang ang ginagawa natin or pwedeng is a combination of three. So this surgical procedure is the trochleoplasty, or a wedge or a block trochleoplasty will be performed to deepen the trochlear groove, allowing to improve patellar stability. So the other one will be the medial release, which will be the release of the medial retinaculum and to release the tension, pulling the patella medially. The next one will be the lateral implication. So sutures will be placed on the lateral side of the patellar capsule to provide support to the patella. Okay, so tibial tuberosity transposition, the tibial tuberosity will be cut by the osteotome or in oscillating saw and repositioned towards the center of the body. So metal implants such as wires and tension bands or circlage wires are placed to transpose the tibial tuberosity in place. So post-op care, pwede tayo magbigay ng mga pain reliefs, paracetamol, pwede po sa aso pero bawal po sa cats, NSAIDs and opioids. Then antibiotics can be given as well for from 5 to 7 days to prevent infection. So just to show you guys how we do the trochleoplasty. So there are two types. So we have wedge and block. Usually I'll do wedge on a very small dog, maybe 5 kilos and below, or even 8 kilos and below. And then on large breed dogs, from 10 kilos and above, usually I'll do block trochleoplasty. Okay. So for this slide, as you can see, this is a patient which has actually it's parang wala na siyang trochlea or trochlear groove. So the patella will not really even sit on this one. So, pumupunta talaga siya sa medial side. So, ito yung patella niya. And then what we did on the case, so we did a wedge trocheoplasty, and then that's how we create a groove for the patella, para remain into position. So this is how it looks in this figure. So sa trocheoplasty naman, tibial tuberosity transposition. So the tibial tuberosity will be cut and then medialized, and then we will place an pins and then a tension band para ma-align yung kanyang patella. So this is the normal tibia alignment with the patella. So this is what happens when meron siyang medial patella luxation. So as you can see, yung muscle ng quadriceps pumupunta dito sa patella, and then it will shift to the left side or to the medial side kasi hindi aligned yung kanyang tibial tuberosity din. So that's one of the cause. So it's a complex disease. So after we did the surgery, so it's always good to compare the pre-operative and post-operative radiographs. So this is the pre-operative and this is the post-operative radiograph. So as you can see, you can appreciate the placement of your pins and the tension band here below the tibial tuberosity. Okay, so this is XC before the surgery. So that's how he really walks before, and then this is 3 days post-op. Okay, so there's another video. Medyo ma-appreciate ninyo, medyo lame pa rin yung pasyente, but again, as you can see, naglalakad na siya ng maayos, and then can use the 4 legs na. And then the way I appreciate those things na successful yung is they can do what they want. They can squat. Itong last portion ng video, they can do their business without lifting other leg or hindi siya in pain. So they're comfortable doing their business like pooping or urinating. Okay, that's how it is. So this is XC after 4 weeks. All right. So profit and outcome, immediate post-operative outcome, of course, we can always see limb swelling and lameness. I'll always tell my clients that there will be a swelling for the first 7 days. That's where inflammation sits in. And then after the NSAIDs or the medications have been completed, usually the expectation will be the swelling will go down. So follow-up assessments is important. Usually 2 weeks, 6 weeks, and 12 weeks post-surgery. Usually 2 weeks I'll do a stitch out, take the stitch out, and then just feel the legs, watch the dog, how it walks, and if let's say merong mga complications earlier, then you can catch it. And then the next review will be 6 weeks post-surgery. Gait assessment, and also I would love to see and appreciate the bone healing. So I'll suggest radiographs as well. And then 12 weeks post-surgery, an expectation is full recovery will be expected. But then again, sometimes meron mga complications. So you would still love to see the patient after 3 months. Progress and prognosis and complications. So usually for grade 2, favorable yung prognosis if we can catch it earlier. And then potential complications ng after surgery is osteoarthritis, implant loosening and migration, especially on the pins. And then relaxation is 5% and infection as well. So infection usually is very low, but it's not impossible to happen. So that's why I will still give some antibiotics post surgery. So for the discussion, medial luxating patella is a condition that frequently affects small breeds, as what I've said. So it can be on genetic predisposition, Chihuahuas, French Bulldogs, Pomeranians, toy poodles are usually my cases. The decision to proceed with the surgical intervention depends on the grading system, and usually different approach and on different grading scheme or different grades, sorry. Generally, they recover and has good outcome with good surgical technique. So, conclusion, for this case highlights the importance of multimodal approach for managing luxating patella in dogs. Usually, we need to have a good diagnostic imaging and a good radiograph to appreciate the changes. Sorry. And then decision making on surgical intervention, and then pain management and physical rehabilitation after surgery. So the post-operative outcome observed emphasized the efficacy of combining trochleoplasty and imbrication of patellar stabilization. So just like what I've discussed, on early stages of the patient selection, if let's say we can, pag nakita po natin na bata pa yung pasyente, let's say 8 months and below, so that means meron pa silang growth plates. We can always do lateral imbrication. So, and then after maging mature na yung pasyente, then we can always reassess the patient whether it will still need the trochleoplasty and tibial tuberosity transposition. So why we do lateral imbrication muna? Kasi nga open pa yung kanilang growth plate, so we don't want to disturb that. And then we only do those 3 surgeries on mature bone. Okay? So for cases that with medial patellar luxation, timely surgical intervention is significantly improves outcomes and quality of life. So for those cases that have been yung chronic case na or matagal na, usually hindi na sila masyadong, naapektuhan yung kanilang outcomes, especially with patients with crepitus or yung meron na siyang arthritic changes sa patellar groove. So on those basis, pwede na tayong mag-suggest ng patellar groove replacement or PGR, which is a new technology ngayon sa market na pwedeng gawin, and then it has a good outcome as well and lesser complications. So it's a type of joint replacement actually, semi, kasi inaano lang natin yung kanyang patellar groove. So take-home messages, so appropriate case selection for those starting to do patella luxation or orthopedics. You have to start with those grade 2 muna before you venture on those advanced cases. so that you will not be frustrated on your cases. So case selection, then physical examination is the key to decision making, and also comprehensive examination in every single case. So the more cases that you have na merong lameness or patella luxation, then the more you have a template at the back of your mind, and the more experience that you will have on doing the surgeries. My advice on young surgeons, please don't hesitate to refer or ask for a guidance from other surgeons para maging successful yung mga outcomes ng ating mga surgeries. So surgery is indicated for cases grade 3 and 4, of course. Grade 2, nasabi ko na, it depends on the history and spontaneous luxation and the clinical signs if it's clinical. So grade 1 is supported by history and imaging findings. So usually I don't operate with grade 1. They do well. So post-operative care and rehabilitation, control physical therapy, monitor for complications, implant failures, and joint stiffness or recurrence of luxation. So meron tayong mga preventative measures. So advise lang natin yung mga owners and breeders natin to do responsible breeding, so that we can minimize the luxations or yung congenital MPLs or medial patella luxations. We advise the client as well to have regular exercise and also weight management to reduce joint stress. Long-term monitoring and client education is appropriate, and to schedule follow-ups, especially for those grade 2 patella luxation, we have to let the client know na meron na silang patella luxation at early grade, and then if let's say if the case will progress, then we have to do intervention. Inform the clients about potential osteoarthritis when if they choose to manage it medically, and then it will lead to chronic or severe cases. We can only discuss the strategies and how to maintain joint health. So thank you for your time, and I'm ready for your questions.
Hello. Yeah. Thank you so much, Doc Dexter.
Hello?
Okay, so now let's have some questions online and here face to face. Meron po ba tayong mga tanong kay Doc Dexter? All right. Okay, question from Doc Angie Maika Baharo. Great topic, Doc. What rehabilitation and supplementary dietary recommendations are recommended moving forward, Doc, in joint diet versus regular diet? Is Adequan readily available in your practice? And what is the price range for the MPL case, Doc, in the Philippines?
So, complex na question. So, with regards to diet, usually I would advise complete diet. Any available diets out there in the market is complete diet, which will support bone growth and normal nutrition. I do usually discourage yung home cooked food kasi nga hindi siya complete na nutrition. If let's say they're going to give yung mga home cooked food, then they will have to add yung mga calcium supplements para magkaroon sila ng normal bone growth and development. And then with regards to a rehabilitation, usually I would just say encourage your pets to do range of motions, flexion and extension, they can always do their normal activities, walking 15 minutes twice a day, and then hydrotherapy is good, swimming, and then to have yung walking on inclined surfaces so that there will be tensions or pressure on the muscles as well, so that would help. And then price range, depending on which practice. Usually, the surgery itself would range about 20 to 40,000, I guess, for excluding the implants and other treatments. So those were the price range. Yun lang pong alam ko.
Thank you, Doc.
I hope I have answered the question.
Yeah, for the price range, really important to understand, and our client must understand that the equipments and the things that we are using for bone surgery are not cheap. So we do have another question here from Doc Paul Cardenio. Doc Paul?
Hi, Doc Dex.
Yes, Doc.
Two questions. First is, can you wait ba? For example, minsan makikita natin grade 1 pa lang siya. At what point natin kailangan gawin yung surgery? Kailangan ba hintayin natin mag-grade 4 or grade 3 to before tayo mag-surgery? Or kahit grade 1 pa lang siya, would it matter? Parang pwede na ba agad natin siyang i-surgery? Would it affect ba yung quality of life ng pasyente kung i-delay natin or gagawin ng mas maaga yung surgery?
Okay, good question. So usually for grade 1, depending on the clinical signs of the disease, usually for grade 1, meron sila mga skipping lameness, on and off. Pero minsan kasi yung mga clients natin are very particular. Minsan natutuwa sila, nagbabanihap yung pasyente. Pero usually hindi siya maganda kasi nga it can lead to advanced cases of patella luxation. From grade 1, it goes to grade 2. So how long can we wait? Usually, depende sa sequence. Sa nabanggit ko na, there are small breeds of dogs that they are doing well kahit na naka-luxate yung patella nila. But then again, we have to see whether it's progressing. So, ano yung nakaka-apekto ba siya sa daily activities ng dog? And also, how long can we wait? Usually, I would advise them na not too long. Usually, I'll give them about 2 to 3 months to decide para gawin yung surgery. I always tell them as early as possible, but not too long. Kasi nga, it will lead to osteoarthritis nung stifle. Once we have arthritis of osteoarthritis on the stifle, then there are more complications. Yes, we can always still do the patella stabilization surgery, but then again, we can expect osteoarthritis. If, let's say, that will happen, then we have to suggest to the client na yung patellar groove replacement na ang gawin natin. Kasi if rough na yung surface ng trochlea, then that would lead to pain as well.
Follow-up question lang muna. Follow-up question, Doc.
Yes.
Regarding, of course, yung nabanggit mo procedure is one of the standard procedures in doing stabilization ng patella. But there are newer techniques. And what will be the deciding factor, which technique to use? Kasi dito sa ginamit mo is the standard one, but we know for sure na there are other options. So, ano yung deciding factor for that?
So, the deciding factor for me would be the age of the patient. As what I've said, usually pag young pa yung patient, from 8 months and below, so we don't usually do trochleoplasty and tibial tuberosity transposition. We can only do lateral or medial imbrication just to stabilize the patella on the middle. Number two is yung age. Age factor and yung how does the patella feel. So if there's crepitus on the patella, then you will have to see whether how advanced is the arthritis or the erosion of the trochlear notch. Usually, you will not appreciate it on the X-rays, but usually you can see it on the surgery theater itself, and then at least you can tell it to the client that these are the expectations after surgery.
Yes, we have one question from Doc Olivia.
Hi, Doc John Dexter. Hi, Doc JD.
Hi.
Yes, Doc. Simple lang po yung question. Meron nagsasabi,
Yes, po.
what is your take dito sa sinabi ng isang vet na management of pain after surgery? Would it be advisable not to give them anti-inflam for the first 36 hours para lang hindi magamit? Or do you advise to give yung anti-inflam para ma-ambulate na kaagad yung patient after the procedure? Thank you.
Okay, good question. So some practitioners, they will give like pre-operative NSAIDs or anti-inflammatories just to lessen the amount of the expected inflammation rather than creating trauma via surgery to the soft tissues and then causing inflammation. So as what we have said, inflammatory process sits in from day 1 to day 7. So that's why we need to give anti-inflammatory medications kasi yung surgery itself is trauma to the soft tissue and bone. So I would suggest na magbigay tayo ng anti-inflammatory for at least a couple of days, 3 to 5 days is fine. Yeah.
Doc, we have another question from the floor.
Doc, good morning. This is Doc Ems. I have two questions actually. My first question is, if we do have a case of grade 2 sa left and grade 3 or 4 sa right, should we do bilateral patella repair or should we wait for the other one to progress? Kasi kung for example, 1 pa rin siya, tapos yung isa mas aggravated, 3 or 4 na siya, bilateral ba siya or unilateral? Second question is, let's make it more complicated. I have a case of patellar luxation, ACL tear, and at the same time I have a hip dysplasia. What is your insight on the surgery for this case? Thank you.
Okay, for the first question, one of the limb or leg is grade 1 or 2, and then the other leg is more complex, which is grade 3 or 4. So I usually do bilateral patella luxation, depending if okay, kasi i-discuss natin sa client kung kaya ba nilang alagaan yung pasyente and what's the expectation of that. So usually I do bilateral. It saves cost for the client and also for the dog as well to heal in one go. Kasi nga kung gagawin natin na stage yung procedure, pwede rin naman. Wala namang problema. So if I will do the stage procedure, I'll do the grade 4 muna, grade 3 or 4, and then we can see how it goes kung magiging better ba yung kaliwa or yung isang leg. So the answer for that is yes, I would do bilateral patellar stabilization procedure. For the next question, ACL and advanced case hip, meron din siyang comorbidity na hip din. Usually, depending on your assessment, that would go back to your history taking, ano ba yung cause ng lameness. That's why we do palpation, we do range of motion. So what's the first pinaka-urgent na matter na pwede nating i-repair? So I would really go for the stifle muna kasi nga without the stability of your stifle, and hindi rin siya maglalakad. Kasi nga meron din mga patient na luxated na yung hip pero nakakapaglakad pa rin sila. The treatment for that is TPLO. So, implant. So, ano natin yung kanyang angle ng kanyang tibial angle of the tibia, modify that, and then to sometimes to translate that. So, meron tayong tinatawag na TPLOM, modified TPLO, yung sinasabi ng iba para i-translate natin konti sa gitna yung piece na kinat natin na wedge, and then we can rotate it to have a 90-degree or 95-degree angle so that it will be more stable. That will fix your patella luxation. And also we will include on top of the TPLO surgery, we'll do the lateral imbrication then, and also your trochleoplasty. But we will not do the tibial tuberosity transposition na.
Okay. Doc, another question from Dr. Clarissa Grace Verceles Olarte. May non-surgical approach po ba in managing patellar luxation?
So that's a tricky question. So yes, non-surgical, meron namang available sa markets na mga yung stifle support. But then again, I would always say to the clients na those were knee support na temporary lang. So there are more complications rather than it would be helpful, I guess, in my experience. Kasi nga, yung knee support natin is nagwo-work lang siya if it's like very tight, not so tight. So depending on yung comfort din ng pasyente. Sometimes mas sinisira pa nila yung kung ano yung nakakabit sa tuhod. So balik tayo dito na okay. So this diagram. So there's no muscles or muscle na nag-i-stop sa patella going to the left and right. Only capsule, joint capsule lang po. So on this basis, pwede niyong sabihin sa client na there's no other way. If let's say it would go advance yung case, so that means we still have to go for patella stabilization. So surgical option talaga tayo.
All right, Doc. Noted. Well noted. Okay, for the last question, how can post-operative care and rehabilitation be optimized to prevent recurrence or complications in young patients? And also, have you considered also laser therapy for the management of the post-op care? And what are the, if ever you consider the laser therapy, what are also the protocol for this?
Okay, so yes, I would really go for rehabilitation. So what I've said, for the planning of rehabilitation for the first 6 weeks, so restricted movement muna. So wag muna silang magkaroon ng zoomies or extraneous activities or long walks. So maybe 5 minutes walks, controlled leash walks, to pee and poo outside, pwede na yun. Pero for the first 6 weeks, so that would be a strict no strenuous activities. From 6 weeks onwards, pwede na tayo mag-start ng longer walks, range of motion, pwedeng hydrotherapy, and also inclined surface walks, but avoid staircases and jumping and running. Laser therapy, yes, magandang ano siya, and then it's gaining more popularity in our practices now, which has a good paper as well to support na they're very effective on healing process of the soft tissue and bone. Yes, ang sa part ko naman, I don't have the experience or I don't have the expertise on how laser works, so I guess I would leave that to depending on the manufacturer's recommendation. So yun yung mga kanilang frequencies na kailangan. Yeah.
All right. Thank you so much, Doc Jan Dexter. So for those who wanted to ask more, you can send your questions directly to Dan.
Yes, there's one more.
Yes,
Sorry,
Doc.
nakalimutan ko lang. So the importance of the rehabilitation then is to gain back the muscle wastage. So sa kaninang lecture or sa napansin niyo na yung yung muscle dito. Yeah. So this muscle here is wasted, and then ito yung good limb. So rehabilitation is very helpful para ma-regain natin yung ulit yung muscle mass nitong affected limb. Yeah.
Okay, thank you so much for that. And everyone, talagang busog na yung mga brain cells natin. Pumuputok na po ba? So now, it's time. Thank you so much, Doc Dex.
Thank you so much, everyone.
Okay, it's time for a well-deserved break. So let's have 1 hour break for lunch. And we thank you again, VetMate, for keeping us nourished at the same time, both clinically and literally. So have a good lunch. Let's come back after 1 hour.
VetMate Pharma Corporation, a Filipino company engaged in the distribution of veterinary products, specializing in companion animals for grooming, supplements, and veterinary medicines. Founded in June 13th. VetMate Pharma Corporation, a Filipino company engaged in the distribution of veterinary products, specializing in companion animals for grooming, supplements, and veterinary medicines. Founded in June 13, 2006, it started when Mr. Herman A. Panghulan, President and CEO, shaped up a cluster of former Beringer Mannheim associates to build a veterinary company. The company continues to expand to provide premium quality veterinary products. VetMate Pharma Corporation also offers a wide range of premium quality products for poultry, such as broilers, layers, and racing pigeons. And on October of 2020, we introduced our first agri product, Leafy Green Organic Foliar Fertilizer. Multivitamins and minerals plus omega-3 fatty acid for support of your canine companion's heart health, promotes a silky coat, reduces itchy and flaky skin, and can help relieve allergies and joint pain. Papi MVP is specially formulated nutritional supplements fortified with vitamin D3 to promote your pet's general health, internal organ, function, and proper diet. Vitamin D3 is cholecalciferol, which maintains calcium balance necessary to bone growth and increase bone mineral density. Papi OB is a breakthrough herbal and mineral nutritional supplements specially formulated to enhance and promote animal health during the pregnancy period. Pappy OB aims to supply that requirement using natural ingredients from malunggay and other mineral resources. Pappy Bion Plus is indicated for the use in prevention and treatment of iron deficiency anemia due to infection, intestinal and external parasitism, iron depletion secondary to post-operative blood loss. Pappy Plate Leaf contains a combination of multivitamins, minerals, and Euphorba hirta for the prevention and treatment of vitamin and mineral deficiencies. It is a supportive remedy of thrombocytopenia and anemia in pets. Nacalvit ZC is a combination of 2 mineral ascorbates or non-acidic vitamin with zinc. It improves immune function and increases the blood level of interferon and antibodies. It also helps in dog arthritis and other regenerative joint diseases. Happy Live Well is a natural food supplement for dogs and cats for a healthy liver, heart, and brain. It is a combination of silymarin or milk thistle to specifically protect liver against toxin. L-carnitine helps fat metabolism and docosahexaenoic acid or DHA, and omega-3 fatty acid for faster brain development and serve as an anti-inflammatory. Pappy Live Well also helps increase appetite, regeneration of damaged liver cells, elimination of harmful toxins, enhances digestion and promotion of better growth. Renacure is a dietary supplement for use in dogs and cats that contains a combination of potassium citrate, docosahexaenoic acid, and Lumea balsamifera ingredients known to aid in the prevention of urinary stone formation. Uticare contains cranberry extract and D-mannose for the relief of symptoms of mild recurrence, lower urinary tract infections of dogs and cats. It also promotes urinary function with proper pH balance and helps support the bladder against any infection. Oritec. It contains a combination of gentamicin sulfate and dexamethasone valerate used for the treatment of inflammation and bacterial infections of the ear in dogs and cats. Gentamicin Wound Ointment. It contains 0.2% gentamicin sulfate, a broad-spectrum antibiotic used in disinfection of all types of wounds, such as cuts, bruises, burn, and surgical incise wounds. Topiderm contains 10% iodine solution, cotrimazine, and potent herb, such as guava leaf extract, citronella, eucalyptus extract, and aloe vera for disinfection of all types of wounds, such as cuts, bruises, burn, and insect bites. It is also a good insect repellent for ectoparasite and other crawling and flying insects. Iozine Wound Spray contains 10% iodine solution, cotrimazine, and potent herbs such as guava leaf extract, citronella, eucalyptus, and aloe vera extract. It is used as disinfectant in all types of wounds such as cuts, bruise, burn, mange, and surgical wounds. Pappy Emetics is used in dogs, cats, and small mammals to stimulate stomach and upper small intestinal movement to prevent esophageal reflux. It is also used in the treatment or prevention of vomiting in dogs and cats. It is also used in dogs and cats to induce milk letdown and to promote milk production. Vermifuge and Volapets is an anthelmintic drug for the treatment of mixed infection by nematodes and cestodes of the dogs and cats, such as Toxocara canis, Toxascaris leonin, Uncinara stenocephalia, Ancylostoma caninum, Echinococcus species, Taenia species, Dipylidium caninum. Happy Oatmeal Shed Control Shampoo gives a long-lasting soothing relief in controlling shedding or loss of hair of your pets. It contains oatmeal that hydrates and moisturizes your dog's skin for a healthier and manageable coat. Vitamin E is an antioxidant that protects and repairs the skin and generally prevents it from dryness. And guava extract has a natural antibacterial property to maintain healthier and germ-free skin that prevents your pet's excessive loss of hair. Happy Oatmeal Hair Regrowth Shampoo is enriched with oatmeal that hydrates and moisturizes your dog's skin. Aloe vera extract that prevents your pet's hair loss. It also soothes dog's skin to prevent itching. Andiroba oil has been used as an anti-inflammatory property that helps our pet's coat and skin, leaving them a softer and healthier manageable skin and coat. Pappy Oatmeal Insect Control Shampoo gives a long-lasting relief in controlling external parasites such as ticks, mites, and fleas. It contains oatmeal that hydrates and moisturizes your dog's skin to promote a healthier and manageable coat, and fipronil that eliminates and kills the fleas and ticks that try to bite our pets that can be itchy and uncomfortable. It can also cause painful allergic reactions and transmit dangerous illnesses. Papi Mixidin is a combination of miconazole nitrate and chlorhexidine gluconate that helps provide relief against fungal infections such as ringworm and superficial skin infections caused by yeast and bacteria. It is the shampoo of choice for those suffering from mixed fungal and bacterial infection and skin with wound and other skin damage. VetMate Pharma Corporation, a Filipino company engaged in the distribution of veterinary products, specializing in companion animals for grooming, supplements, and veterinary medicines. Founded in June 13, 2006, it started when Mr. Herman A. Panghulan, President and CEO, shaped up a cluster of former Beringer Mannheim associates to build a veterinary company. The company continues to expand to provide premium quality veterinary products. VetMate Pharma Corporation also offers a wide range of premium quality products for poultry, such as broilers, layers, and racing pigeons. And on October of 2020, we introduced our first agri product, Leafy Green Organic Foliar Fertilizer. Multivitamins and minerals plus omega-3 fatty acid for support of your canine companion's heart health, promotes a silky coat, reduces itchy and flaky skin, and can help relieve allergies and joint pain. Papi MVP is specially formulated nutritional supplements fortified with vitamin D3 to promote your pet's general health, internal organ, function, and proper diet. Vitamin D3 is cholecalciferol, which maintains calcium balance necessary to bone growth and increase bone mineral density. Papi OB is a breakthrough herbal and mineral nutritional supplements specially formulated to enhance and promote animal health during the pregnancy period. Papi OB aims to supply that requirement using natural ingredients from malunggay and other mineral resources. Papi Biome Plus is indicated for the use in prevention and treatment of iron deficiency anemia due to infection, intestinal and external parasitism, iron depletion secondary to post-operative blood loss. Papi Plate Leaf contains a combination of multivitamins, minerals, and Euphorba hirta for the prevention and treatment of vitamin and mineral deficiencies. It is a supportive remedy of thrombocytopenia and anemia in pets. Nacovit ZC is a combination of two mineral ascorbates or non-acidic vitamin with zinc. It improves immune function and increases the blood level of interferon and antibodies. It also helps in dog arthritis and other regenerative joint diseases. Papi Live Well is a natural food supplement for dogs and cats for a healthy liver, heart, and brain. It is a combination of silimarin or milk thistle to specifically protect liver against toxin. L-carnitine helps fat metabolism and docosahexaenoic acid or DHA, and omega-3 fatty acid for faster brain development and serve as an anti-inflammatory. Papi Live Well also helps increase appetite, regeneration of damaged liver cells, elimination of harmful toxins, enhances digestion and promotion of better growth. Renacure is a dietary supplement for use in dogs and cats that contains a combination of potassium citrate, docosahexaenoic acid, and Lumea balsamifera ingredients known to aid in the prevention of urinary stone formation. Uticare contains cranberry extract and D-mannose for the relief of symptoms of mild recurrence, lower urinary tract infections of dogs and cats. It also promotes urinary function with proper pH balance and helps support the bladder against any infection. Oritec. It contains a combination of gentamicin sulfate and dexamethasone valerate used for the treatment of inflammation and bacterial infections of the ear in dogs and cats. Gentamicin wound ointment. It contains 0.2% gentamicin sulfate, a broad-spectrum antibiotic used in disinfection of all types of wounds, such as cuts, bruises, burn, and surgical incise wounds. Topiderm contains 10% iodine solution, cotrimazine, and potent herb such as guava leaf extract, citronella, eucalyptus extract, and aloe vera for disinfection of all types of wounds, such as cuts, bruises, burn, and insect bites. It is also a good insect repellent for ectoparasite and other crawling and flying insects. Iodine wound spray contains 10% iodine solution, cotrimazine, and potent herbs such as guava leaf extract, citronella, eucalyptus, and aloe vera extract. It is used as disinfectant in all types of wounds such as cuts, bruise, burn, mange, and surgical wounds. Papi emetics is used in dogs, cats, and small mammals to stimulate stomach and upper small intestinal movement to prevent esophageal reflux. It is also used in the treatment or prevention of vomiting in dogs and cats. It is also used in dogs and cats to induce milk letdown and to promote milk production. Vermifuge and Volapix is an anthelmintic drug for the treatment of mixed infection by nematodes and cestodes of the dogs and cats, such as Toxocara canis, Toxascaris leonin, Uncinara stenocephalia, Ancylostoma caninum, Echinococcus species, Taenia species, Dipylidium caninum. Happy Oatmeal Shed Control Shampoo gives a long-lasting soothing relief in controlling shedding or loss of hair of your pets. It contains oatmeal that hydrates and moisturizes your dog's skin for a healthier and manageable coat. Vitamin E is an antioxidant that protects and repairs the skin and generally prevents it from dryness. And guava extract has a natural antibacterial property to maintain healthier and germ-free skin that prevents your pet's excessive loss of hair. Happy Oatmeal Hair Regrowth Shampoo is enriched with oatmeal that hydrates and moisturizes your dog's skin. Aloe vera extract that prevents your pet's hair loss. It also soothes dog's skin to prevent itching. Andiroba oil has been used as an anti-inflammatory property that helps our pet's coat and skin, leaving them a softer and healthier manageable skin and coat. Papi Oatmeal Insect Control Shampoo gives a long-lasting relief in controlling external parasites such as ticks, mites, and fleas. It contains oatmeal that hydrates and moisturizes your dog's skin to promote a healthier and manageable coat, and fipronil that eliminates and kills the fleas and ticks that try to bite our pets that can be itchy and uncomfortable. It can also cause painful allergic reactions and transmit dangerous illnesses. Papi Mixidin is a combination of miconazole nitrate and chlorhexidine gluconate that helps provide relief against fungal infections such as ringworm and superficial skin infections caused by yeast and bacteria. It is the shampoo of choice for those suffering from mixed fungal and bacterial infection. and skin with wound and other skin damage. VetMate Pharma Corporation, a Filipino company engaged in the distribution of veterinary products, specializing in companion animals for grooming, supplements, and veterinary medicines. Founded in June 13, 2006, it started when Mr. Herman A. Panghulan, President and CEO, shaped up a cluster of former Beringer Mannheim associates to build a veterinary company. The company continues to expand to provide premium quality veterinary products. VetMate Pharma Corporation also offers a wide range of premium quality products for poultry, such as broilers, layers, and racing pigeons. And on October of 2020, we introduced our first agri product, Leafy Green Organic Foliar Fertilizer. multivitamins and minerals plus omega-3 fatty acid for support of your canine companion's heart health, promotes a silky coat, reduces itchy and flaky skin, and can help relieve allergies and joint pain. Papi MVP is specially formulated nutritional supplements fortified with vitamin D3 to promote your pet's general health, internal organ, function, and proper diet. Vitamin D3 is cholecalciferol, which maintains calcium balance necessary to bone growth and increase bone mineral density. Papi OB is a breakthrough herbal and mineral nutritional supplements specially formulated to enhance and promote animal health during the pregnancy period. Papi OB aims to supply that requirement using natural ingredients from malunggay and other mineral resources. Papi Bion Plus is indicated for the use in prevention and treatment of iron deficiency anemia due to infection, intestinal and external parasitism, iron depletion secondary to post-operative blood loss. Papi Plate Leaf contains a combination of multivitamins, minerals, and Euphorba hirta for the prevention and treatment of vitamin and mineral deficiencies. It is a supportive remedy of thrombocytopenia and anemia in pets. Nakalvit ZC is a combination of two mineral ascorbates or non-acidic vitamin with zinc. It improves immune function and increases the blood level of interferon and antibodies. It also helps in dog arthritis and other regenerative joint diseases. Papi Live Well is a natural food supplement for dogs and cats for a healthy liver, heart, and brain. It is a combination of silimarin or milk thistle to specifically protect liver against toxin. L-carnitine helps fat metabolism and docosahexaenoic acid or DHA, and omega-3 fatty acid for faster brain development and serve as an anti-inflammatory. Papi Live Well also helps increase appetite, regeneration of damaged liver cells, elimination of harmful toxins, enhances digestion and promotion of better growth. Renacure is a dietary supplement for use in dogs and cats that contains a combination of potassium citrate, docosahexaenoic acid, and Lumea balsamifera ingredients known to aid in the prevention of urinary stone formation. Uticare contains cranberry extract and D-mannose for the relief of symptoms of mild recurrence, lower urinary tract infections of dogs and cats. It also promotes urinary function with proper pH balance and helps support the bladder against any infection. Oritec. It contains a combination of gentamicin sulfate and dexamethasone valerate used for the treatment of inflammation and bacterial infections of the ear in dogs and cats. Gentamicin Wound Ointment. It contains 0.2% gentamicin sulfate, a broad-spectrum antibiotic used in disinfection of all types of wounds, such as cuts, bruises, burn, and surgical incise wounds. Topiderm contains 10% iodine solution, cotrimazine, and potent herb, such as guava leaf extract, citronella, eucalyptus extract, and aloe vera for disinfection of all types of wounds, such as cuts, bruises, burn and insect bites. It is also a good insect repellent for ectoparasite and other crawling and flying insects. Iodine wound spray contains 10% iodine solution, cotrimazine, and potent herbs such as guava leaf extract, citronella, eucalyptus, and aloe vera extract. It is used as disinfectant in all types of wounds such as cuts, bruise, burn, mange, and surgical wounds. Papi emetics is used in dogs, cats, and small mammals to stimulate stomach and upper small intestinal movement to prevent esophageal reflux. It is also used in the treatment or prevention of vomiting in dogs and cats. It is also used in dogs and cats to induce milk letdown and to promote milk production. Vermifuge and Volapets is an anthelmintic drug for the treatment of mixed infection by nematodes and cestodes of the dogs and cats, such as Toxocara canis, Toxascaris leonin, Uncinara stenocephalia, Ancylostoma caninum, Echinococcus species, Taenia species, Dipylidium caninum. Happy Oatmeal Shed Control Shampoo gives a long-lasting soothing relief in controlling shedding or loss of hair of your pets. It contains oatmeal that hydrates and moisturizes your dog's skin for a healthier and manageable coat. Vitamin E is an antioxidant that protects and repairs the skin and generally prevents it from dryness. And guava extract has a natural antibacterial property to maintain healthier and germ-free skin that prevents your pet's excessive loss of hair. Papi Oatmeal Hair Regrowth Shampoo is enriched with oatmeal that hydrates and moisturizes your dog's skin. Aloe vera extract that prevents your pet's hair loss. It also soothes dog's skin to prevent itching. Andiroba oil has been used as an anti-inflammatory property that helps our pet's coat and skin, leaving them a softer and healthier manageable skin and coat. Papi Oatmeal Insect Control Shampoo gives a long-lasting relief in controlling external parasites such as ticks, mites, and fleas. It contains oatmeal that hydrates and moisturizes your dog's skin to promote a healthier and manageable coat, and fipronil that eliminates and kills the fleas and ticks that try to bite our pets that can be itchy and uncomfortable. It can also cause painful allergic reactions and transmit dangerous illnesses. Papi Mixidin is a combination of miconazole nitrate and chlorhexidine gluconate that helps provide relief against fungal infections such as ringworm and superficial skin infections caused by yeast and bacteria. It is the shampoo of choice for those suffering from mixed fungal and bacterial infection and skin with wound and other skin damage. VetMate Pharma Corporation, a Filipino company engaged in the distribution of veterinary products, specializing in companion animals for grooming, supplements, and veterinary medicines. Founded in June 13, 2006, it started when Mr. Herman A. Panghulan, President and CEO, shaped up a cluster of former Beringer Mannheim associates to build a veterinary company. The company continues to expand to provide premium quality veterinary products. VetMate Pharma Corporation also offers a wide range of premium quality products for poultry, such as broilers, layers, and racing pigeons. And on October of 2020, we introduced our first agri-product, Leafy Green Organic Foliar Fertilizer. Multivits, multivitamins and minerals plus omega-3 fatty acid for support of your canine companion's heart health, promotes a silky coat, reduces itchy and flaky skin, and can help relieve allergies and joint pain. Papi MVP is specially formulated nutritional supplements fortified with vitamin D3 to promote your pet's general health, internal organ, function, and proper diet. Vitamin D3 is cholecalciferol, which maintains calcium balance necessary to bone growth and increase bone mineral density. Papi OB is a breakthrough herbal and mineral nutritional supplements specially formulated to enhance and promote animal health during the pregnancy period. Papi OB aims to supply that requirement using natural ingredients from malunggay and other mineral resources. Papi Bayan Plus is indicated for the use in prevention and treatment of iron deficiency anemia due to infection, intestinal and external parasitism, iron depletion secondary to post-operative blood loss. Papi Plate Leaf contains a combination of multivitamins, minerals, and Euphorbia hirta for the prevention and treatment of vitamin and mineral deficiencies. It is a supportive remedy of thrombocytopenia and anemia in pets. Nacalvit ZC is a combination of two mineral ascorbates or non-acidic vitamin with zinc. It improves immune function and increases the blood level of interferon and antibodies. It also helps in dog arthritis and other regenerative joint diseases. Papi Live Well is a natural food supplement for dogs and cats for a healthy liver, heart, and brain. It is a combination of silimarin or milk thistle to specifically protect liver against toxin. L-carnitine helps fat metabolism and docosahexaenoic acid or DHA, and omega-3 fatty acid for faster brain development and serve as an anti-inflammatory. Papi Live Well also helps increase appetite, regeneration of damaged liver cells, elimination of harmful toxins, enhances digestion and promotion of better growth. Renacure is a dietary supplement for use in dogs and cats that contains a combination of potassium citrate, docosahexaenoic acid, and Lumea balsamifera ingredients known to aid in the prevention of urinary stone formation. Uticare contains cranberry extract and D-mannose for the relief of symptoms of mild recurrence, lower urinary tract infections of dogs and cats. It also promotes urinary function with proper pH balance and helps support the bladder against any infection. Oritec. It contains a combination of gentamicin sulfate and dexamethasone valerate used for the treatment of inflammation and bacterial infections of the ear in dogs and cats. Gentamicin wound ointment. It contains 0.2% gentamicin sulfate, a broad-spectrum antibiotic used in disinfection of all types of wounds, such as cuts, bruises, burn, and surgical incise wounds. Topiderm contains 10% iodine solution, cotrimazine, and potent herb such as guava leaf extract, citronella, eucalyptus extract, and aloe vera for disinfection of all types of wounds, such as cuts, bruises, burn, and insect bites. It is also a good insect repellent for ectoparasite and other crawling and flying insects. Iozine wound spray contains 10% iodine solution, cotrimazine, and potent herbs such as guava leaf extract, citronella, eucalyptus, and aloe vera extract. It is used as disinfectant in all types of wounds such as cuts, bruise, burn, mange, and surgical wounds. Papi emetics is used in dogs, cats, and small mammals to stimulate stomach and upper small intestinal movement to prevent esophageal reflux. It is also used in the treatment or prevention of vomiting in dogs and cats. It is
Good afternoon. Good afternoon, everyone. So everyone already recharged. Yeah? And now, let's go to our fourth presenter, who will share a series of cases involving dogs and cats with otitis, successfully treated using a combination of chlorphenicol, terbinafine, and mometazone, commonly known as FTM. So this is a promising case, a common yet stubborn problem that will be addressed today with our case presentation. So for us to know our presenter, I will ask Doc Chris to introduce our presenter for today.
Dr. Ernesto R. Coloyan graduated last 1981 with a degree of Doctor of Veterinary Medicine at Gregorio Araneta University Foundation on what is now known as De La Salle Araneta University. Spent his first 34 years after graduation specializing in large animals in the Middle East. He was often called the camel vet and has done an extensive research on camel brucellosis and camel contagious ecthyma in Saudi Arabia. Doc Ernie, at 67, still going strong and kicking, is the proud owner of Kalbi Kita Vet Clinic, established in year 2015 at Santa Maria, Bulacan. He continuously learned and worked in improving his craft. His personal motto, Aral Pa More, is what makes him good at what he does. A proud father of a twin, Dr. Peterni, a resident doctor at St. Luke's Medical Center, and Polarni, a medical student from UP College of Medicine and about to graduate in 2025. Inshallah. Your large animal and companion vet practitioner, Dr. Ernesto Coloyan.
Good afternoon, ladies and gentlemen, fellow colleagues, veterinary practitioners, future diplomats. Hopefully, this is my topic. Actually, this case I got only curious when this drug or this otic medication was presented in Bulacan. When I asked the different practitioner what is their comment when they have used this product, FTM, I just abbreviate it with the three components, which is chlorphenicol, terbinafine, and mometasone. So I just called it FTM because for our presenters, we don't need to mention the real brand or brand name, okay? And even the manufacturer. So, my topic is about a case series of dogs and cats with otitis, specifically otitis externa, treated with this combination, okay? So, my personal motto is Aral Pamor, okay? So, this is my introduction. It was piloted last year, last September, up to November, where I got curious to try it under clinical setting. So that time, during the bare months, there is an increase in the prevalence of otitis infection among dogs and cats in our clinic. So what we did is do first recording, and then try to examine the ears using this otoscope, and then cleaning it. No, after cleaning it, we do the ear swabbing to perform ear cytology, what is inside the ear canal. So it was done on the very first day, remember, before the application of this medication. So, the first 5 group we mentioned is that we take the ear samples, ear swabbing, and then do the cytology. The cytological examination for the last 5 groups was performed on their 15th day because we want to segregate the first 5 cases and the last 5 cases to see the difference and what will be the general cytological picture of the cytology. So the application was done on the very first day. So the observation was recorded on the very first day, 15th day, and 30th day. So out of the 10 samples we have examined, 6 responded positively, 3 dogs and 3 cats, because all in all, we have 6 dogs and 4 cats, which was brought to our clinic for the trial medication. So after the treatment, there was no recurrence. After 30 days of treatment, and the remaining 4 samples which did not respond to the treatment, we tried giving them systemic antibiotic. That means they failed this medication which was given into the ears. So we used the drug which is called the coamoxiclav right after there's no response for these 4 animals. We did try it for only 7 days to see the response. So the bacterial isolates, right after the bacterial culture and isolation, we were able to isolate Staphylococcus aureus for the first case of a Shipu, which is called Mia, and then Klebsiella pneumonia for the 2 cases, Otto, and then this Otto and Clyde, and for the last animal, which is a cat, we were able to isolate Escherichia coli. So the objective of this study is to justify the actual and unbiased response rate of this drug for dogs and cats. So let's proceed with this diagram or the general picture of the canine ear. The main focal point of this medication, this FTM otic drug, involves the pinna, the middle portion of the pinna or the inside portion, and goes down to the ear canal, which considers the vertical and the horizontal ear canal up to the external portion of the tympanic membrane. So in this area, this organism lurks because they are the main commensal organism that flourishes during the cases of otitis externa. So aside from this Staphylococcus pseudointermedius, Malassezia pachydermatis, we have also Streptococci, E. coli, and Pseudomonas. So the same with this feline ear. They also thrive on this L portion of the anatomy of the feline ear. So auricle cartilage down to the horizontal, down to the vertical and the horizontal ear canal up to the side of this tympanic membrane. So my 10 cases, I just group it into this table to see what are the manifestation or the clinical characterization of the suspected otitis externa. So about the color, you could see the cardinal signs of inflammation. There's a pain, there is the redness, the swelling, and the heat. So it also occurs in dogs and cats, 6 dogs and 4 cats. You could see when the animal or these cases were presented to the clinic, they keep on scratching the ear, you know, pawing for the cases of cats. And when you smell the ear, you will smell the musty and offensive odor. Cheesy, specifically for cats. Parang kumakain ka ng, alam nyo na yun. So, what about the discharges? The discharges consist of a yellow, brown, and even to bloody color. So they ranges from brown, beige, dark brown, and even to the blackish color, which means a severe infection is occurring. So their body weight consists of 8 to 10 kilograms for 6 dogs, 3 to 6 kilograms for cats. Their ages ranges from 3 to 6 years, 1 to 5 years for cats. So for the dogs, 3 males and 3 females. For cats, 2 males and 2 females. Their appetite ranges from being normal to anorexia. Their action, when you see the animals, they keep on rubbing on the floor or even on the chairs. So, what are the breeds that I have encountered or included in this experiment? We have this Corgi, Beagle, Shih-Tzu, combination of Shih Tzu and Poodle. Then we have this Maltese, and also we have this Chow Chow. For the cats, we have this 2 Puspin and 2 Himalayan breed. So, table 1. What are the breeds that are prone to this otitis externa? First, we have these dogs who have a pendulous ear, you know, Dachshund, Basset Hound, this Cocker Spaniel, and even Beagle. And for cats, these are Himalayans, Devon Rex, and Sphinx. And also include those animals that love swimming, the retrievers, and those with hirsute ears. Hirsute means what? Those ears that have plenty of hair inside the vertical ear canal. So sometimes you will see why your groomer will pluck the ears out, because if you don't remove excess hair inside, they are prone to this otitis externa. And those with stenotic ear, this is usually seen in our clinic, the Sharpei and the Bulldogs. So, when you have otitis externa, these are the primary causes. So these autoimmune or immune-mediated diseases, the juvenile cellulitis. Or sometimes they appear in the muscles or even around the eyes. Then we have this conformation as we have shown in the table 1. We have discussed it. And then we have this endocrine disorder. Those animals or dogs suffering from this hypothyroidism are prone also to this otitis externa infection. Foreign bodies, usually they occur as a unilateral otitis externa. Sometimes you have to see plant materials inside the ear, the dirt, even small stones, impacted wax, and even dried medication such as neomycin and propylene glycol medication inside the ear. So usually they occur as a unilateral. But let me show you that my 10 clinical cases showed 9 having a bilateral otitis externa using otoscope. And then we have also these inflammatory polyps that originate from the linings of the tympanic cavity, the auditory canal. Then we have these hypersensitivities. As shown in the literature, the occurrence of this otitis externa usually coincide with atopy. Also this food hypersensitivity and contact dermatitis. So if your dogs are having this, naturally, it will also affect the ears. And then we have these keratinization disorders, like canine primary seborrhea and the Persian facial dermatitis. About neoplasia. If your dog is suffering from neoplasia, you will need to expect that your also dog is suffering from this otitis externa, adenomas, carcinomas, and even papillomas. And lastly, for the differential diagnosis, we have these parasites. Otodectes cyanotis. If you will observe, Otodectes cyanotis usually accounts for the 50% among cats, and only 10 to 20% for dogs. This Otodectes cyanotis, or what you call the ear mites. So we need to differentiate it, because the main point or the main target of this FTM is the secondary causes of this otitis externa, which is the bacterial otitis and the yeast otitis. So the topic about this FTM is the elimination of what you call the commensalistic interaction of this Malassezia pachydermatis, which is the yeast, and the Staphylococcus subintermedius, very specific, this chlorphenicol, and terbinafine and mometasone otic drop. So let's review some of the literature. According to the literature, FTM is for the resolution of this otitis externa infection, which is the inflammation of the anatomic structure of the pinnae, the middle portion down to the vertical ear canal up to the horizontal ear canal. So, the main bacterial cocci involved is Staphylococcus pseudointermedius. It is what you call the true canine commensal implicated with an isolation rate of 31 to 68% in dogs, in healthy dogs, 100% in puppies, but less prevalent in cats. About the Staphylococcus aureus, these are the main feline commensals identified in cat population. So this is the electron microscopy of Staphylococcus species. So when we deal with this organism, Staphylococcus has so many subspecies, and we are very specific of Staphylococcus aureus and Staphylococcus pseudointermedius. You see, this Staphylococcus pseudointermedius is the newly emerging methicillin-resistant staph being researched today. And we must be aware that this staph pseudointermedius can be contracted to human beings. Okay? So, these are gram-positive organisms, cocci rather. They are they grow in a colony which are paired, sometimes unilateral or sometimes in cluster shapes. You could see the magnification of only 0.1 to 1 micrometer. What about this Malassezia pachydermatis? It is a zoophilic and opportunistic yeast or fungi that causes the infection. For cats, they causes seborrheic dermatitis, even though they were commented as less prevalent in cats, but they causes this disease in cats. While cats are rarely infected with this yeast, it even causes ceruminous otitis externa infection. So, this is the electron microscopy of Malassezia species. So, they measured from 3 to 6.5 to 2.5 micrometer. This is what you will see under electron microscopy. But in our vet clinics, particularly if you have a higher magnification of microscope, you will see a bilobe yeast as if a peanut shape, or you will see just like a footprint in the snow. Okay? You will see around with our slide what it will look like. So, ears and skin with higher level of pH or alkalinity, they are prone to ear infection and even skin disease, this dermatitis. The normal pH of the dog is 6.1, but when you go down, it becomes acidic, you will have an acute otitis externa infection. Once it goes up, it becomes a chronic up to 7.2. They become alkalinic, so you have a chronic otitis externa. So, you need to correctly identify the microbial pathogen. That's why ear cytology is very important, because it is critical in the treatment decision and to promote antimicrobial stewardship. So, 9 years ago, there was a research in the US involving 200 plus animals suspected of this otitis externa. And they come up with the same 3 ingredients or this 3-in-1 combination, but they have resulted in a 72.5% efficacy rate. Now, after my presentation, you will see what will be the efficacy rate because I don't like to be a bias. Okay? So, the single dose administration, because you will need to apply it only once on the very first day. So, forget the rest of 29 days. This is the point of this medication. So, it eliminates the opportunities for client dosage administration error because I don't know whether in the US, the veterinarians will just instruct the owners or the pet owners to do the medication. But here, we, the veterinarian, will be the one to apply it. The owner will need to observe because of the amount of the medication plus the cost. It's very expensive. And you could observe in the US, most of the parents do medication stockpiling. Why? Because sometimes irritated silang magbigay ng mga otic drops, lalo na if their fur babies are not cooperative. So with this medication, which I have tried, will resolve this problem. So this is the product formulation. Each 1 ml tube contains 16.7 milligram of chlorphenicol and terbinafine with 2.2 memetosone 48. So the indications is this: acute canine otitis externa and acute exacerbation of recurrent otitis or those having a mixed infection. You could see with their literature, specifically Staphylococcus subintermedius and Malassezia pachydermatis. So, how does it apply? The route of administration. Per year, single treatment. Imagine 1 ml dose. After the first day of application, you need to observe only on the 28th to 30th days. You need to shake it for 5 seconds, and you need to hold the tube in an upright position because you need to break the seal using the spike of the cover. You invert the application nozzle in the affected external ear canal and squeeze the entire content. This is the diagram of how to apply it. Okay? So, the proper administration. There is a technique in cleaning the ears. You don't need to use this long cotton bud applicator that insert it. You will be inserting the dirt deep inside. So, they have recommended using the sodium chloride solution. Put at least 1 ml inside the ear, massage it, and then try to squeeze it. So all the debris will pop out using this tissue paper. And then you repeat it once or twice. That's the time you need to clean it with cotton bud. This is the proper way. So you have also to restrain the dog because when you apply this medication, naturally, if something is inserted into your ear, you'll keep on head shaking and you will be irritated and sometimes you will be beaten. So let's go to the pharmacodynamics. This combination is what you call 3-in-1. Antibiotic, aflorphenicol, Remember, this is a bacteriostatic antibiotic. It inhibits protein synthesis because it binds and acts on the 50S ribosomal subunit of the bacteria itself. The spectrum of activity is gram-positive and gram-negative, specifically Staphylococcus pseudointermedius. And then we have this antimycotic, terbinafine hydrochloride. It's an allylamine that pronounced with fungicidal activity. It inhibits ergosterol synthesis, an essential component of the yeast membrane of this Malassezia pachydermatis. So, this antimycotic usually coats the organism or this yeast, which eliminates them. About this corticosteroid, a newly established or newly promoted corticosteroid with anti-inflammatory and antipruritic properties. So, 3-in-1. So, you don't need to prescribe this drug for irritation, this drug for inflammation, this drug for malassezia, this drug. So, this medication is what you call a special one. Okay. So, what's the purpose of cleaning the ears? This will hasten what you call the transcutaneous absorption, because your medication will not be affected if the area wherein you will apply the medication won't be or won't achieve a greater efficacy. So you need to clean it. So for the otic examination of number 2, we need to see first if there is an inflammatory condition inside the ear of what we have cleaned, to see the effect or the real effect of this medication. So what are the possible side effects when you apply this medication? These are some of the possible side effects which I have also observed in the 10 experimental animals. So right up after the application, sometimes you will see the vocalization for dogs and cats, but I have not observed it in cats. Naturally, when you put something inside the ear, it starts to head shake. Sometimes there is pain. According to pharmacovigilance report in Europe, they have observed this, which I have also observed during the application of this medication. We have this ataxia, head tilt, nystagmus or the involuntary eye movement, erythema. You'll see the reddening in the middle of the pinna, middle portion of the pinna. Sometimes the dog will vomit. Sometimes also they become lazy and loss of appetite, but those are only temporary. In a latest research class 2023, the application of this medication have shown what you call this Horner's or idiopathic syndrome. It involves or affects the eyeball itself or the vision of the animals. So after the application, you'll see the ptosis. So the upper eyelid seems to droop down. And you will observe that the pupil of both eyes will have a different size. As if the eye is sunken or pushed inside, and you will see a hyperemia in the middle portion of the ear. So these are the methodology which I have performed in the clinic. So we record the owner's complaint. You've got to be curious and to be what you call the makulit. Because sometimes the owners will not tell you the true story. Okay? Then you need to examine the ears physically. As I have mentioned, you need to observe those primary causes of otitis externa. So that comes the first otic examination. After otic examination, that's the time you need to do ear swabbing. Cytology and staining under microscope will follow soon. So after swabbing, you need to clean it properly using sodium chloride solution only. That is recommended by the company. And then you've got to examine for inflammation as a second otic examination. After that, you need to apply this FTM on day 1 and followed by the post-treatment observation on day 15 and day 30. So on day 15, you need to do also otic examination. What had transpired, what happened inside the ear. Sometimes these are my observation. The 3 dogs and 1 cat, the 2 dogs on their 15th day and 1 cat on their 15th day, they showed abscessation. That's what made myself curious. What happened? So we need to send it for bacterial culture for isolation. And during the final treatment evaluation, you need also to examine the ear again for the 4th time. So this is the raw table we have collected. You could see the color in each line. Those who have a successful FTM treatment and those that failed. So in the day 1, you have seen this otic examination. Ear cytology, ear cleaning, otic examination, and then FTM application. For the first case, we have this Sky. Sky is a beagle. The first day of cytology revealed plenty of fungi, cocci organism, and PMNS. What is PMNS? These are polymorphonuclear cells, which are the leukocytes present during the ear infection. And then we have this Smokey, the cat. You observe D as in dog, C for cat. Okay? For Smokey, choknut, they have all these cocci which are prevalent with PMNS, polymorphonuclear cells. And what is TNTC? Too numerous to count. For Mia and Clyde, for Cholo, because the last 6, I have collected the abscess samples plus the ear cytology. These are the information that I have collected. For Mia, the dog, this is a Shih Tzu, Clyde, which is a Chow Chow. They have presence of RBC and WBCs. Abscesses collected were sent to the laboratory for bacterial isolation and culture. So both Mia and Clyde responded positively. So Cholo and Gumi. Cholo is a Shih Tzu and Gumi is a Maltese. On their 15th day, where I did the ear cytology, these are my observations. Plenty of cocci, epithelial cells, which are TNTC, and you will see the category down. How did I quoted or write +4 or +1? It has the number of +1, only 1.5 organism per field. So if 6, 81 to 100 organism per microscopic field. So if you could count it, TNTC, too numerous to count, above 100 organism per microscopic field. So these are the summary of those animals that responded to the treatment. On day 1, we have this Sky, which is the beagle. The presence of cocci bacteria represents Staphylococcus intermedius, plus the inflammatory cells, plus this PMNS. So it indicated otitis externa infection for Sky, the very first animal we have treated, followed by Cholo and Gumi, which belongs to the second group, which I did the, what you call the ear cytology. And then, for the 3 cats that have recovered, you could see that too numerous to count PMNS, which indicated the presence of Staphylococcus aureus, because according to the literature, the main Staphylococcus infecting the cat population are Staph aureus, not Staph intermedius, which is common in dogs. So, for Sky, the presence of yeast or Malassezia, there's an overgrowth, which I will show you later on in the slides. While chokenut, the first cat which was included, or the first cat which we have examined, showed a few prevalence of yeast, which only shows that lesser occurrence of yeast in cat population. So the absence of pachydermattis in Cholo and Gumi 15 days after showed that carbinapine, or one of the components of this FTM, eradicated them, because there's no more observation of this yeast on their 15th day. All 6 animals have clean bilateral ears on day 15. Okay? So, all 6 have clean bilateral ears on day 30, nearly after 1 month, which means 3 dogs and 3 cats were successfully treated by this FTM, coupled with the disappearance of their these clinical otitis manifestations. And these are the 4 animals, 3 dogs and 1 cat who have a failed treatment. On day 1, the presence of overgrown yeast infection with cocci and bacilli plus the indication of this otic infection showed Klebsiella pneumonia organism. This is Otto, the number 2 animals showing this malassezia of the ear. On day 15, Mia, the Shipu, the number 5 animal, with the presence of WBC and RBC in their cytological examination, we were able to isolate Staphylococcus aureus. About the Clyde, Clyde is number 3, rather number 7, the abundance of bacilli with PMNS, we have isolated Klebsiella pneumonia. So 2 dogs have exhibited Klebsiella pneumonia in bacterial isolation. For the last animal, tax, which is a puspin, a combination of cocci and bacilli. So a mixed infection showed that E. coli was present in their abscess. So on day 30, all 4 animals, this Otto, Mia, Clyde, and Tax, 3 dogs and 1 cat, were subjected to systemic treatment. Because naturally, the owner will complain, Dok, ba't niluga? So when they were presented, on their 15th day, we need to clean it. So after cleaning, we did not apply any medication. So we have told the parents to leave it. Let the medication do their work. So on the 30th day, it's the reverse situation. Those animals having an ear abscess on the left ear appeared on the right ear. So what we did is that we tried to recommend a medication, a systemic medication, which is already outside this experiment. Because nakakahiya nga naman sa, niluga yung kabila, ngayon magaling na. Ito naman, niluga yung kanan. So, we recommended co-amoxiclav for these 4 animals, 3 dogs and 1 cat. And you see what happened? 2 dogs responded positively using co-amoxiclav for 10 days medication. Whereas this Clyde have failed a treatment of this co-amoxiclav. After that, we recommended cephalexin, but also failed. You know what? After interrogating the owner, why it did not respond? According to the owner, his dog, Clyde, had already a previous medication, so it appears that this medication that we are using is already resistant. Whereas for the 2 dogs, 2 dogs and 1 cat, after only 30 days, for 10 days treatment of co-amoxiclav, they all responded positively. So, this is the ear examination results. On day 1, this is Kai, the beagle. You could see the erythematous manifestation of the middle portion of the pinna on day 1. There's severe inflammation, and you will also observe some nodular appearance. On the concave. 30 days after, this is now the result. A clean, clear pina with the absence of inflammation. You could see here what you call the coloration, the inflammation. About choke nut, the cat which showed a few presence of Malassezia pachydermatis. This is the appearance on day 1. You could see the inflamed middle portion of the ear canal. You could see the waxy exudates right after the flushing of the sodium chloride. That is on day 1. On day 30, you could see how clear it is, as if no more blood. So, one client will show, how about the inner portion? So we tried to use this endoscope using a smaller probe which is inserted into the vertical ear canal up to the horizontal ear canal. This is what we have observed, the presence of wax plug with the tympanic membrane. You could see that the inflamed portion on the left side, which showed the otitis externa infection. For the normal tympanic membrane with a minimal exudate and inflammation. So this is the actual picture of the Malassezia pachydermatis. For Maltese, this gummy and choke nut, you could see the gram-positive cocci, Staphylococcus pseudo-intermedius for gummy, and for choke nut, Staphylococcus aureus. So this is 3-in-1. This is the actual ear cytology on the right side of the slide, and the abscess of Mia was bacterially cultured using this mannitol salt agar. Under gram staining, you will see the purple or dark blue organism. You will, yes. And also in the left portion of the slide, Staphylococcus aureus. For Otto and Clyde, this is the picture. You'd see the Klebsiella pneumoniae which is present for Otto and Clyde. The abscess was cultured in the McConkey agar and showed a pink or red color gram stain negative organism. You will see it seems as a blue color for Klebsiella pneumoniae. Deep in the deep quick staining, you will see that the organism, all the organism, whether it is fungi, will have a dark blue color. So also for E. coli, for tax, they were cultured in the Eosin metal blue. You could see the gram negative, this red and pink color. So table 4, these are the animals, the four dogs which were subjected to bacterial culture and isolation using a mannitol salt agar for Mia and McConkey agar for Otto and EMB eosinmethyl blue for the cat tax. You could see the morphology, the same size for the 2 dogs. And then for the last 2 dogs, for Mia, you could see our basis is the green-yellow colonies for Staphylococcus aureus. When a Staphylococcus should intermediate, you have a colorless colony. You need to culture it in the blood agar, not using this mannitol salt agar. So what about this biochemical test? Biochemical test shows that both dogs are catalase and coagulase positive. And then we have this methyl red and Simon citrate positive and negative for Staphylococcus pseudointermedius. So this is the basis wherein you could differentiate Staph aureus and pseudointermedius. The clumping, the pigment factor, plus the acetoin production, which show that Staph aureus, if you suspect Staph aureus, they are resistant to polymyxin B antibiotic and sensitive for Staph pseudointermedius. And how could you differentiate whether it's an E. coli or Klebsiella pneumonia? This is the basis according to L microbiologists, and this is also what we have observed. So, summary. So, the history of suspected otitis externa infected dogs, 6 dogs and cats, they are strictly recorded. They occurred in different days of September to November, okay, last year. Examined, differential diagnoses were considered, and ear swabbing for ear cytology was done. Slide stain and microscopically examined. So, 4 organisms were isolated: Staph aureus, Malassezia, Klebsiella, and E. coli. So, we have a 60% response rate. So, 6 out of 10 responded positively. Those that did not respond were treated with systemic antimicrobial. So, those with confirmed otitis externa were resolved by this drug, FTM. No relapse was recorded, and those that did not have to receive this coamoxiclav. So Clyde was prescribed with this cephalosporin, but with the latest news, it responded with only with 1 drug. So drug sensitivity is still recommended. So a combination of clinical manifestation plus the cytological findings, they have to be combined so that you will arrive with otitis externa infection. So you need to also remind the owners, if you weren't able to diagnose what is the infection of his dog, whether otitis externa or media or intermedia. That's why we need to examine otoscopically, cytologically, and treat with this drug. So, single dose application makes the treatment less stressful because the owner will just watch it and wait for the result for 30 days. So you need also to observe the animals at least 3 times because according to the literature, forget it. Come back after 30 days. So we need a random sampling for this treatment medication. As stated by the manufacturer, reapplication every 2 weeks for 3 treatments has been tolerated by their experimental animals, according to the manufacturer. So that means 1.5 months. So you need to apply it every 15 days. But we have to follow the program for this drug. Give it once, observe 15 days, 30 days, and that's it. Those that respond, you need to prescribe a systemic antibiotic.
Yes, thank you so much, Doc Ernie.
Yes.
Yeah.
Thank you, thank you.
This is so timely, Doc, and otitis actually is one of the most common problem nowadays in our practices. So thank you for the insights. We do have many questions here. And from Doc Eugene Gomo, according to your introduction, there was an increase in otitis cases observed during September to December 2024. So is there any environmental or seasonal factor for the uptake of these cases?
Oh, yes. Pagpasok ng mga bear months, taglamig na yan. So, diyan take yung bacteria tsaka yung malassezia. You will observe those animals with fungal infection, they love to stay in cold places, which causes them to proliferate right away. So this is usually observed during the cold months or cold season.
Okay. For practicality, Doc, you use commercial product. You mix single, if we mix single F, single T, single M, FTM together to make eardrop, can we use it? And one thing, if we use also oral fluorophenical, oral terbinafine, and oral mometazone together instead of eardrops, is it also effective instead of eardrops?
I think we need to be practical. Why not use 3-in-1 rather than individually putting a stress to your animal or giving it orally or systemically whatsoever? So that's the practical point.
Okay, but the question is if it's
It is possible.
possible.
It is possible.
Okay. And as a summary, is FTM treatment effective in treating the 3 otitis, external, media, and internal?
No, it's very specific. Otitis externa. Because usually when you go to otitis media, there is already the damage of this tympanic membrane, which involves another modalities or procedure to treat it. So very specific otitis externa. You will see why I did try it off the label in cats. So I got curious only and it responded positively.
Okay, noted, Doc. Question from the participants via Zoom. Hi, Doc. Since you've mentioned MRS, can we use a combination of doxycycline for Staphylococcus and carbinapine for Klebsiella?
For Klebsiella, you could try another medication because when I used this co-amoxiclav, they responded systemically, not otically.
All right. Any questions from the floor? Yeah. Question from Doc Green.
Hi, Doc. Thanks
Yes.
for your presentation. So, yung question ko kasi, actually medyo nasagot mo na. But ito na lang, how do you tell your clients regarding prescribing that FTM to cats, especially if they see the specific products that nakalagay na yung specific siya indication for dogs? How do you tell your clients regarding that? Especially nowadays, one click lang malalaman na nila at maraming mga praning na clients. So how do you tell it?
First of all, you must be true to your client. This is specifically indicated for dogs. We could try it to your cats, but expect what will happen. Hopefully, it will be okay. So that's the point. Because we need also to show them the literature that it is indicated for cats, though it is not written in the literature. It shows only the picture of the dog. Okay? That's it. So we need to clarify it to the owner. And one of the drawback with this otic drop, it's very expensive. So you need to be careful in applying it. So we, the veterinarians, will be the one applying it, not the owner, or else they will waste their money.
You mentioned that it's expensive, Doc. Can we ask how much?
Usually in a normal clinic, they sell per tube of 1 ml for 1, 2 and up per ear.
Per ear, 1, 2, 2, 4.
So in my cases, I have 9 dogs, and 9 animals suffering from bilateral otitis externa. Only one, which is Clyde, that did not respond to FTM, plus did not respond to 2 systemic antibiotic.
Okay. Last question, Doc. In your summary, there are no relapse. You mentioned
None
there are no
so
relapse.
far.
So what are your advices na lang to clients after the treatment?
Just observe, because this medication is new to the market in the Philippines.
Okay. How about the cleaning, Doc? Do you mention that you need to clean these ears how often, etc., etc.?
So, we need to clean the ears. Me, myself, the normal cleaning of the ear, if you're applying an otic drops, at least every 3 or 4 days. But according to the literature, there's no need to clean. You need to apply it, you need to clean it in the first day, apply it, forget the rest of the day. Wow. So wait for 30 days. And these are the result. 6 responded positively out of 10. Those that did not respond, usually kapag niluga na yan, on the 15th day, mag-prescribe ka na ng antibiotic. Kundi lalala pa yan, magiging chronic ang otitis externa. Yes, Doc?
Patients, head tilting po,
Yes. Temporary.
Temporary lang. So, say for example, hindi ito temporary. Siyempre, meron ng involvement of the CNS, yung neurological, tama po ba?
You need to examine further.
Further. And then, chine-check nyo rin po yung kung meron tayong, what do you call that, yung sideways,
Yes.
nystagmus, yes.
Nystagmus, yes. I have observed it.
Okay, sige, Doc. Ano po ang contraindication ng inyong ginagamit na gamot na ito? Meron po ba?
Usually, maybe you are applying to the ear. There must be a connection between the ears and the eyes because of the proximity of the application.
Okay. No, Doc. I mean, for example, otitis externa yung
Yes.
Meron bang contraindication dun sa medication? Halimbawa, ano yung condition na bawal siyang i-apply?
Oh, yes.
Ano po
Some of the contraindications for this medication is if you have a punctured tympanic membrane.
Bawal po ba to sa matanda? Sa mga old dogs?
None so far.
None so far. Okay.
Because
Kasi
according to the age range of the 10 animals, they ranges from up to 6 years old.
Okay, Doc. Sige, Doc.
Yes, that's the wrap up. So I need to stick with the time, and we need to move forward to our next presenter now. For those who have questions, Dr. Ernie, thank you. Send our questions via email. All right, our 5th presenter is a compassionate veterinarian focusing his career in small animal practice. He is a proud graduate of the University of Southern Mindanao in Cabacan, North Cotabato, where he completed and was conferred with the degree of Doctor of Veterinary Medicine last April 2015. He also took and passed the veterinarian licensure examination in September of the same year. Right after passing the exam, he was immediately hired as a junior veterinarian at Island Veterinary Clinic in Davao City, where he grew to love small animal practice and mastered his skills and worked as a veterinarian, served and stayed there for 3 years, until he decided to return to his hometown in Digos City, where he ultimately established his own facility, Apo Pet Veterinary Clinic, last September of 2018, which he manages until today. His goal is to provide optimal veterinary services to his clients and patients in Digos City and nearby municipalities, and to continue with his advocacy and spreading enlightenment on responsible pet ownership in his area, He is a member of Philippine Veterinary Medical Association, and he is interested in the field of canine and feline medicine, internal medicine, surgery, like soft tissue and orthopedics, and diagnostics imaging. In the near future, he hopes to pursue higher degrees related to these specialties, to expand his career and satisfy his never-ending thirst for knowledge and expertise. He will take us through a compelling case report on combined doxycycline and ceftriaxone therapy in the management of leptospirosis. Timely kasi tagulan na ngayon, especially relevant to tropical veterinary medicine. Please welcome Dr. Yol Briner I. Tante.
Thank you to my mentor. Before anything else, I would like to grab this opportunity to express my heartfelt gratitude and thanks for PCCFP. So, we all know that we came from the South, and then, as far as I know, there are only four vets, including us, Doc Ading, Doc Edgar, that represents PCCFP in Mindanao. In addition, Doc Dexter, my former boss, and also Doc Joel. In-express ko lang po kasi maliit talaga yung numbers ng PCCFP doon sa amin. As far as I know, 4 lang kami. So, rest assured, PCCFP will be represented there in our area. So, yun lang po. So, for my... Okay, so tonight's general objective is to present today's general objective is to present case report to the Specialty Board of Philippine Canine and Feline Practitioners, and also to veterinarians present here on the floor at the same time on the Zoom. So specific objectives of this report is to give an introduction of the case, present a detailed clinical history and physical examination of the patient, show diagnostic tests used and corresponding results of the test, present the treatment and management done to the patient, discuss the results of the case, and present the conclusion and recommendation of the case report. So, matanong lang po, sino po dito ang gumagamit ng ceftriaxone? Especially sa admitted patients na may leptospirosis. Sino po? Doc Randy? Yeah. So as I can see it, hindi po siya common for now. Dito sa atin. Dito po sa floor. I don't know with the po. So, yun po. My title is about combined doxycycline and ceftriaxone therapy in management of leptospirosis, a case report. This is related to a 24-kilogram American Bully. So, leptospirosis is a worldwide sporadic zoonotic disease which causes significant morbidity and mortality in animals and humans alike. So, lahat naman sa atin dito, kilala talaga yung lepto. Kahit sa tao, common nga. So, alam niyo ba na it is recognized as the most widespread zoonosis and it's most prevalent in developing tropical and subtropical countries, especially in most areas in Asia and South America. Swak na swak ang Pilipinas. So, it is caused by a bacterium of genus Leptospira, gram-negative, which are thin, highly motile filamentous spirochetes with hook-shaped ends. Canine leptospirosis is caused by parasitic species of Leptospira interrogans sensulato, but the two serogroups, Leptospira canicula and Leptospira ectohemorrhagiae, are the most common. In addition, Gripo typhosa and Pomona are also available. Sino po ang nagbibigay ng L4 dito na vaccine? Recombitec po yan. Tama ba ako? Marami po. Yes. Yun lang alam ko eh. And then, kasama na po siya sa ibang vaccine po natin. So, kadalasan po, yung dalawa po, canicula at saka ectohemorrhagiae. So leptospirosis is usually transmitted directly when hosts come in close contact with the urine shed by the infected animals. So most of the time, sa cats, abrasions po, skin cuts, mouth, eyes, and nose, or any mucosal surface po. So for clinical manifestations, fever, shivering, vomiting, inappetence, dehydration, generalized weakness, and lethargy can be seen in early course of the illness. So common po, and hindi siya specific. However, as the disease progresses, the dog may exhibit signs of icterus, hemorrhage, anemia, and eventually, if left untreated, acute kidney injury or hepatic failure ensues. Diagnosis of leptospirosis may be difficult in early stage of the disease kasi nga, non-specific siya. So, and it's done by taking thorough clinical history, physical examination, and laboratory findings. Confirmatory testing like microscopic agglutination tests, ELISA, lateral flow, and PCR are the tests can be used to diagnose, especially yung PCR po. To ensure prompt diagnosis at the point of care, rapid canine leptospirosis test was recently developed and it's now widely used. The optimal treatment of leptospirosis is unknown and remains a major clinical dilemma, for which limited data from clinical studies exist. Main antibiotics currently used to treat leptospirosis include penicillin, ceftriaxone, doxycycline, oxytetracycline, and azithromycin. So for doxycycline, it can be used for both prophylaxis and mild disease. Ampicillin for mild disease, penicillin G and ampicillin can be considered for severe disease. For more serious cases, penicillin G and ceftriaxone were equally efficient. It is important to evaluate alternatives to penicillin G because its use has potentially drawbacks like antibiotic resistance, allergic reaction, and JHR or Jarry-Hexheimer reaction, common po to sa humans. Antibiotic therapy with penicillin or doxycycline had been the antimicrobials widely used in the treatment of dogs, while ceftriaxone presents good antibacterial sensitivity and has been recommended to replace penicillin in human leptospirosis. Although not widely studied in canine leptospirosis po, but a study by Mayoto et al. Demonstrated that ceftriaxone was able to effectively interrupt shedding of leptospires. Despite the success of treatment, the use of ceftriaxone in canine leptospirosis needs to be further investigated. This study presents a case of leptospirosis successfully managed with combined doxycycline and ceftriaxone. So, the case involved a 4-year-old intact male, 24-kilogram American Bully, which presented with a 3-day history of oliguria, hematuria, fever, anorexia, vomiting, weight loss, and lethargy po. The dog's vaccination and preventives was not up to date as per the owner during history taking. The dog was not caged and roams around the owner's premises freely. The owner also reported that the dog's food and water were not regularly changed and refilled only when containers are empty. They added that rats have been seen around their vicinity. For physical examination, day 1, vital signs were taken which revealed a rectal temperature of 39.9 degrees Celsius, a respiratory rate of 32 cycles per minute, and a heart rate of 109 beats per minute. On clinical examination, the dog was dehydrated with 8% dehydration, with poor skin turgor, and dry pink oral mucous membranes, with less than 2 seconds capillary refill time. Conjunctival mucous membranes were also anicteric. The dog had a thin body condition of 3/9, and upon palpation, the abdomen was slightly distended. Blood sample was drawn and collected in the for CBC and serology and also antibody testing. Hematology results shows low hemoglobin, leukopenia with lymphocytic predominance, and thrombocytopenia and anemia. So, differential diagnosis may include tick-borne diseases. Dito pa lang sa CBC, leptospirosis, pwede po, and then immune-mediated hemolytic anemia. Serology revealed high serum creatinine, elevated ALT, hyperkalemia, and hyperphosphatemia. Rapid antibody testing shows positive for leptospirosis and negative for Anaplasma, Ehrlichia, Babesia gibsoni, and Babesia canis. So, wala po kaming PCR. So, sino po dito ang gumagamit ng PCR? Ang meron po. Dalawa. So, best po talaga yung PCR po, and hopefully maka-acquire tayo niyan. So, for now, ito po muna ang ginagamit namin. So, X-ray on the thoracic cage shows no pulmonary lesions. Kasi po, if you have severe case of leptospirosis, meron po tayong tendency magkaroon ng ARDS or ARD, acute respiratory distress syndrome. Did you have any cases before na positive po sa leptospirosis na mayroong upper respiratory symptoms? Wala pa. So for those are present in severe cases po. Also we take a ultrasound on the abdomen, especially to the left kidney. Hindi po klaro, but there is increased cortical echogenicity and pyelectasia or retention of urine in the renal pelvis. For the treatment, intravenous fluid therapy was started with normal saline at 6 ml per kg body weight per hour. Intravenous ceftriaxone was started at 20 mg per kg body weight every 12 hours for 7 days. Oral doxycycline at 7.5 mg per kg body weight was also started on the 3rd day of admission po. Adjunct therapy with intravenous sodium bicarbonate at 2 milliequivalent body weight given within 6 hours as an initial dose. Along with the above therapy, antiemetics was also given to halt nausea and vomiting, like metoclopramide. Ammonium ferrous citrate, thiamine, HCl, nilagay ko na lang po yung 1 drop per body weight orally once a day for 5 days. Sorbitol, arginine, ornithine, citrulline plus betaine, also given a 3 ml injection through subcutaneous route, and oxygen supplementation. Supposedly po, we suggest to the client to perform BT since there's financial constraints. So every time we perform any procedure, we need to ask clients' consent for them to know, at the same time for them to ask if how much. So since wala po tayong BT, we manage na lang po kung ano po meron sa atin. Yes, that is my patient on day one. Day 1, as you can see, weak, reluctant to move and stand. Nakahiga lang po yan. Tapos, nagtataka kami kung mangangagat ba. So, on day 0, there were no significant improvement. Day 0, there were no significant improvement in the first 1 to 2 days of admission. But on day 3, hydration status was improved and the patient was, hindi na po siya nagsusuka, void of vomiting. And on day 4 of treatment, the patient is already febrile, increase in appetite. And on day 5 of treatment, no hematuria, urine output is already on normal limits. Repeat labs were done on 7th day of treatment, and hematology results shows again low hemoglobin, leukopenia with lymphocytic predominance, thrombocytopenia, and anemia. Serology shows increased serum creatinine, elevated ALT, hyperkalemia, and hyperphosphatemia. This video shows my patient on day 7 of treatment. On this day po, dinischarge na namin siya since kumakain na po siya and bright and active na po. Provided with home medications of doxycycline at 7.5 mg per kg twice a day for 10 days. Libutin supplement, 12 ml orally once a day daily, and prescription diet, especially for kidney prescription diets and liver prescription diets. Okay. 10 days after, during follow-up, we did, again, hematology, serology, and antibody testing. So the results were normal WBC count, normal hemoglobin, normal ALT, and negative for leptospira antibody test po. For summary, hematology and serology. On day 0, leukopenia with lymphocytic predominance are noted. Anemia, thrombocytopenia are also present po. Increased creatinine levels and increased ALT, hyperkalemia, and hyperphosphatemia. So what we did, since meron siyang hyperkalemia at hyperphosphatemia, we managed to give sodium bicarbonate. So who here used sodium bicarbonate po? Ano po, for hyperphosphatemia po daw? Yes. IV, yes po. Sino po ditong gumagamit ng IV? Si Doc. Alam nyo ba na ang katawan po natin nagpo-produce din po ng bicarbonate? So, in fact, bicarbonates are 85% of bicarbonates are produced in the kidneys. So, since po sira po yung kidney ng patient natin, so might as well we give sodium bicarbonate. This is my own preference po. And then, on day 17, upon follow-up, normal WBC, normal hemoglobin levels, normal ALT, and negative for leptospira antibody test. So as you can see on follow-up po, bumaba po yung, although hindi pa siya normal, at least malapit na po siya. Yung potassium levels niya at phosphorus. Yung sodium bicarbonate po, binigay ko lang po during admission days po. Nasa 7 days po yun. So, common hematologic results in canine leptospirosis include leukocytosis, thrombocytopenia. However, leukopenia may be common during the acute leptospiremic phase of the disease. Mild to moderate anemia may be seen due to hemolysis, commonly secondary to blood loss, and may also be due to chronic inflammation. Sino po ang gumagamit ng CRP? For inflammation po. Okay. Before. Yes. Yun nga. So, in addition, other presentation may include renal insufficiency, usually is present in initial examination as evidenced by increase in serum creatinine. Electrolyte abnormalities such as hyperphosphatemia and hyperkalemia may be seen on renal failure. Leptospirosis should be considered in patient with acute kidney injury. Yun po yun. So, AKI is associated naman po with increased serum creatinine and phosphate concentration. Kung may SDMA, mas maganda po. Sino pong gumagamit ng SDMA? Yun. Hepatic injury may manifest as elevations of ALT and AST. So, for the test po, have you heard microscopic agglutination test? Okay. And ELISA, PCR, and lateral flow. MAT, or microscopic agglutination test, remains the standard reference test in acute and convalescent stages of the disease. But also, MAT titer lacks specificity. Yun yung problema sa kanya. And single positive result is not recommended as diagnostic test in the early phase of the disease. And it's very difficult to perform. I don't know, here in the Philippines, are there any facility utilizes microscopic agglutination test? Meron po. Kasi po, ang problema sa kanya, live po na leptospirosis yung hinahandle. So, medyo delikado tayo. It needs laboratory setup po talaga. Next, ELISA has been considered a reliable screening test to detect IgM and IgG antibodies in the early stage of infection, but it requires expertise and specific laboratory facilities and may not be commercially available on practicing veterinarians. Rapid detection of canine IgM antibodies using lateral flow assays was developed as a screening tool for leptospirosis and is now widely used. But PCR is considered as gold standard, less expensive than I was pertaining to MAT. So less expensive and can identify the infection in early course of the disease. And also not affected with recent vaccinations, and unlike MAT, and ideal for clinic setup. These tests have not replaced MAT for confirmation of diagnosis, but offers an advantage due to it being rapid, convenient, and user-friendly. And it also provides diagnostic indication before MAT results are available. Kung gusto nyo na mas specific po, MAT po. Pero sa atin, clinic setup, best po PCR. For the sake of discussion, a brief review of mechanism of action of ceftriaxone. So, a definition of ceftriaxone. Ceftriaxone is a third-generation cephalosporins, in which that generation has gram-negative and gram-positive efficacy, and it is derived from fungus cephalosporium. So, its mechanism of action utilizes, anong tawag dito? Beta-lactam ring. So, that beta-lactam ring binds to the PBP or penicillin binding protein, which inhibits the cross-linking of peptidoglycan, which is crucial component for bacterial cell wall. So, if walang bacterial cell wall, it will lead to cell death po. So, a little bit of pharmacokinetics. Absorption of ceftriaxone demonstrates effective if given IM or IV administration. It can distribute and can cross blood-brain barrier, placenta, synovial fluid, aqueous humor, and excellent pulmonary penetrators. That's why, if meron po tayong severe leptospirosis na may acute respiratory distress syndrome, I can consider ceftriaxone. Then metabolism, mixed renal and biliary excretion for ceftriaxone. So, ito lang sa third generation lang, especially sa ceftriaxone, has mixed renal and biliary excretion for excretion. Most of them are renally excreted. May percent pa nga yan, nasa around 60% po yung na excrete through biliary and 30% lang po sa renal excretion. So for doxycycline, doxycycline is a water-soluble broad-spectrum tetracycline antibiotic derived from Streptomyces species. So, college days pa to binds to the 30S ribosomal subunits and blocking the binding of amino acid tRNA to to the mRNA inhibiting bacterial protein synthesis. This process halts the translation of the growing polypeptide chain, yan po, impeding the production of essential proteins and eventually killing the bacteria. Pharmacokinetics. Doxycycline is almost completely absorbed following oral administration in small bowel and is detectable in the blood within 15 to 30 minutes after administration. Distribution. Doxycycline is readily transported across cell membranes, resulting to widespread distribution in the body tissues, and fluids. It localizes in the bone, marrow, liver, and spleen, crosses the placenta, and excreted in breast milk. For metabolism, excretion of doxycycline occurs primarily by the gastrointestinal tract. So, yun lang po. If ang patient ko po kasi, during first 3 days, nagsusuka. And as we all know, doxycycline, pag binigay nyo siya orally, can trigger vomiting. So, nabigay ko siya on the 3rd day na po. For discussion, ceftriaxone is equally effective as penicillin in the treatment of leptospirosis in humans. But, however, it's not widely studied in treatment of dogs. Ceftriaxone showed excellent activity against leptospirosis at a dose of 15 to 50 mg per kg IM or IV every 12 hours, together with doxycycline at 5 to 10 mg per kg orally BID. So, ceftriaxone as bacterial problem. Kasi po, yung excretion niya sa GI tract lang. So, baka magtanong kayo, Doc, baka may drug interaction yan kasi, ano po doxycycline is bacteriostatic, tapos ceftriaxone, nasabay siya sa bactericidal. Yeah, mayroon po talaga. Pero as I've read the literatures, hindi po siya considered as main or baga severe drug interaction. Mild to moderate lang po. At during the treatment course of my patient, the only time na nagkasabay sila was on the 4th day up to the discharge po. So in some studies, ceftriaxone showed excellent activity against leptospirosis of different strains and also had lower minimum inhibitory concentration or MIC value than ampicillin, penicillin, and doxycycline. I-explain ko po yan later. And a study by Hospital and Murray last 2003 also reported that ampicillin and ceftriaxone had similar minimum inhibitory concentrations and minimum bactericidal concentrations against several strains of leptospiral species. So this is a table showing, hindi na po siya klaro, but this is a table showing minimum inhibitory concentration between the three, doxycycline, penicillin, and ceftriaxone. So, ang result po sana niyan, almost the same yung MIC between penicillin G and ceftriaxone on a, ano po to, leptospira canicula po to. I think it's 0.2 microgram per ml. And sa, ano po, sa ceftriaxone is 0.39. Almost the same po yan sila. And sa doxycycline, given it's a bacteriostatic in nature, mataas po talaga yung MIC niyan. Hindi rin klaro. So, this table shows penicillin G, ampicillin, and ceftriaxone shows equal MIC results against this leptospira interrogans ecterohemorrhagiae and canicula, 0.16 microgram per ml. The same po yan sila lahat. Itong tatlo po. So, ano po, for public health importance of leptospirosis, elementary pa ako, naririnig ko na yung leptospirosis. So, since we vets commonly tackle that kind of disease, might as well we need to explain it to the client na this is a zoonotic disease and it has a public health impact. As you can see, 2009, Metro Manila, 2,299 cases po yan with corresponding deaths. Up until 2023, meron pa rin cases reported, at the same time deaths din. So even if a non-medically inclined person, if you ask him or her about lepto, they know that sakit po yan at nakakamatay. So for us to mitigate, before I forgot, risk factors for outbreak of leptospirosis. Well, Pilipinas po, common po yung flooding. And then, did you know na ang leptospira can survive in the environment weeks up to months, given the humidity and pH of its environment? Poor sanitation. Self-explanatory naman po yung poor sanitation. And rat infestations. Not just rats, but ito yung pinaka main source natin lalo na sa urban areas po. And occupation. When you say occupation, yun po yung mga nagtatrabaho po sa farms, yun po yung mangingisda, yun po yung iba po, slum dwellers. Sorry to say that, but sila po yung pinaka-prone. So to mitigate the effects of this neglected tropical disease and protect public health, it is crucial to have cooperative efforts between health authorities, researchers, and communities in the Philippines towards the fight against leptospirosis and other zoonotic disease in the country. Conclusion, leptospirosis is a zoonotic disease with worldwide significance, occurring mostly in developing countries, especially Philippines. In order to successfully treat leptospirosis, one must possess a high index of suspicion in order to arrive at a proper diagnosis promptly and to effectively and timely treat the patients with appropriate antibiotics and supportive care. The dog in this study showed great improvement after the treatment po. So for recommendation, routine urine analysis during admission should be done. Given if the client approve. Yun naman po talaga yung always limiting factor natin. So we know what's the best approach, but our frustration is not with the practice but the client's approval po. I know it's not just me na napupustrate po kung ano yung magandang gawin sa patient pero hindi natin magawa-gawa. Next, blood transfusion. So, sino po dito ang routinely nag-BBT? Blood transfusion po daw. Yes. Yun nga. Pero so, nakikita ko ngayon, pag capable naman po yung client and the facility is able naman po, gamitin po talaga natin yung BT po. And then, hemodialysis. Sino po dito kung may hemodialysis machine? I know one person, yung mentor ko po. So, kung may hemodialysis naman po and then there's no any financial constraints with the client, then offer it. Ang ginagawa po ko po doon sa amin, sa province po, ay nilalatag ko po yung lahat ng options na pwedeng gawin. But, yun nga, at the mercy of the client's ability to cooperate. Yun lang po. And then, catheterization for monitoring urine output, sample collection, and then prevention of contamination in your facility. And at the same time, prevents nosocomial infection po. And para din sa atin at sa mga staff po natin. And repeat laboratory, mas maganda po as frequent as possible for proper monitoring sa patient. I don't know how frequent, but for me, as deemed necessary, perform ulit ng laboratory. And then alternative treatment. Alternative treatment, ampicillin, 20 to 30 mg per kg IV every 6 to 8 hours, or penicillin G at 25K to 40K unit per kg IV 6 to 8 hours. And also doxycycline, 5 mg per kg orally every 12 hours, or 10 mg per kg every 24 hours. Recommendation. For future researchers, this study may serve as a guide to further develop future treatment protocols in the management of leptospirosis. And for patients with penicillin-based allergies, this study may serve as guide for treatment. Who here performs anong tawag doon? Yung sa skin, prick test ba yan? Before skin test, yes, yung sa tao, before nagbibigay ng antibiotics sa atin, gumagawa po tayo nun, Doc. Opo. Sheda. Okay. So, prior administration of antibiotics, na-perform po ba kayo o diretso na? And then if may reaction, bigay kagad ng antihistamine. So, I assume hindi siya commonly na pina-perform prior administration of antibiotics. But in humans, bawal na bawal po yan pag wala pong sensitivity testing. So, for areas or regions in parts of the world where ampicillin or penicillin resistance is accurately defined, this study may also serve as guide to treatment po. So, you have options. You can use this Trexon, penicillin, or ampicillin. But I assume most of us use ampicillin before. Tama ba? So, these are my reference po. Special thanks to the owners of Kabib and especially to my mentor na mahaba ang pasensya sa akin, and to my wife and my child. Yan lang po.
Okay. Thank you, Dr. Tante.
Thank you po, Doc.
We have few questions from the audience from online and from our fellow diplomates. A question from Dr. Paul. With false positive and false negative result, the lateral test kits can be wrong sometimes. What convinced you that the case is real case of leptospirosis?
Okay, thank you, Doc Paul. Actually, based po talaga yan sa clinical presentation, add-ons, especially kung mas maganda po if na-study natin yung patient thoroughly. And at the same time, back up lang po tayo kung ano yung available sa amin. Especially sa akin, if I have the chance, if I have a PCR, I right away put PCR kaagad. Even if I perform lateral flow, i-parallel test ko po yan ng PCR. Just to make sure po. Kasi tama naman po si Doc Paul, meron talagang tendency na mag-false positive, false negative yung ating lateral flow. But sad to say, I don't have PCR right now. So, ginamit na lang po natin yung pagiging doktor natin. Kasi po, to tell you frankly, nakakagamot naman tayo kahit ano eh. Kaya nga tayo pumasok sa veterinary school eh. Wala pang test nun eh. Nakakagamot naman tayo po. So, we just need to make scientific conclusions based on the things that we gather during first patient encounter.
Yes, I agree, Doc. With clinical signs manifestation during history taking, and that's why we are suggesting na mag-test tayo kasi the signs and symptoms of leptospirosis is there. Just to confirm. Related to the occupational risk, do you ask physician for a prescription of doxycycline as prophylactic meds for your staff or your vets if they handle leptospirosis case? Or you just give doxy?
For my staff and our own prophylaxis. Yeah, wala pa. what we did, we did not perform prophylaxis for our own.
Your wife is physician, right?
Yeah. But kahit yung wife ko po physician, hindi po siya nag-suggest. PAMED po yun siya. Hindi po siya nag-suggest. I guess siguro meron po. Kahit ako, sa akin, hindi naman kailangan eh. For me, that's my own opinion po. As long as you perform and you handle your patient correctly. Gumagamit tayo ng gloves, nanghuhugas ng kamay, yun naman po yun eh. Kasi kahit nga sa labas ng clinic natin, sa bahay, pwede din tayo makakuha ng lepto. But as long as we do personal hygiene, hindi naman po yan siya masyadong, hindi naman po tayong masyadong risky. Not unless kung dumaan po tayo sa baha.
Yes, I recall some news clips before that during flood season, sinasuggest nila na mag-take na ng doxycycline yung mga lumulusong sa baha kahit wala pang nag-positive. A follow-up question from Doc Paul. In lepto cases, how do you educate the clients on the possibility of zoonotic transmission?
I do it by simple analogy and correlation in daily life naman po. Kasi po, leptospirosis is a very common disease. Everyone heard leptospirosis on TV, and even nga sa mga non-medically inclined person, alam nila yung lepto eh. So, for me to educate my client, just correlate it to the news naman po. Sinasabi ko lang po, if your patient is positive, given na positive po yung patient with lepto, sinasabihan ko lang talaga, sa Bisaya, kabaluman mo na tao gani mamatay sa lepto. So, for us, dun pa lang po sa statement na yon, alam na po ng client na, uy, delikado pala tong lepto. So, they need to handle their patient in their house properly.
Yeah. Okay. From the start of doxycycline, how long do we expect the dog's urine will be clear of lepto and is less likely to be infectious?
Ang doxycycline is suggested to be 14 days treatment course for patients. So I haven't read if during that 14 days treatment course on the 3rd day or 7th day clear na po ang patient natin with lepto. Not unless if you perform PCR on that period. If you manage to convince your client na, okay, we do 14 days of treatment course, but then you need to come back here every, let's say, 3 to 5 days to check if the patient still may lepto pa. Pero I don't think if that's a practical approach for me.
Okay, Doc. What if you're the senior veterinarian in your practice and then pumasok ka, meron ng case na pinasa sa iyo, they already started antibiotics for 24 hours and you want to do urine culture sensitivity, will you still go for it or hindi na?
Mahirap sagutin na. Depende po kasi yan sa level of infection eh. But if gusto naman ng gusto natin ng evidence-based na sagot naman po, why not?
Okay, Doc. Can ceftriaxone treat or clear the carrier state of leptospirosis patient?
I haven't read na kaya ng ceftriaxone yung mga convalescent cases. I guess that's the point. I haven't read na sinabi po doon na this ceftriaxone can be given to those patients na may convalescent and it's guaranteed na maka-clear ng ceftriaxone yung microorganism. But what I've read, doxy will do the thing.
This from Dr. Eugene. Is it safe to say that I can just use ceftriaxone instead of doxycycline for leptospirosis since effective siya, lalo na if patient is not eating?
Yes. Yes, I can proudly say you can use ceftriaxone. Even you can use also ampicillin or penicillin naman po.
Okay, if ceftriaxone or cefaxone is not available, can we use cefazolin also?
For that question, I cannot answer yes. Because in my case kasi, I only focus on ceftriaxone. I haven't read cefazolin. Hindi kasi siya lumabas dun sa, sa literatures na you can use in lieu of ceftriaxone. Mas common pang nilalagay nila azithromycin.
Azithromycin.
Opo.
Okay, what are the criteria for putting a patient on a kidney or liver prescription diet, and for how long?
For adjunct naman po talaga yung prescription diet. It's a prerogative naman po sa vet if you wish to prescribe it. Even clients know about naman sa prescription diet. Even if hindi nyo pa dinable sa ginagawa, dapat bili kayo ng prescription diet na ganito. Sometimes I encountered clients na ganyan po. They even ask me, Doc, pwede po bang mag-prescription diet na kami kaagad? So, I cannot say if how long. It's a discretionary naman po sa client. If financially stable naman po siya with no constraints naman, it's fine for me.
Yes, Doc, I agree. Because many clients will ask, ano po yung bawal? Di ba? Okay, another from Doc Paul. Do you need to assess the kidney function, and ideally, how often should you test for leptospirosis in a patient?
On my case, since 2 weeks yung, all in all, naging para siyang more than 2 weeks yung treatment course ko, yung frequency ng test, ay, tama po ba, Doc? Frequency ng to test if lepto,
Okay. Patient monitoring.
During admission yan sa Doc? Or, okay. For me, if there's no financial constraint, as frequent as possible. If you can do it every other day, then why not? Every now and then, yung talagang frustrations po natin, I assume same tayo ng frustrations. If we can do it as frequent as possible, because we need an ample data to at least solidify our assessment to the patient. So if we limit our tests, yun yung parang magse-self-doubt tayo baka kasi maliit masyado yung frequency ng pag-test natin sa patient. So if as frequent as possible, mas maganda po. Ang question lang is the client willing to cooperate. If the client's willing to cooperate, why not?
Okay, Doc. Question from the audience online. Hello, Doc. Can a dog be PCR positive but MAT negative? What does this indicate about the stage of infection?
Negative sa MAT but positive sa PCR?
Yes, Doc. What does this indicate about the stage?
Okay, sa PCR kasi DNA talaga yun. LIP number nung yung tawag dyan, virulence factor ng lepto yung dinidetect. So, sa MAT naman po, I guess it depends on the number of serovars of this facility performing MAT. Kasi it depends on the number. Ang MAT kasi gumagamit siya ng live lepto. So, depende. Did you know that lepto has 300 serovars? So, did the facility performing MAT has this 300 serovars? So, few serovars. And yet, PCR can detect lepto. But PCR cannot say na this lepto is serovar blah, 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 blah. Only MAT can perform that. So, yung tanong niya po if anong indication yan, I guess it's the yung gaano karaming serovar meron yung facility na may MAT. Ayun lang po.
Okay, Doc. A question from the Penglai audience. Your case is leptospirosis. You used antibody test kit. On the initial test, the test came positive. And after few days, a repeat antibody test came out negative. Please explain the result.
So, in behalf of sa lateral flow, yun yung problema sa lateral flow eh. So, I rely on lateral flow only. So, the lateral flow, upon follow-up kasi, yung patient po natin is apparently healthy naman po. So, tinanong, and then chinek po natin, CBC, ganito, ganyan. Promising naman po yung result. It's just yung test na ginamit is lateral flow. It's not yung degree ng result niya cannot be compared with PCR. If only PCR read that this patient is negative for leptospirosis, maybe there's no more question with regards to how to explain the result of the lateral flow.
Okay, Doc. Question again, Doc. Rabies is a zoonotic disease and it is a national concern. Do you think leptospirosis should be also considered as a national concern?
Of course. Of course. Even the government also tried to issue nga yan ngayon flood control projects. It's not just to control the flood, but during, after flooding kasi, maraming pong sakit. One of those is lepto. So if they ask me if ano yung mas mabigat, rabies and lepto, why not both? Mabigat po yan kasi it costs lives. It's just rabies 100%, but lepto is treatable if it's diagnosed properly and early.
Okay, Doc. From online audience, hello, Doc. Do you start treating po right away sa mga pets na na-expose sa carrier patient? Prophylaxis?
No, personally, I don't do prophylaxis.
Okay, Doc. Dogs and cats can be carrier of leptospira, but not infected. Do you treat them?
Can we put it if the dog, stray dog or if that
Household?
dog or cat has owners? Kasi it depends on the owners naman kasi. If the dog has no clinical signs, cat has no clinical signs, and the dog and the owner sees that their patient or their fur baby is not sick, so there's no reason to go to the vet. But if it's incidental finding during your first patient encounter, then we need to address that. Even if there's no clinical signs. Mga incidental finding na siya, hindi yun yung main concern niya bakit sila pumunta sa facility natin.
Okay po. Doc Randy, patanong ng question ko. If the lepto patient develops secondary IMHA and knowing that cephalosporins can also trigger secondary IMHA, would you still advise giving ceftriaxone?
So, if given na-diagnose natin siya na may AMHA, so, well, marami naman tayong option. Ceftriaxone is one. So, bakit po natin nilalagay yung sarili natin sa problema? So, we can use naman po penicillin, ampicillin, yan lang po. If makatrigger siya ng IMHA, then that's part of our treatment course naman po. Kasi hindi naman natin alam na IMHA yan pagdating sa ating facility. Pero pag nalaman or na-trigger po siya, then shift.
Okay, Doc. Thank you for that answer. Question po from the audience of Penglai. What type of leptospirosis antibody test kit do you use?
What brand or what type?
When testing.
IgM po.
IgM. Do you also consider the vaccination date?
Yes. We need to consider vaccination date kasi yun yung kaya nga need natin ng thorough history taking, and you need to indulge to the client na to say as truthful as possible naman po.
Okay, Doc. Thank you. This is for your the answer would be your opinion, I think, personal opinion.
Yes.
Other vets vaccinate every 6 months for lepto. What is your opinion on this?
Go for it. Why not? Kasi yung lepto available na vaccine po natin is 4 lang yung maximum. And then yung, did you know na 8 po yung common sa dogs? Harjo, Bratislava, in addition to the 4, Harjo, Bratislava, Autumnalis, nakalimutan ko yung isa.
But are they also susceptible to doxycycline or
Yes.
ceftriaxone?
Yes.
So, okay.
Yung doxycycline naman po, hindi naman po sinabi sa doxycycline na specific for serovirus only. They said lepto in general. So regardless sa regardless po sa serovar po.
Doc, how about this scenario? The vaccination is completed, bacterian yung 8-in-1, and then after 2 days, sinipon, nagbigay ng antibiotic. Do you think the bacterium is still there or napatay na siya ng antibiotic?
Specific na doxy na antibiotic po, Doc?
Yes.
Patay talaga yun.
Okay, last question, Doc. Since dog and cats can be carriers and not show clinical signs, this can be risky to others. Right? So can we do a routine screening for Leptospira kahit walang sign or healthy yung patient, since this is a zoonotic concern?
Best. Yun yung best. Without one, if you can manage to sell that to your client na can we do lepto test for this patient, best. Why not? Hindi naman po siya hindi naman po siya against ethical issues naman po. Best nga po yun.
Yeah, okay.
Yeah, good question. Yes, actually, sinagot ni Doc Randy. Actually po, ang prerequisite naman po natin for vaccination sa patient, as long as it will warrant, the patient warrants na healthy po siya. So, ito yung tanong po natin po, kung kailan po natin i-vaccinate yung patient ko na nag-recover, I guess, I will base on the history prior siya nagkasakit ng lepto. If in case na if I assess na the patient it's not, hindi siya matitrigger ulit, then I will vaccinate the patient naman.
Yes,
I don't give obsolete number po kung ilang araw, ilang kwan. I cannot give po.
Sige, Doc.
Okay. I'm proud to say I produced actually more than 5 patients na po na nag-okay. Apo.
Yes, Doc. And I may add, just do titer testing before vaccinating. Doc, may question ka?
Yes.
Hi, Doc. Good afternoon. So, 3 tanong ulit. So, what other indication of ceftriaxone in dogs and cats aside from lepto? So, can we use it in Ehrlichia disease ba? And second question, what would be the drug interaction between vitamin K and ceftriaxone when the patient is having jaundice? And then last, can ceftriaxone cause biliary sludging or problems in the hepatobiliary system?
First question po, Doc, is can we use ceftriaxone in lieu of other antibiotics against?
Ano pa yung other indication na ceftriaxone aside sa lepto? Pwede rin ba siyang gamitin sa Ehrlichia?
Okay, ceftriaxone is ano pong nabasa ko po is only limited for gram-negative and gram-positive.
So aside sa lepto, ano po yung niya?
So if you can go bacterial culture in your patient, if it's a gram-negative, you can use ceftri. If it's gram-positive, you can use ceftri.
Okay. And then yung second question ko, yung interaction niya between vitamin K. Kasi parang alam ko, parang contraindicated siya dun. Like, paano kung lepto patient mo is having jaundice na?
Okay. Then, if that's the case, you don't need to use ceftri. mas maganda po doon na lang po tayo sa mas safer na antibiotics na pwede pampalit sa Ceftry. And then yung last question po, Doc. I cannot answer if Ceftry can cause biliary sludging.
Okay, last question from Dr. Eugene. Do
Yes,
you vaccinate leptospirosis in cats?
Personally and honestly, I haven't done vaccination leptospirosis in cats. Although cats are susceptible, but most of them do not show clinical signs.
Doc, last question. Natanong po kasi kanina, the use of antibiotics with prior to vaccination. What is your insight with mass kapon or neutering and then nag-i-inject sila after ng anti-rabies, ay ng mga vaccines? Usually sa trap, capture trap and then release.
What's my opinion? Okay. Hirap naman nun.
Okay.
Sagutin na lang kita mamaya, Doc.
Okay, I think since overtime na po tayo, more than an hour. We'll get back to you, Doc, with regarding that. We'll hand over to Doc Mary Ann.
Thank you so much, Doc Yol. Very interesting topic, I guess, right? Everyone cannot stop asking you, Doc. So, congratulations. It means that your topic is really interesting. Okay. So, we need to move now to our next presenter. She will share to us the results of her knowledge, attitudes, and practices study and electrolyte testing and monitoring in patients with gastrointestinal and kidney diseases. I will let Doc Chris introduce her. Doc Chris, come on down.
Dr. Mary Otraje-Seneris graduated from the School of Veterinary Medicine at Aklan State University with a Doctor of Veterinary Medicine degree in 2011. That same year, she passed the VMLE and secured her first job as a small animal veterinarian at the Hayop Kalinga Veterinary Clinic in Laguna, where she began her formal years in small animal practice. During her 5 years, Dr. Marie O focused on pet wellness vaccinations, client education, and soft tissue surgery, laying a solid foundation in veterinary care. Fondly called Doc Mary by her peers, she transitioned to academic teaching at her alma mater for 3 semesters, where she taught several minor and prerequisite veterinary subjects, both clinical and surgical. In 2018, seeking to broaden her skills and expertise, Dr. Mary O moved abroad to work as a veterinary technician in the multi-specialty veterinary hospital. There, she gained invaluable exposure to various specialties, including internal medicine, oncology, orthopedic surgery, dentistry, acupuncture, and emergency medicine, collaborating with veterinarians from around the world. This experience deepened her interests in nursing care, internal medicine, and anesthesia. In 2021, she returned to the Philippines armed with globally recognized knowledge in veterinary practice and best practices acquired overseas. Committed to advancing veterinary practice and patient care, Dr. Mary O advocates for high standards in veterinary medicine, aiming to elevate the quality of care in her local community, starting off in the region where she is practicing as a senior veterinarian at South Tails Veterinary Clinic in Leganes, Iloilo, Philippines. Please welcome Dr. Mary O. Otraje-Seneris.
Hello, good afternoon. Okay pa ba ang lahat? No? So down to third speaker na tayo. So today I would like to share a survey entitled Knowledge, Attitudes, and Practices on Use of Electrolyte Testing and Monitoring in Patients with Gastrointestinal and Kidney Diseases in Small Animal Practice in the Philippines. Bago ang lahat, shout out po muna sa mga taong tumulong sa akin sa survey na to. May mga nanonood po sa ngayon via live, Facebook, Zoom, and they are part of this study. So salamat po sa mga nag-respond doon sa ating survey, which is ipepresent ko po ngayon sa inyo. And also, I will also share some cases regarding electrolyte testing and monitoring in patients that I encountered in our practice in Iloilo. So for the introduction, electrolytes, so ano ba ang function ng electrolytes? So electrolytes are crucial in maintaining homeostasis in our veterinary patients. They are essential for basic life functioning, such as regulating nerve and muscle functions, maintenance of hydration, and proper blood pH. So electrolytes are minerals that carry an electric charge when they are dissolved in a liquid such as urine, sweat, and blood. And commonly, we measured electrolytes using serum samples. So medyo gumalaw po yung ating highlights. Okay. So electrolyte imbalances disrupt normal bodily functions. Hence, patients with gastrointestinal and kidney diseases must be closely monitored and routinely checked. So it is important to identify and immediately treat abnormalities to create appropriate treatment plans of the underlying conditions. So in this picture, when interpreting laboratory result, therefore, we as veterinarians, we must consider the entire clinical picture of the problem of the disease to minimize inappropriate treatment. So according to literature, veterinarians have traditionally approached fluid therapy by considering the volemic status of the patient and correcting volume deficits. Sorry for that. So gumalaw siya ulit. No? The line should be, where should it be? Ayun. So status of the patient and correcting volume deficits but have paid less attention. No? So dati wala naman kasi tayong electrolyte testing, di ba? So tinatansya-tansya lang natin. No? So they have paid less attention to ongoing electrolyte abnormalities and administration of electrolyte balance solutions to critically ill patients. So, ano po yung mga electrolytes na meron sa katawan natin, no? So, same in animals, same in humans, no? The major electrolytes in the body includes the sodium, the chloride, the potassium, calcium, magnesium, and phosphate. So, they play a critical role in maintaining normal cellular functions, and these ions will regulate or affect two important physiological functions. Number one, the flow of water molecules, which we call osmosis, and the electrical charge across the cell membrane. So if you can see here, meron po tayong mga cations and anions, no? So since ang electrolytes po ay constantly nawawala sa body through urine and gastrointestinal secretions, therefore, the regulation and preservation of normal concentrations of these important electrolytes can be crucial for support life-sustaining functions such as cardiac performance, brain function, neuromuscular activity, and fluid balance. Oh, sorry. Oh, okay. Okay, so the CAP survey, this survey aims to assess veterinarians' knowledge, attitudes, and practices, and on the utilization of electrolyte testing, on initial evaluation, and ongoing management of electrolyte imbalances in small animal patients with gastrointestinal and kidney diseases within the context of veterinary practice in the Philippines. So the objectives of this CAP survey, and this presentation includes to evaluate the knowledge, attitudes, and practices surrounding electrolyte testing during the initial assessment and continuous monitoring of electrolyte imbalances in small animals with gastrointestinal and kidney conditions, focusing on the practices of small animal veterinarians in the Philippines. Secondly, to understand the importance of electrolyte testing in diagnosing and managing gastrointestinal and kidney diseases in small animal practice in the Philippines. And lastly, to discuss relevant cases of electrolyte disturbances commonly encountered in small animal practice in the Philippines. So let's go to the results and discussion of the CAP survey. So we have the knowledge section. So this section evaluates the veterinarian's knowledge about electrolytes and their important bodily functions. So the first question here is, kidney is the major organ affected by hypernatremia. Majority of the respondents said they said true, and which is around 51.92%, and 48.07% of the respondents said false. According to the literature, the brain is the major organ affected by hypernatremia, and it's not the kidney. Next question is, in a hemolyzed blood sample, what electrolytes can you expect to yield a high result, leading to false value interpretation? So as you can see here, majority of the respondents said all of the above, but the correct answer here is potassium. So nag-move yung ating So according to the literature, potassium results from hemolyzed samples may falsely indicate or disguise a life-threatening abnormality and can lead to inappropriate treatment. For the next question, which electrolyte is lost the most in vomiting? Majority of the respondents said all of the above. So among the choices, we have sodium, potassium, chloride, and all of the above. So they answered all of the above, but the correct answer here is chloride. So according to the literature, expelling the gastric acid contents causes the loss of chloride and hydrogen ions, which can lead to hypochloremic metabolic alkalosis. For the next question, it is the most frequent electrolyte disturbances in veterinary patients and can be life-threatening when severe. The correct answer here is potassium. Yes. Majority naman po ay sumagot na potassium. So according to the literature, potassium disorders are among the most frequently electrolyte disturbances in human and veterinary patients and can be life-threatening when severe. Next question is, which drug helps protect the heart from high potassium levels but does not lower potassium levels in the blood? So majority of the respondents said or answered correctly, no? So it's calcium gluconate. So according to the literature, calcium gluconate directly antagonizes the toxic myocardial effects of hyperkalemia by reducing the threshold potential of cardiac myocytes, leading to stabilization of the membrane potential, with or without changing the serum potassium concentration. So among the choices here, the dextrose, the terbutaline, insulin, and sodium, they can lower potassium levels. But the calcium gluconate do its job by protecting the heart muscles. Okay? So now we go to the attitudes section. So this section assessed veterinarians' views on the use of electrolyte testing and monitoring in patients with gastrointestinal and kidney diseases. So the first statement here, which is answerable by a Likert scale, initial electrolyte testing and monitoring alongside other blood tests, such as complete blood count and full blood chemistry, is crucial to guide appropriate treatment of the underlying condition, such as diseases of kidneys, gastrointestinal, and endocrinopathies. So majority of the respondents here, they said they strongly agree. So according to the literature, measurement of electrolytes will help clinicians in the diagnosis of a medical condition, the effectiveness of treatment, lalo na kapag nagmo-monitor tayo, no, after mabigay natin yung initial treatment, and of course, potential side effect of medications. Next question is, electrolyte therapy, similar with fluid therapy, should be tailored to each individual patient and doses calculated as is done with the administration of the drug. So majority of the respondents here said they agree. So according to a literature, so electrolyte imbalances such as hypokalemia, hyperkalemia, hyponatremia, hypernatremia, hypocalcemia, and hypercalcemia are commonly seen in emergency medicine. Severe abnormalities of these electrolytes can cause potentially life-threatening consequences to the patient. It is essential that the clinician understand and correct, if possible, the underlying cause of each disorder and recognize the importance of the rates of correction, especially with serum sodium disorders. Next question is, do you think it is necessary to check on the electrolyte levels in dogs and cats with suspected and existing gastrointestinal and kidney disease? Majority of the respondents, they said yes. Next question, do you highly recommend electrolyte testing in patients with suspected and existing gastrointestinal and kidney disease? Majority of the respondents said yes. Okay, sa mga sumagot ng no, ang majority of the reason nila is mahal yung test or mahal yung electrolyte test. It is too expensive for the client or the pet owner. Seconded by electrolyte testing is not available in the clinic, and followed by electrolyte testing is not available in other clinics, just in case gusto nilang mag-refer. And may mga sumagot na hindi sila nagtitest kasi hindi nila alam or they have limited knowledge in the interpretation of the results. Who among here dito ang may electrolyte test at laging ginagamit ito sa clinic? Light 4. Yun. Okay. Next question, do you recommend monitoring of electrolyte levels in patients with existing and gastrointestinal and kidney diseases in small animal practice? So majority naman po ay sumagot ng yes. So according to the sa mga sumagot ng no, ganun pa rin, same reason, mahal yung test, hindi afford ni clinic, and then followed by hindi rin available yung electrolyte test sa kanila, and then hindi rin sila makapag-refer kasi hindi rin siya available sa mga neighbors na clinic, and yung iba sumagot ng wala silang kakayahan or they have limited knowledge and interpretation of the result. Now we go to the practices section. So this section evaluates the veterinary's practices related to the use of electrolyte testing and monitoring in patients with gastrointestinal and kidney diseases used in the practice. So what blood tests do you perform to diagnose patients with suspected and existing gastrointestinal and kidney disease in small animal practice? So majority here of the respondents, they said they do full blood chemistry panel, seconded by complete blood count, and then third is electrolyte panel, and last is biomarker panel. Sa practice po namin sa Iloilo, kapag may suspetsa, siyempre, di ba, history taking, physical examination, tapos magre-recommend na tayo ng test. So, siguro parang naging ano na namin yun, naging culture or naging protocol na namin na kapag yung pasyente na pumunta is may base doon sa nakuha nating history and physical findings, may suspetsa na agad kami or alam namin na may existing kidney disease yung pasyente or gastrointestinal disease. Pina-priority namin yung full blood chemistry panel and electrolyte panel. Kapag afford naman ni client, go yung first three, CBC, blood chem, electrolyte. Pero kapag ang suspetsa namin, lalo na yung pasyenteng present sa amin ay nagsusuka, nagtatae, very non-specific yung signs, instead na unahin namin yung CBC, kung afford ni client, pina-priority namin yung blood chem and electrolyte panel. Next question, how often do you recommend electrolyte testing and monitoring in patients with existing gastrointestinal and kidney diseases in small animal practice? Majority of the respondents here, they said they do initial testing and then after 24 hours na. Next is 26.3% of the respondents here, they said they do initial testing, tapos after 2 weeks na, and then monthly na. Next is 21.10% of the respondents here, they do initial testing, tapos kapag nagkaroon na tayo ng treatment plan, uulitin after 4 hours, 24 hours, then every 3 days. And then minority of the respondents answered they do initial test only. Sa amin, depende pa rin sa kakayahan ng client to pay for the test, and depende rin sa degree of client education in connection doon sa problema ng patient. We do, as much as possible, we do initial testing And then after the treatment, after the initial plan, we repeat the test after 4 hours. And then every 24 hours na, and then every 3 days. So syempre kapag ginagawa namin to, laging may consent ng owner. Kapag medyo limited ang budget ng owner, dito kami sa initial testing, and then every 24 hours na. Kasi mahal yung electrolyte test. So according to the literature, in cases of hyponatremia, sodium should be rechecked 2 to 4 hours after therapy, adjusted as necessary, and then assessed 6 to 8 hours thereafter. So madalas ito yung ginagawa namin. In hypocalcemia naman, so following initial stabilization, weekly calcium evaluation should be sufficient with the client monitoring for signs of hypocalcemia and hypercalcemia at home. After at-home stabilization, recheck every 3 months is appropriate to adjust drug therapy. So this is applicable sa, what do you call this? Pinaka-common cause ng hypocalcemia natin, yung eclampsia, and of course, CKD patients. So this is applicable. So next question, what are the common electrolyte imbalances you encountered in small animal practice? So, majority of the respondents here, marami silang na-encounter na cases ng hypokalemia, 73% of the respondents, followed by hyponatremia. I will just emphasize on the top 5. So the first one is hypokalemia, seconded by hyponatremia, followed by hyperkalemia, and then hypernatremia, and hyperphosphatemia. So kung mapapansin ninyo, yung top 5 na yon, it's either manifestation siya ng either ng kidney or gastrointestinal problems. Yun yung most common top 5. Next question, how do you correct the electrolyte imbalances of your patients with gastrointestinal and kidney diseases in small animal practice? Majority of the respondents said they use appropriate intravenous fluids, and then followed by addition of electrolytes in the treatment plan in the form of oral or injectables. And then third is addition of specific electrolytes in IV fluids. And then last is bolus injection, infusion, or use of CRI of electrolytes. Next question, what intravenous fluids would you use in hypernatremic patients? Majority of the respondents here, they would use D5 water, followed by half-strength saline. Third is LRS, and last is sodium chloride. Kasi nga, hypernatremic na, bakit gagamit ng NSS, di ba? Parang mali yata. Pero, in hypernatremic patient, presents with signs of shock and obvious need for resuscitative fluids, the safest option is to administer a fluid with sodium within 10 millimoles per liter of the patient's measured serum. So, ang NSS or ang physiologic saline or ang 0.9 sodium chloride, ang sodium niya, kung medyo naboboard ako sa clinic, yung mga ginagawa ko, nagbabasa ako ng mga, ganyan, yung mga labels. So, yan. So, you can check it out also. Ang NSS, ang meron na sodium sa kanya is 154 millimoles per liter. So, this is an acceptable option if yung sodium ng patient nyo is less than or equal to 164. Hindi siya masama. Lalo na sa mga patients natin na may signs of shock. And madalas, yung mga signs of shock natin na patients is yung may mga dehydration and gastrointestinal losses, which are very common in parvo patients natin. Okay? Now, depende naman sa dahilan kung ano yung cause ng kanyang hypernatremia, kasi there are 3 categories, no? But I will emphasize here yung dalawa lang, which is ito yung most common sa practice natin na nakikita. For pure water loss and acute cases, wherein tinatawag nito itong isovolemic hypernatremia, very common ito sa mga patients natin na nagpapanting, may lagnat, heat stroke, seizures, and yung mga napapabayaan, yung mga hindi masyadong umiinom ng tubig, or yung mga dog na madalas nasa garahe lang, hindi nabibigyan ng tubig. So ang ideal fluid therapy natin dito is D5 dextrose water. ang pwede nating gamitin. For hypotonic losses naman or hypovolemic hypernatremia, especially sa mga cases natin ng parvo cases, pancreatitis, the ideal fluid of choice natin is NSS or LRS. Now, for the review of related literature, when we say gastrointestinal issues, kidney issues, halos pare-pareho kasi yung signs and symptoms nila, no? Very non-specific. So paano ba natin malalaman which is which, no? So regardless of our diagnosis, pareho lang eh. May makikita tayong irregular, fast or slow heartbeat, lethargy, fatigue, seizures, nausea or vomiting, diarrhea or constipation, abdominal cramps, muscular weaknesses, numbness, disorientation. No, just a quick review about kung ano yung mga electrolytes na meron sa katawan natin, no? So the major cations in the cations are the potassium, sodium, calcium, magnesium, and for the anions are the chloride and phosphate. The major cations in the extracellular fluid is the potassium, while in the ECF, the major cation is sodium. The major anion in the ICF is phosphorus, and the major anion in the ECF is the chloride and phosphorus. Now, for the review of electrolyte imbalances, this is very, self-explanatory. However, I would use the reference which we have in the clinic, no? For sodium disorders, greater than 160 is hypernatremia, below 144 is hyponatremia. For potassium disorders, greater than 5.8 is hyperkalemia, and below 3.5 is hypokalemia. In chloride disorders, we have above 122 is considered hyperchloremia, and below 109 is considered hypochloremia. For calcium disorders, above 12 is hyper, and below 7.9 is hypo. For phosphorus disorders, above 7.5 is hyper, below 3.1 is hypo, and for magnesium disorders, greater than 1.06 is hypermagnesemia, and below is 0.71 is considered below. Now, what are the common clinical signs associated with an excess or deficiency of major electrolytes? I will not go longer in this, so I provided a QR code. So please scan na lang kasi baka maubusan tayo ng time, no? Kung ano yung mga common clinical signs. Anyway, we will encounter this later sa mga case na ipe-present ko. Yun po. So, what are the common medications or treatment na dapat meron tayo? I have here 1, 2, 3, 4, 5, 6, 7, 8. At least meron dapat kayo nito. And these medications are always considered emergency drugs. Okay? Ayun lang. So, for furosemide, no, pwede siya nating mai-consider na treatment, emergency drug, lalo na kapag, yun nga, may mga kailangan tayong i-induce ng diuresis, yun. So, yun po. And then, this one is the calcium gluconate, the insulin, the dextrose, potassium chloride, phosphate binders, and sodium bicarbonate. Ayun. Napakaraming kondisyon or sakit, clinical manifestation na associated or merong electrolyte imbalances. Sobrang dami, di ba? Ang gulo, oh. But for today, I will only tackle about electrolyte imbalances associated with diarrhea, vomiting, AKI or acute kidney injury, TLS, tumor lysis syndrome, post-renal azotemia, and malignancy. Now, our first case scenario today is Choco. So Choco is a 3-month-old Shih Tzu, intact male presented. Ang tanging problema lang ng owner at ng patient is ang pagtatai ng kulay itim. Hindi kumakain for 2 days, walang water intake. Pero masigla si pasyente. Normal naman yung kanyang vital stats, pink mucous membrane, hindi pa naman siya mukhang dehydrated. Yun lang, ang tae niya ay kulay itim, na parang uling, malagkit. This patient was a heartworm positive patient, natapos na yung treatment niya. So, bumabalik-balik from time to time yung patient para tick and flea and heartworm preventives every month. Gusto ni owner na every month kasi doktor kasi yung may-ari, so yun yung time na day off niya. So, pag iniiwan niya yung pasyenteng ito, iiwan lang muna, tapos balik na naman siya sa duty. Yun. So, I don't know if klaro sa inyo yung CBC, no? Yung mga blood test, mukhang hindi. Pero sa CBC niya, normal. Normal siya. Tapos, ang kanyang basic blood chemistry, normal din. Pero yung kanyang electrolytes is mataas yung kanyang chloride. So, the initial treatment natin sa pasyenteng ito is LRS, no? And then, oral antacids, kasi nga hindi kumakain. Tapos, probiotics and a gastro diet. So, yun. Okay. Ay, nagkandugulo-gulo, sorry. Oo nga. Okay, sorry. Okay na po. Okay na po. Magulo talaga siya. Okay. Pero okay, I think we have some technical difficulties here, but sige, gawa natin to ng paraan. Okay, Okay. So dito sa day 0 niya, ito 'yon, yung initial na blood test na ginawa ko sa kanya. Mataas yung chloride niya, yan, mataas yung chloride niya. Ang normal natin is 109 to 122, sa kanya is 138. And kung mapapansin niyo, yung sodium hindi mabasa. So tinanong ko dito yung company yung nag-ano ng machine sa amin. Ang sabi nila, and even in literatures, pag mga ganito daw na hindi nababasa yung certain parameter, it's either sobrang taas ito, sobrang taas na hindi mabasa ng machine. So at this point, mataas yung chloride ng pasyente, hindi mabasa yung sodium niya. Ayun. So, tawag nito, nag-initiate na tayo ng fluid therapy, no? Tapos, dahil apparently, generally okay naman yung pasyente, pinaiwan pa rin ng client, pinakonfine pa rin niya for fluid therapy. No? So ang purpose natin is para lang ma-rehydrate yung pasyente at the same time just in case na baka kumain yung pasyente sa clinic, no. The following day, nag-repeat ulit tayo, no, nag-monitor tayo ng kanyang electrolyte levels, and at this point of time, yung chloride niya na 138, 129 na siya, yung sodium niya nababasa na pero sobrang taas pa rin. Yun. So continue pa rin yung treatment plan natin, fluid therapy. As far as I can remember, yung patient, nag-start na siyang kumain ng prescription diet. Tapos yung pupo niya, nagkakaroon na rin ng color, hindi na kulay itim. On the following day, on day 3, lalong tumaas yung kanyang chloride. Lalong tumaas yung kanyang chloride. Surprisingly, ang taas ng potassium niya, ang sodium niya nababasa na rin pero mataas pa rin. So what we did is, dahil mataas yung kanyang potassium, nagbigay tayo ng calcium gluconate, no? Di ba ang function ng calcium gluconate is hindi niya necessarily pabababain yung potassium, pero yun nga, dahil nga sa side effects ng potassium na gagawin niya sa heart natin, that will be counteracted by calcium gluconate. So, pasensya na po. Oh, okay. So, medyo okay na. Ayan. Yun. So, ideally, no, kapag nagbibigay tayo ng calcium gluconate, in a more advanced practice, kapag nagbibigay tayo ng calcium gluconate to counteract the effect of potassium, dapat nag-ECG tayo. At that time, wala pa kaming ECG. What we do is, yun lang, physical monitoring, heart rate, counting, respiratory counting. And dahil nga, masaya naman yung dog, na-challenge na ako sa dog kasi mukha naman siyang okay, happy naman siyang makita ako, normal naman yung vital signs niya, so I don't know what to do. But anyway, dahil yun ang sinasabi ng blood test natin, evidence-based tayo, go tayo sa treatment, no? Okay. Now, nabanggit ko kanina, yung pasyente ko ay nag-positive sa heartworm, ginamot natin, tapos na siyang gamutin ng melarsomin treatment. So ito yung mga araw na naggamot tayo, no? Pina-follow natin yung American Heartworm Society protocol, yung 3-dose regimen. Yung first dose, then after a month, second dose, and then after 24 hours, third dose. So sa timeline, si Choco was presented in the clinic 84 days post-injection of the first treatment, 31 days post-injection of the second melarsomin treatment, and 30 days post-injection of third melarsomin treatment. Ngayon, nagtanong ako nito kay Doc Paul, Doc Paul, may na-encounter ka na bang ganitong case na heartworm positive, ginamot mo, tapos nagkaroon ng ganito. So, I don't know kung may nasagot si Doc Paul sa akin, pero I searched further, and yun nga, wala akong ibang maisip, wala akong ibang dahilan kung ano yung pwede niyang maging reason kung bakit nagkakaroon siya ng electrolyte imbalance, no? According to the product detailer of this brand, from 0 to 63 days, there is the average onset and time and duration, this is range of the most common reactions in clinical trial was seen in between 0 to 63 days, showed anorexia and inappetence. And then, a prevalence of clinical observation for adverse reaction reported in clinical field trials, an average of 13.2% of the dogs involved in the clinical field trial showed anorexia and inappetence. And 2.6% showed diarrhea or nagka-diarrhea, and 1.5% ng mga dogs treated with melarsomin exhibited abdominal hemorrhage, abdominal pain, bloody stool, diarrhea, and many more, involving gastrointestinal system. So my differential diagnosis or my working diagnosis on this patient is gastroenteritis or possible melarsomin adverse reaction. Yun po. Okay. So anyway, tumagal yung patient sa clinic 4 days. Sa monitoring natin kanina, kung nakita ninyo doon sa day 4 monitoring niya, nag-repeat tayo, nagbigay tayo ng calcium gluconate, nag-normal naman lahat, pero mataas pa rin yung chloride. Kung napansin nyo ha, I cannot go back, I don't know how to go back. Pero later on, let's try to review it later. Mataas pa rin yung chloride niya, pero dinischarge ko pa rin siya sa kagustuhan ng owner na dahil nga mukha naman siyang masaya, and mukha namang okay, nag-brown na yung pupo niya, kumakain na. So kahit mataas pa rin yung chloride ng pasyenteng iyon, tawag nito, dinischarge ko yung pasyente. Lately ko lang na-realize na bakit hindi na correct yung chloride niya despite the treatment, yung treatment na binigay ko. I realized na hindi ako nagbigay ng anything to counteract the accumulation or yung pagtaas ng chloride niya. And then expecting na i-correct siya ng LRS because LRS is contains lactate, di ba? Which will then be converted into bicarbonate. Usually kapag mataas ang chloride, yun naman yung pang-counteract natin, no? Usually LRS. So late ko na na-realize sana nabigyan ko siya ng sodium bicarbonate. May mga tanong sa sarili ko na bakit pinatagal ko pa ng 4 days. So yung mga ganong realization. So minsan, nasa-challenge tayo kapag natapos na yung pasyente, nakauwi na, pero may something pa rin dun sa window na bakit hindi ko to nagawa? Bakit hindi ko to na-correct? Buti na lang okay yung pasyente. So yun yung take away ko, realization ko sa case na to. Next, we have Max. Magpapagroom lang sana. So I don't know kung ano yung protocol ninyo sa grooming, pero kami, bago kami magpa-groom, dino-double check namin talaga yung vaccination record. Hindi pwedeng tumamba yung dog ng matagal sa grooming area na walang vaccination, walang record ng vaccination, or hindi siya na physical exam ng vet. So, mag-groom lang siya. Hindi ko siya pinag-groom. Kasi upon physical examination, nakita ko sa mucous membrane niya, para siyang may mga pinpoint hemorrhage. Yun. Pero na closer look, para siyang maliliit na pinpoint ulceration. Tapos, medyo payat yung dog, body score condition of 3/9, napaka-dry ng hair, magaspang, tapos uremic breath, and then sa dental exam, meron siyang periodontal disease number 1. Upon auscultation, irregular yung heartbeat niya, pero wala namang murmur, and then an estimate of 5 to 7% dehydration yung ating physical assessment sa kanya. According to the owner, the patient lives in the garage area, and sabi naman ng owner, inako naman niya, may less access to water si owner. So si Max is an acute case of an acute kidney injury. So what we did, CBC, so mukhang okay naman yung CBC niya, yun nga lang may konti tayong pagtaas ng kanyang lymphocyte, monocyte, and eosinophil count, and may reticulocytosis tayo, pero wala naman siyang infection. Sa blood chem niya, ayun, ang taas ng phosphorus, ang baba ng calcium, medyo bumaba ng konti yung ALKP niya. Sa electrolytes niya, to the roof ang kanyang potassium. Normal naman yung SDMA niya. Yun. So other tests performed in this patient, negative siya sa blood parasite, negative sa DBS, kasi itong pasyenteng to, every month, the owner is very compliant sa monthly deworming and preventives niya. Yung urinalysis niya, ito yon. So ang pH ng kanyang urinalysis is 5. There are traces of proteins, negative naman siya for nitrite and leukocytes. So initial treatment plan natin sa pasyenteng ito is NSS. Bakit NSS? Unang-una, sodium and chloride lang siya. Mataas yung potassium ng patient, so ito yung safe option natin sa pasyente natin. Okay? Kasi purely lang siya, sodium and chloride yun. And then of course, dahil mataas yung potassium niya, nagbigay tayo ng calcium gluconate. Oh, ito na naman. Okay, medyo na yungi na naman yung ating table. So ayun, sa day 0, kung makikita ninyo, yun nga, initially mataas yung kanyang phosphorus, mababa yung kanyang calcium, sodium niya normal pa naman, chloride niya normal pa naman. Okay, dahil nag-calcium tayo, after 6 hours, nirecommend natin sa owner na uulitin natin yung monitoring. So ayun, normal na yung kanyang phosphorus, normal na yung kanyang calcium, sodium niya medyo tumaas, at saka chloride niya medyo tumaas. So what we did is, we stopped the NSS, at dahil nga tumaas yung kanyang sodium and chloride, we shifted to LRS. The following day, ito na yung sodium niya, no? Medyo bumaba na ng konti, pero medyo mataas pa rin, pero at least bumaba siya. Tapos, on the following day, day 2, hindi na natin tinest yung calcium and phosphorus niya kasi previously nag-normal naman, tapos yung sodium and chloride niya is normal na. So, ayun, nag-LRS tayo, dahil nga sa mga nakita natin doon sa blood test niya, kahit wala naman siyang kidney problem, but just to i-enhance yung diuresis niya, nag-prescribe tayo ng mga kidney tonics, tapos nag-renal diet na rin ako. So yung further plan natin sa patient na to is, yun nga, nag-serial monitoring tayo ng kanyang electrolytes, which is na-correct naman natin, and then the patient was discharged after 72 hours. Pinauwian natin ng prescription diet and kidney tonics for a month, and dental prophylaxis and full dental examinations were recommended. Case number 3. Okay, so case number 3 natin is a case of post-renal acute kidney injury. So si Fear is a 2-year-old intact male Persian cat presented with distended bladder, no appetite for a day, lethargic, and very weak. Yung vital signs niya ay normal naman, pero dahil nga given na lalaki, pusa, distended bladder, matic, check natin agad yung pototoy ng pusa. So nakita natin doon, highly inflamed, nangingitim, and dry. Dry yung tip ng pusa, which means hindi nakakaihi yung pusa natin. Nag-urinalysis tayo, ang taas ng protein, positive for nitrite, ang taas ng leukocyte count. Sa urine microscopy, hindi siya medyo makita, no? Pero meron siyang calcium oxalate and struvite. Sa CBC niya, yung WBC count niya, bahagyang mataas, which is normal, common sa mga ganitong situation. SDMA ng pusa to the roof, it's 40 micrograms per deciliter. Yung CREA niya, hindi mabasa. ALT niya is normal, sodium niya is mababa, potassium niya sobrang taas, and chloride niya is bahagyang bumababa na. Now, our plan is 2, surgical and medical. Dito sa surgical, of course, ang gagawin natin, i-unblock natin, di ba? So, the usual treatment, the usual anesthesia protocol, magbibigay tayo ng atropine, magbibigay tayo ng tilitamin, zolazepam, para ma-unblock natin yung pasyente natin. Now, let's talk about the side effects of tilitamin, zolazepam. So, common side effect ng tilitamin, zolazepam, I won't mention the brand. Common side effect is hypotension. Yung pusa mo, hyperkalemic. Kapag nag-anesthesia ka ng hyperkalemic patient, anong mangyayari? Possible cardiac arrest, no? So, I want to emphasize this lalo na sa mga batang vets ngayon na hindi pa masyadong kapa yung paano natin kinokorek ito, lalo na kapag mag-unblock tayo ng patients na mataas yung potassium, tapos mag-anesthesia tayo. First, huwag nyo munang i-anesthetize yung patient. Huwag nyo munang bigyan ng kung ano-anong anesthesia. Correct nyo muna yung hyperkalemia. Unang-una ang hyperkalemia, magkakaroon, ang kanyang side effect is bradycardia. Hihinain niya yung heart. So, pag nagbigay tayo ng anesthesia, para na rin natin siyang pinitiis. So, to counteract the side effects or the effects of potassium, high potassium levels, mag-calcium muna tayo, no? Yun. Walang kasiguraduhan na ma-unblock ba natin to agad, pero at least, meron na tayong naibigay na emergency drug. So, fortunately, na-unblock naman natin, and then after nating ma-unblock, is doon na tayo magsisimula ng diuresis or ng fluid therapy. Okay? So, yun po. Ngayon, dito naman sa medical, siguro mag-jump na lang ako. Kung mapapansin nyo sa pinakadulo, after 4 hours po ako nagbigay ng NSAID. Bakit po? No? So, di ba usually ang NSAID is usually associated sa mga acute kidney injury, and sa case na to, hindi pwede. So, kaya ko bakit after 4 hours siya binagyan ng NSAIDs kasi sinigurado ko munang na-rehydrate yung pasyente natin. No? Para naman nagkaroon ng chance yung kidney niya na makarecover naman doon sa insult na nangyari sa kanya. Post-obstructive insult. Okay? So, yun lang. Parang protocol ko na to sa buhay ko, yung ganitong practice. Okay, so ito yung day 0 niya, no? So, yun nga, mababa yung sodium, potassium niya mataas, chloride niya is mababa. So, ang fluid of choice natin dito is NSS. Mataas yung potassium niya, nag-calcium gluconate tayo bago natin siya in-anesthesia. And then, successful naman yung pagtanggal ng obstruction natin, no? Nag-catheter tayo, closed system urinary catheterization. And then, the following day na tayo nag-repeat kasi nga medyo financially constrained na rin yung may-ari. So, the following day na tayo nag-check. Ayun, mababa yung kanyang potassium. Okay. So, dahil mababa yung potassium, actually acceptable ito. Pero kasi, dahil pusa ito, at ganyan yung problema niya, what I did is, nag-add pa rin ako ng potassium chloride doon sa fluids niya para lang masiguro natin na pwede siyang, yun nga, hindi lalong bumaba yung kanyang potassium. Kasi imagine, in 24 hours, bigla tayong nagtanggal ng obstruction. So, possible talaga, dahil nga nag-diuresis tayo, bababa at bababa talaga yung kanyang potassium. Ayun. So, okay, let's skip na lang this one. Case scenario number 4, si Cooper. Si Cooper is a case of CPV and intestinal parasitism. So, meron siyang vomiting, the usual signs and symptoms ng parvo. Okay? Wala siyang bakuna, wala siyang purga. Now, let's go to the blood test. So, meron siyang insinaria. Positive siya sa parvo test kit, antigen. Kung makikita nyo yung kanyang electrolytes, sodium, potassium niya is borderline, pababa na. Chloride niya okay pa naman. Negative siya sa Giardiasis, sa test kit, pero meron kaming nakita sa pupo niya. Okay? So sometimes, yun nga, isa din sa takeaway sa case na to, minsan may mga hindi sinasabi yung test kit, and sometimes yun nga, siguro gut feels na lang din. Since nag-collect na rin naman kami ng pupo, given na walang purga yung patient, nakakita kami ng worm, egg ng worm. So surprisingly, kahit negative siya dun sa test kit, may nakita kaming protozoa. So, treatment plan natin sa patient na to, NSS, kasi nga bahagya ng bumababa, pababa na yung kanyang sodium, no? Tapos, the usual treatment protocol ng parvo natin, for sure, similar tayo ng treatment protocol sa parvo natin, no? Dahil nga nagsusuka yung aso, hindi ako nag-oral deworming, nag-spot on tayo, yun. So, ayun, day 0, okay pa yung kanyang electrolytes, pero dahil dinedma ko na 3.5 na lang yung potassium niya, I did not hesitate na magdagdag sana ng potassium chloride. Hinintay ko pa yung kinabukasan, voila, ayan, 3.4 na. Yung dog na to overnight na nagsusuka at nagdadiarrhea. So what can you expect? Natural, bababa talaga yung potassium niya. So this is a learning, you know, na pag may mga ganito kayong cases, huwag niyong i-disregard. Pag medyo papunta na tayo sa abnormal, mapa-below man o mapataas, gawa na natin ng paraan. Huwag na nating hintayin. Buti na lang pumayag yung owner na magpa-monitor siya kasi nga na-explain naman sa kanya ng maayos kung bakit kailangan nating mag-monitor. Okay. Eto, last na to. Si Aurora is a spayed female. May growing mass siya sa external genitalia niya since December 2024 according to the owner. Pero dinala lang siya sa clinic February 2025 niya. So until now, minamanage ko pa rin yung pasyente na to kasi hindi pa rin siya nagpapatanggal ng TVT niya. Ang dami ng complications. Okay. Pero, spayed si dog ha. Spayed si dog. Kung makikita niyo po yung picture na yun sa dulo, ano po yun? Body ng... Hindi po yan penis, girl po siya. Spayed female. Body siya ng... Anong tinatanggal natin sa spade? Yes, body siya ng uterus. Hindi
Collapse.
siya totally natanggal. Okay. At yung dog na to lives in a multi-household dog with a lot of male dogs. So ayun, initial CBC ng pasyente, ang taas ng WBC count niya, ang taas ng neutrophil count niya, ang taas ng monocyte count niya, ang baba ng platelet count. Hindi na ako nag-bother mag-test sa blood parasite kasi may history na yung dog na to. So for a first timer, mababa ang platelet. Blood parasite test, screening. So hindi na ako nag-blood parasite screening nito. Dahil mukhang normal naman yung pasyente, no? Wala namang ibang complaints except for that vaginal bleeding and yung lumalabas dun sa pudingding niya. So, at dahil na-confirm naman natin na may TVT yung pasyente natin, nag-proceed tayo doon sa chemotherapy. And dahil nga ayaw magpa-admit ng owner, gusto niya lang oral prescription. And then, sa protocol ng TVT, di ba usually, every week tayo nagtitreat. Okay, so every week, balik tayo every week, ma'am, sir. What happened, 6 days after nating mag-chemo, ayun, nilagnat yung pasyente, nag-shiver daw, hindi kumain for more than 48 hours, at nag-repeat tayo ng blood test. Ito na yon. Yung normal na CBC, 6 days ago, may anemia na. Pero surprisingly, nag-normal na yung WBC count niya kasi nga, nag-antibiotic tayo prior. Bumaba yung glucose kasi nga, more than 48 hours nang hindi kumakain yung pasyente. Ang taas ng phosphorus niya, ang taas ng globulin count niya, mataas din yung ALKP, biglang tumaas yung amylase lipase niya. Okay. After 2 weeks. So at this point, instead na every week yung chemo natin, every 2 weeks na. So, dahil, ayun, kung bakit every 2 weeks, may nabasa akong protocol sa Thailand about TVT, na marami silang successful cases, dahil nga may mga previous silang na-treat na nagkaroon ng complications, ginawa nilang every 2 weeks. So, ayun. So, ito summary ito ng phosphorus calcium niya. No? So, yung phosphorus niya, yung sa 6th day, na bumalik siya after the first dose is 8.1. Dahil nga nag-phosphate binder na tayo, prescription diet. After, at day 15, sa second dose niya, usually kasi sa chemo protocol namin, bago kami magbigay ng gamot, CBC, blood chem, gagawin muna namin yan to make sure na okay yung pasyente. So, magandang balita, okay naman siya. Ayun. Sa third dose niya, okay pa yung kanyang phosphorus, kasi nga minomonitor natin to every before magbigay ng chemotherapeutic agent. Pero yung calcium niya and chloride niya is abnormal. At this point, ayaw pa rin ni owner magpa-confine. So, nagdagdag lang tayo ng calcium and cholecalciferol supplement, tapos sodium bicarbonate, and phosphate binders for idadagdag sa food for 2 weeks. Sa fourth dose niya, this is after 2 weeks na naman fourth dose niya, ganun pa rin. So tuloy pa rin yung take-home prescriptions natin, pero tinigil ko na yung phosphate binders kasi normal naman Phosphorus niya normal sa third dose and fourth dose. After 6 days na naman, bumalik na naman kasi nilalagnat na naman yung pasyente, nagsishiver na naman siya, ayaw na naman, tumaas na naman yung kanyang phosphorus. Okay, so right now, itong case na to, minamanage ko pa rin to hanggang ngayon. Minamanage ko yung condition ng pasyente kasi nga ayaw pa rin niyang magpa-opera. And yung dahilan ng kanyang sitwasyon ng pasyente is dahil nga nagkikimo tayo because of the TVT condition. So meron tayong, kung narinig niyo na to, acute tumor lysis syndrome. So this happens when nagbibigay tayo ng chemotherapeutic agent, which is pinapatay niya yung cells, no? So pag namamatay yung cells, nagre-release sila ng potassium, phosphorus, as a result of rapid tumor cell death following effective chemotherapy treatment. So conclusion, okay, bilisan ko na lang din. 3 R's, revisit, review, revise. Sa mga vets, especially sa younger generation ngayon, huwag mahiyang bumalik sa nakaraan, bumalik sa basic, bumalik sa books, revisit the theory of electrolytes and electrolyte monitoring. Review. Marami tayong mga sources ngayon online, even sa mga conferences, natatopic yung mga ganitong bagay, mag-review po tayo. Revise. Kapag meron tayong evidence na laboratory test, yun nga, nagsiserial monitoring tayo, mas madaling mag-revise ng ating treatment plan para maagapan natin yung sitwasyon na kinakaharap ng pasyente natin. 2C is collate and collaborate. Yung mga blood test natin, i-collate natin yan, reviewin natin, kasi yun nga, doon natin makikita yung trend ng result ng pasyente natin. And yun nga, dahil doon sa CAP survey na yun, majority, may mga sumagot na dahil mahal or hindi available ang test sa clinic nila, huwag tayong mahiyang makipag-collaborate, mag-send out po tayo ng sample sa mga clinic na merong electrolyte testing. Of course, importante sa lahat, client education. Kailangan maintindihan ng client kung bakit natin kailangan gawin ang test na to, kahit mahal. The reason why, especially kung kidney and gastrointestinal issues na ang involved, kailangan nilang maintindihan na ang electrolyte monitoring, just like any other blood test, is very important. Now, recommendations. Electrolyte testing is highly recommended. So kung hindi nyo pa po ito nagagawa, please gawin po natin. Referrals, yun, so facilitate access to specialized case. Kung wala po tayong electrolyte testing, mag-refer po tayo. Okay? It enhances patient care quality. Okay, nakita ko lang to nakaraang araw, no, sa wall ni Doc Joff. Sabi ni Doc Joff, sometimes no matter how many tests you run or how many treatments you try, there are still no answers. Because the hardest part of being a veterinarian isn't doing everything you can, but it's realizing that even everything might not be enough. And then just the other day, they can threaten your name, question your worth, even break your heart, but tomorrow you'll still show up. So that's why I'm here today. Thank you.
Thank you, Dr. O. In the spirit of time, questions will be sent to you personally later.
Yay!
And we now will proceed to our next speaker.
Thank you, Doc. Very challenging. Challenging. I apologize for the next presenter. Is it apologize or thank you? All right, our seventh presenter, the next one, will be presenting a case report on chronic kidney disease, challenges and therapeutic approaches. It's always a complex topic deserving a nuanced discussion. So, Dr. Edgar V. De Jesus Jr. is a passionate and skilled veterinarian who earned his Doctor of Veterinary Medicine degree from the University of Southern Mindanao in Cabacan, North Cotabato. With a strong foundation in veterinary medicine, he's dedicated to advancing his practice in the field of canine and feline practice. Driven by his desire for excellence, Dr. De Jesus aims to become a proud member of the Philippine College of Canine and Feline Practitioners, reflecting his commitment to continuous learning and professional growth. With a profound love for animals, Dr. De Jesus is currently the senior veterinarian of the Animalandia Veterinary Solutions Clinic, and also connected to the local government unit in Coronadal City Veterinary Office. He believes in a holistic approach to veterinary care, combining technical, proficiency, compassion, and innovation. He is committed to delivering high-quality veterinary services marked by precision, competitiveness, and ethical practice, ensuring the well-being of his patients and earning the trust of the pet owners. Dr. De Jesus is also a firm advocate for lifelong learning, staying updated on the latest advancements in the veterinary medicine, and sharing his knowledge to benefit the local pet community. Guided by his core values of empathy, integrity, and excellence, Dr. De Jesus strives to create a positive impact in every aspect of his practice. His ultimate goal is to set a benchmark in compassionate veterinary care, fostering stronger bonds between pets and their owners while elevating the standards of the profession. Please welcome Dr. Ading. We call Ading Edgar V. De Jesus.
Hello everyone, good afternoon.
Good afternoon.
So, I am the second to the last speaker. Please bear with me. I just need some time to set up. So again, good afternoon, everyone. To the officers and members of the PCCFP, the Philippine College of Canine and Feline Practitioners, to the sponsors, to my batchmates, to all the participants online and on-site, my fellow veterinarians, a pleasant and wonderful afternoon full of learnings to all of you. Well, I am Edgar V. De Jesus Jr. My presentation is about a case of chronic kidney disease, particularly on a 3-year-old intact female French bulldog. This young patient defies the typical age-associated pattern of canine CKD, or chronic kidney disease. Now, before I delve into my particular topic, let us first have a little review of the importance of kidneys. As we know, kidneys are vital organs that plays a crucial role in maintaining overall health and homeostasis. They filter waste products and toxins from the bloodstream, which are then excreted through urine, helping to keep the blood clean and chemically balanced. In addition, the waste removal, the kidneys regulate fluid electrolytes levels, ensuring proper hydration and support essential functions like muscles, contractions, and nerve signaling. And they also played in the vital role of red blood cell production. They also helps in the blood pressure regulation and calcium metabolism. Well, when a dog's kidney become damaged, their ability to carry out vital bodily functions is reduced. As mentioned, the kidneys are essential for filtering waste and toxins from the blood, regulating fluid, and electrolytes levels, maintaining normal blood pressure, and producing hormones that support the red blood cell production. As the kidneys lose function, waste products and fluids begin to accumulate in the body. This can cause some symptoms such as vomiting, lethargy, loss of appetite, weight loss, increased thirst and urination, and in general weakness. Over time, this imbalance can affect nearly every organ system, leading to a cascade of health issues that disrupts the dog's day-to-day comfort and functioning as toxin buildup. Without immediate and ongoing medical intervention, kidney damage can worsen rapidly. Unlike many organs, the kidneys have limited capacity to heal once injured. That means the prognosis becomes poor. The outcome largely depends on how much kidney function is lost. If left unmanaged, the dog may face life-threatening complication, including severe dehydration, dangerous high blood pressure, heart problems, anemia, and toxin buildup in the bloodstream, or uremia. These complications can quickly become fatal, highlighting the importance of early detection and treatment. Well, our objectives for this presentation is to evaluate the clinical importance of CKD biomarkers to facilitate treatment. Second is to identify the challenges in managing patients with CKD. And third, to assess the stage of CKD using IRIS guidelines in the 3-year-old French Bulldog. Chronic kidney disease in dogs is a condition that veterinarians frequently encounter, whether we are in general practice or a specialty clinic. CKD cases are something we encounter, particularly in aging patients. It presents unique challenges not only in diagnosis and management, but also in addressing the concerns and emotions of the pet owners. In this discussion, we will delve into its relevance to our field, explore practical solutions to common challenges, and provide strategies to support both our patients and their families. Nowadays, CKD in dogs increasingly presented in many animal clinics, particularly aging pets. This may be due to many factors. As we all know, CKD is progressive and irreversible loss of kidney function over time, leading to the systemic effects that impact the quality of life and survival of our patients. Many of these cases are influenced by the age of the patient and the length of time the pet has spent living within the owner's lifestyle, such as sedentary lifestyle, poor diet, or inconsistent vet visits may contribute to health issues. If the owner is attentive to health, provides proper nutrition, and seeks early veterinary care, it can delay or reduce the impact of chronic disease. Yeah. So as you can see, chronic kidney disease has a prevalence of 7% according to the JVIM, Journal of Veterinary Internal Medicine. Yes, thank you, Doc. However, I would like to present to you another study that I have searched from the prevalence of the CKD by age, stage, and breed. So as you can see, the prevalence between among the age group, 29% of the CKD cases are in the lesser than 5 years old, where 42.12% are in the 6 to 10 years old dog, and 29% that passes the 10-year-old or 10 years in life of a dog. So there are more older than the most of the affected dogs. So in breeds, prevalence usually high in mixed breed. So more on the mixed breeds. So in stages, most commonly presented to our clinic is on the iris stage 4. Stage 3 and 4, pero usually stage 3. So additionally, there is a study so predisposing factors that affects CKD. So we categorize it into 4. So first is the intrinsic endogenous risk factors. There are the age, the breed predispositions, and genetic diseases. Second is the chronic or systemic comorbidities. Categorized or there is the hypertension, diabetes mellitus, Cushing's disease, hypercalcemia, immune-mediated diseases, and chronic infections. The third one is modifiable and environmental risk factors. This is the one that we can influence or affect. Obesity, dietary factors, exposure to toxins, especially ethylene glycol, lilies, and NSAIDs, or non-steroidal anti-inflammatory drugs. So urogenital structure, risk factors, there are only one, urinary tract obstruction. So, in this table, we can see that the early signs of CKD is a subtle signs that we can find it in most of the patients that presented in our clinic or brought into our clinic. The increased thirst, polydipsia, and the polyuria. Decreased appetite, weight loss, and lethargy. They are all unsuspicious for CKD. So that's why sometimes we neglected to suspect CKD automatically in our patient. In progressive or moderate to severe signs, there is bad breath. So this is one of the hallmark of CKD. Well, there are diseases that causes also bad breath. But one of the peculiar sign of CKD cases are this uremic halitosis. And it also provides or exhibit vomiting and nausea, diarrhea, and constipation. So, contradicting, it depends upon the patient's presentation. If it is on diarrhea or it is constipated. Pale ulcerated gums and weak unsteady gait or gait, ataxia. So lahat po ng mga cases na yan, ay yung mga signs na yan, are very common to any other diseases na nakikita natin sa clinic. But here, in severe or end stage signs, you will see now the edema, anemia, high blood pressure or hypertension, toxicity symptoms like uremia, and for other signs, unusual or foul-smelling urine. So, actually, uremic din yung ang amoy niya. Then, increase or decrease heart rate. So, it's either bradycardia or tachycardia. So, in CKD, we are always staging the patient. So, one way of staging it is by using the creatinine level. So there is stage 1, stage 2, and stage 3 and 4. Bilis-bilisan natin. So, the clinical signs for stage 1 is that asymptomatic or mild, which is usually prominent. But here in stage 3, elevated and frequency of the clinical signs are among observed, and hypertension is always there. So, what we have to do is to address the electrolyte imbalance and diet modification. In stage 4, severe clinical signs including anorexia, vomiting, diarrhea, weight loss, lethargy, and possibly the development of the uremic crisis or the high BUN and creatinine level. So that's for creatinine staging. Another staging that we are using is by comparing it to proteinuria and the urine specific gravity. Another is by using the staging CKD iris method or procedure by using the SDMA values. So we have different kinds of staging. So we can now assess which one is best to use. But everything of these are needed to profoundly discern the disease or diagnose properly the disease. So CKD is the loss of nephrons and the structural integrity. It's not the function itself, but the nephrons or the tissue. The tissue is the one damaged here. So such glomerulosclerosis, the hardening of the glomerulus, tubular atrophy, the tubules are shrinking, interstitial fibrosis, and vascular change. So this leads to a gradual progression of an irreversible decline in kidney function. So what are the implications of those? So in nephron, there are nephron loss or dropout. So imagine yung isang kidney, pagka namatay yung mga nephrons, so wala nang magpa-process. Including the glomerulosclerosis. Sa tubules naman, nagkaroon ng atrophy, as I have said kanina. Dito na lang tayo. So, I'm presenting this case for seeing that one of the challenges, because my title is about the challenges and the therapeutic approaches that we employed in our patient. So this is Shawi, a female French bulldog, a 3-year-old, and an 8.6 kilogram unspayed or intact brindle with white markings French bulldog. She was presented in the clinic with lethargic for 3 days, dehydrated 10% as we assess it, and tachycardia, nausea and vomiting, weight loss, initially referred for suspected nawala. Foreign body. Nawala yung karugtong. Foreign body. Kasi nga, from other clinic, dahil sa mga signs na pinakita, clinical signs na pinakita niya, they suspected na mayroong obstruction or foreign body sa loob. So the dog presented in a critical condition upon arrival at the clinic. The clinical signs developed gradually over the past several days. This was taken from the owner's history taking. So, no history of illness for over a year. So, wala daw sakit. Yun ang sabi ng owner. Fed with a commercial dog food 3 times a day, no exposure to toxins or sick animals. Kasi nga, paboritong dog nila ito, nasa loob lang. Up to date, yung parasitic niya, against endoparasites, at yung sa ectoparasites naman niya. However, vaccinations are not updated. Indoor pet with minimal outdoor exposure and suspected of possible gastrointestinal foreign body. Dito nilagay. Okay. So, by physical examination findings, dry nose, sunken eyes, loss of skin elasticity, pale gums, and the halitosis. Meron na siya. Then rough coat, skin problem, konti lang naman yung skin problem. But we still put it here para ma-emphasize na na-check talaga siya ng maayos. Loss of appetite, wobbly and weak, uremic urine smell. So, diagnostic test, we've done our CBC. So, by these values, we see chronic systemic stress like the uremia, due to uremia, dehydration, or chronic inflammation. Mild to moderate normocytic, macrocytic, hypochromic with anisocytosis. Despite 10% dehydration, hematocrit is not elevated, suggests true anemia. So as you can see, for her blood chemistry, highlighted, creatinine BUN. So the results showed that azotemia is present, hyperphosphatemia, electrolyte changes with hypokalemia, hepatic enzyme elevated, hyperglycemia must be ruled out, concurrent diabetes mellitus. So, wala naman, hindi naman nag-appear yung mataas na glycemic level, so hindi siya diabetes mellitus. However, by comparing it to the staging with this creatinine BUN into what I have presented previously, na yung staging ng using creatinine, the dog has 280 mole per liter and considered to be stage 3 na siya. So, we also run for protein and specific gravity. So, the results is 2+. If we stage it through the protein, according to protein, she is on a stage 3 CKD. While using specific gravity values, isostenoria, kidney unable to concentrate or dilute urine, nasa stage 2 na siya. So, parang iba-iba yung result. Yun yung lumalabas pag i-compare mo lahat ng mga biomarkers. So, we done also biographs because of the reason na nung dinala siya sa clinic, may suspect yung other vets na foreign body. So, nakita natin, actually, hindi na namin tinignan yung, kinuhanan din namin sa taas, pero hindi ko na nilagay dito because of, I wanted to emphasize yung, kinuha na rin namin yung sa kidney. Because, yung measurement. So, we compared it, and the result shows that there is, in the left kidney, normal lang yung size. Yung right kidney naman, slightly below normal size. So there is a reduction or an inflammation to the other side. It's dependent upon that because X-ray cannot discern naman kung nag-inflame ba talaga. But anyway, what we have to emphasize here is there is a difference in the size from normal. So radiographic changes may lag behind functional renal deterioration. Dogs may exhibit advanced azotemia despite mild or no visible kidney abnormalities on the radiographs. This is taken from Ittinger, S.J. Feldman, AC, on 2017. So, disorders of urinary system. So, sabi, wala naman daw, pwedeng nangyaring walang changes dito, pero meron ng azotemia na nangyayari. So, it could be that our biomarkers speaks for itself. However, our radiograph does not. Because let us consider that the patient is a 3-year-old dog, not the typical CKD patients above 10 years old. So it might be that this dog is, because she is still young, okay pa yung structural o buo pa yung buong kidney. Wala pa yung nag-shrink, hindi pa nakikita. So in ultrasound, yung sa amin kasi, konti pa lang yung may ultrasound. So ang hirap din talaga siya ipa-ultrasound. So yung dog naman actually was in another province and I have to drive almost 1 hour or more para kunin siya and then dalhin na naman sa other clinics na may ultrasound because yung ultrasound namin ay hindi na okay. So we have only X-ray. So in ultrasound, yung tingnan na lang natin itong mga pictures na to. Si Shawi, napa-ultrasound namin. However, hindi masyado maganda yung picture, yung kuha. Kaya it was suggested na hindi na lang siya ilagay. Pero actually, yung picture niya is like this. Yung ultrasound niya. So, if we will take this out, para i-compare natin doon, it will fall under the stage 4. Sayang lang kaya hindi ko na siya nalagay. So, commonly, yung ultrasound should be, lalo na doon sa mga expert na sa ultrasound, yung expectation natin at expected natin na makikita is the irregular in shape, in contours, regular in contours, increased echogenicity. This is brought about because of the fibrosis of the kidney. And decreased corticomedullary differentiation. So parang nagiging ganyan na siya. Parang hindi nyo na nakikita yung marker na nandun pa yung mga tissue. So, this is common. Kidney size. In a stage 4 CKD, small and irregular and bilateral reduction in the renal size. So, ibig sabihin, yung kidney daw should be bilateral, yung pag-reduce sa CKD. However, what we have seen in the radiograph or the X-ray, isa lang yung lumiit, pero yung isa na iwan. So renal contour, irregular margins, and poor corticomedullary distinction. Renal cortices are thin and hyperechoic. So hyperechoic because of the fibrosis. Then echotexture, increased cortical echogenicity. There is fibrosis, mineralization, and glomerulosclerosis. Renal medulla may be hypoechoic or heterogeneous, usually hypoechoic. Then cystic changes or focal mineralization within parenchyma. Now, in pelvis and collecting system, renal pelvis may be dilated. So, malaki siya. Then, but commonly associated with concurrent pyelonephritis, pag merong infection. Ureters are usually not dilated unless obstruction or pyelonephritis also present. So, these are my, yung na-present ko previous slide, ito yung mga kinuhanan ko ng informations. So, we also tested, actually this dog was treated already with some medications for CKD and for stage 3 or stage 4. Then, it was suggested to check, because we have collaborated the results from protein test, the urine specific gravity, the radiograph. It was seen that it is a CKD case. However, to solidify those suspicion or that diagnosis, we use the SDMA. So, ang SDMA naman doon sa amin, bihira pa. And sakto na may isang clinic na meron na siya. So, dinala ko doon yung mga sample na kinuhanan ko. Actually, isa lang, pero kinuha ko dalawa para at least ma-compare, para hindi magbago. So, as we can see, this is the difference between BUN creatinine ratio and the SDMA symmetric dimethyl arginine. So, hindi na natin yan siya anuhin kasi those are definitions. So, dito na lang, interpretation, high BUN creatinine ratio greater than 30 suggests pre-renal azotemia. Dehydration, shock, normal, or low ratio with high creatinine, more consistent with intrinsic renal. So, pag sinabing renal azotemia, bago pa makarating sa kidney. Kasi pre-renal siya. Pag yung normal or low ratio, usually intrinsic, meaning yung sira or ang cause ng azotemia is coming from the kidney itself. So, dito naman sa SDMA, elevated SDMA with normal creatinine suggests early or mass CKD. Pwedeng magsuspetsya na tayo kahit na normal pa ang creatinine. High SDMA with elevated creatinine and phosphorus consistent with advanced CKD. So, as you can recall, yung kaninang pinakita kong blood chemistry, it is consistent of high SDMA, hindi pa pala, kundi consistent of BUN creatinine high level with phosphorus increase. Now, in SDMA, this patient has 79.5 microgram per deciliter, which is beyond to the higher limit of the CKD. So greater than 20 microgram, kidney disease probable. So siya, 79.5, siya doon na siyang mataas. So if we will relate that particular result to the graph of the iris staging, medyo maliit na, 54 in canine. Kasi dito sa baba, feline yan, sa taas naman, 54. So yung result natin is 79.5. So most likely, it is probable of chronic kidney disease. So differential diagnosis, we have search and review all the diseases that with the same clinical signs or have clinical signs that overlap to the signs of chronic kidney disease. These are acute kidney injury, the urinary tract infection, glomerulonephritis. So kung titingnan natin, yung mga clinical signs nila are almost pare-pareho. So, mahirap talaga siyang i-confirm kaagad. So, diagnostic indicators naman is creatinine BUN increased, isostenuria, small irregular kidneys on ultrasound. Actually, diretso ko na, sa ultrasound, pag advanced stage na talaga, nakita ko na para siyang nagkaroon ng lobules or parang bukol-bukol. However, I cannot testify talaga kung ano siya dahil hindi pa ako nakakandak. At saka hindi rin ako nagkandak nung halimbawa yung nag-pass away na patient ng CKD para tignan talaga sa loob. Kasi pwede man tayong mag-ask sa mga owners, sometimes inaasma nila na necropsy. So, however, the difference between the AKI and the chronic kidney disease, yung shoot up ng creatinine is actually, if you can monitor that, mabagal. Habang yung sa AKI, biglaan yung onset. Halimbawa, nagkaroon ng toxin. Tapos, like for example, yung example ko kanina, yung ethylene glycol, nakakain siya or ano siya ng ethylene glycol, mag-shoot up kaagad yung BUN creatinine. And if the patient was na-resolve yung kanyang problem, nabigyan siya ng medication, magbaba kaagad yung BUN creatinine. However, chronic kidney disease will stay high pa rin kung CKD talaga siya. So, other diseases, congenital developmental kidney disease, the endocrine disorders, neoplasia, liver disease, and electrolyte imbalances. Kanina, ang topic was electrolyte imbalances. So, kaya mahirap ang CKD talaga i-assume na CKD agad because ang daming disease na pwedeng mag-associate sa kanila. So, halos pareho, polydipsia, polyuria, stunted growth, meron lang mga differences, slight. So, our patient, to summarize, history, meron siyang polyuria, polydipsia, anorexia, weight loss, vomiting, and lethargy. Ito yung unang makikita when presented. Pero pag nasa stage or hindi pa siya nasa advanced stage, yung nakikita natin is parang normal lang yung dog. Physical examination, ito lang, meron siyang poor body condition, yung BCS niya. So, biochemistry, meron siyang high BUN and creatinine level. Urinalysis, proteinuria. Yung blood pressure, hypertension, meron siyang, nagkuha kami ng blood pressure. But this is a challenge kasi ang French Bulldog is very mahirap kuhanan ng blood pressure kung gamit yung oscillometer. Yes. Kasi maiksi yung paa, malaki yung breast, yung sa niya, madikit na yung kanyang panga. So, yung paglagay mo nung cuff, hindi kakayanin minsan. So, it is about yung tamang identification of the size of the cuff. Yung pinaka-importante. Balik muna tayo. So, there is, ang kidneys size differ. So, yun lang ang aking i-emphasize kasi I cannot go deeper than that kasi yun lang ang nakikita sa x-ray. So, sa CBC result naman niya, non-regenerative anemia, electrolytes, hyperphosphatemia, and hypokalemia. So, parang bugbog tayo sa kanina sa hypophosphatemia and hypokalemia. So, sa CKD, ganito rin siya, lalabas din siya. So, with SDMA 79.5 microgram deciliter, ang interpretation is severe kidney dysfunction. It could be AKI or CKD stage 4. With hematocrit and hemoglobin high, likely hemoconcentration from dehydration, kasi nga dehydrated and estimated at 10%. Red cell indexes, MCV high, MCHC low, with RDW high. It suggests of abnormal red cell production or shape, possible early anemia. WBC, neutrophilia, but could be possible infection, inflammation, or stress response. Kasi stress yung ating dog. Platelets, normal lang. So, ano lang siya? No thrombocytopenia, but platelet function may still be impaired in CKD. So, what we did for treatment, meron tayong fluid therapy, medications, dietary management, and supportive care. Now, for our fluid therapy, this is what we employed. Ito yung binigay namin. So, at 8.6 kilogram dog with 10% dehydration, so ang volume ng fluid is 860 ml. Maintenance dose of 516 ml per day with only ongoing losses. Nag-estimate tayo kasi meron siyang vomiting, tapos di ba meron din siyang polyuria, tapos minsan nagsusuka din siya, nagba-vomit siya. So, we expect for approximately 10 to 20 ml per kilogram. So, approximately 150 to 200 ml per day yung ating ongoing losses. So, total of 1,526 to 1,576 ml ang kailangan nating ibigay over 24 hours. Pero it could depende kasi sa CKD, pwedeng magkaroon ng overload, fluid overload. So itong over 24 hours na ibibigay natin, pwedeng i-increase natin if we see pag meron tayong nakitang edema or nahihirapan siyang huminga. So kailangan natin siyang i-reduce, gawin natin siyang 48 hours. Pero kailangan nating bigay talaga itong dehydration deficit. Kasi importante dahil yun ang needed talaga, vital. Tapos yung maintenance, pwedeng iakyat natin sa yung ibibigay nating fluid, doon na tayo mag-change. Pwede natin gawing 48 or lesser than 48 hours. Kumbaga, extend lang natin itong 24 para maiwasan natin yung edema po na yung overload. Okay. So, that's it for fluid. Then, we have the treatment. Initial stabilization. We give marufpitant, omeprazole for gastroprotectant, Savilamer carbonate for hyperphosphatemia. Tapos, kasi ito, available. Kaya ko ito ginamit dahil nabasa ko ito sa Lazada, Shopee, and I check it up sa pharmacy, meron din. So, mahirap kasi hanapin si aluminum hydroxide. So, mahirap at saka may danger of the aluminum toxicity. So, I go for Savilamer carbonate. Then, nagbigay tayo ng amlodipine. Usually, wala si enalapril. Wala yan. Pero pagka tuloy-tuloy yung BP, yung angat ng kanyang blood pressure, nagdagdag na tayo ng enalapril. Pero better sana kung bago natin ibigay itong enalapril, nakakandak tayo ng pag-check ng presence ng RAAS or RAAS, yung angiotensin, yung presence ng renin, angiotensin, aldosterone system. So, pero depende yan kasi kung tuloy-tuloy pa rin yung yung mataas na BP, subukan natin yung enalapril. Siya ang pwede nating i-partner sa amlodipine. So sa hypokalemia, ang binigay natin is potassium citrate. Sabihin na lang natin dito, nandito siya eh. Wala pala. wala pala, nasa sponsor to eh. Potassium citrate with sambong and DHA. Kasi parang ano na siya eh, parang go-go na. Potassium citrate kailangan mo, yung sambong tumutulong para okay yung kidney, tapos may DHA siya na kailangan, yung nasa omega-3 fatty acids. So of course, we have to supplement pa rin yung omega-3 fatty acids. I put it here, furosemide, dapat furosemide. Anti-edema, because honestly, the dog developed edema during that time that we provide fluid therapy. So, nung nakita namin na parang bulging, bigay ka agad. Kasi tapos reduce yung fluid na binibigay. Kasi baka hindi talaga kinakaya ng kidney. So, kailangan siya monitoring, very keen ang monitoring para mabantayan talaga ang patient. Then anti-anemia, we give EPO, pero this is with caution kasi nga pwedeng magkaroon ng problema tayo dito sa allergy. Kasi nga ang French Bulldog are common, ang common problem niya is yung allergy na pwedeng sa skin niya or pwedeng systemic na allergy. Tapos supplements, B-complex and iron. Of course, iron is very needed para sa red blood cell. Then hepatoprotective. Silimarin, nandito din. Kasama din yan siya dito. Silimarin, DHA, L-carnitine na produkto. So, kasi yun ang mga available drugs na madali nating kuhanin because of its importance sa treatment sa CKD. Now, as you can see here sa table, meron tayong ginawang BP medication for 10 days. For 10 days lang kasi na during hospitalization lang. So, at saka yung konting extension sa home medication na. So, during the time, sa day 6 niya, na pagbigay, dito makita nyo, 170 yung kanyang BP. So, ang binigay natin na amlodipine, nag-start tayo sa pinakamababa. And the problem, we have meron tayong na-identify na challenges dito or challenge. One is, walang amlodipine na para sa mga dogs na prepared para sa kanila. So biruin nyo yung maliit na tablet, 4 na beses mo siyang i-cut para makagawa ka ng 1.25 milligram. Tapos yung enalapril naman, madali lang ito. 4 din, 1/4. So, treatment, long-term goal, slow progression, yung kidney, yung manage natin yung symptoms to improve dog's life quality and ensure proper nutrition. So, same pa rin, pero long term lang ito. This is the everyday na dapat na may bigay sa patient. So, meron tayong mga prescription diets, renal diets na dapat yun din ang ating ma-promote. So, here, ito naman yung recommended namin nirecommend namin sa patient during the time of home medication for subcutaneous fluid therapy. So, Shawi is a chronic kidney disease patient, a French Bulldog. Ang challenge natin dito is walang literature na talagang eksakto para sa French Bulldog. Mahirap siya hanapin. Karamihan, Setter, German Shepherd, Shih Tzu, ganun lang. So, and we all know that maraming mga anomalies or problems si French Bulldog. So yun ang one of the challenges natin na nakikita. So, well, we have to manage the electrolyte. We also need to discern yung ano talaga ang cause ng CKD nitong aming patient. However, this is our limitation kasi kulang yung at saka yung owner hindi na rin gustong gumastos para maano nila para malaman lang kung ano talaga ang cause ng CKD nila. Hindi na ayaw na nila kasi malaki na ang gastos. Every blood chem that's 2,000 plus, CBC, meron pang SDMA 2,000 din. So malaki ang magagastos. So late stage CKD presents significant treatment challenges. So, yun na nga ang sabi. So, kailangan natin yung SDMA, i-emphasize talaga natin, dapat ma-incorporate na siya sa routine na check-up. So, usually, the primary focus disease, ito yung challenges, very common clinical signs, diagnostic tools or machines availability, then owner education and financial capacity of the owner. So, this is Chawi. So, yan na po siya yung video niya. Recent na video niya, yan. So, medyo matamlay lang talaga. Kasi hindi pa siya, ganun talaga pag CKD patient. So, in conclusion, ito po, SDMA should be part of the periodic evaluation of our pets. So, are we doing enough to catch kidney disease early in our patients? That's a question. And let us move beyond age-based assumptions. Hindi dapat natin isipin na pagbata pa walang CKD. Prioritize periodic SDMA testing and commit to a vigilant monitoring because the kidneys won't wait. So, pwedeng matay na yung patient natin bago natin makita na may problema. So, with that, happy and grateful tayo. So, thank you po sa time po.
Thank you so much, Dr. Edgar De Jesus. Thanks, Doc. Okay. We would like to acknowledge the presence of our past president and the member of the specialty board, Dr. Menandro. Doc, before we proceed with our last presenter, let's all welcome Dr. Menandro Valerio. A few words, Doc. Doc, may we have a few words from you? Or longer words?
I'm surprised.
Yes.
First of all, I would like to thank the attendees of these seminars and also the speakers who dutifully done the necessary laboratory testing and patiently treating the patient itself daily. I would like to commend the work of the doctor, the speaker here.
Edgar De Jesus.
It's from day 1 to day 10 had been monitored. That's exemplary. Most of them are in an outline form. So that's all. I hope everybody is get interested and educated on that topic. Thank you to all of you.
Thank you so much, Dr. Menandro. The Q&A question and answer will just send via email. All right. So, Dr. De Jesus, may we have your email address forwarded? Okay. To cap up our scientific program, our last presenter for today is Dr. Efren Celestino, Jr. is an accomplished veterinarian, academician, and researcher. He currently serves as the head of the Department of Veterinary Clinical Sciences of the College of Veterinary Science and Medicine and an attending veterinarian of the Veterinary Teaching Hospital in Central Luzon State University, since 2003. He finished his DVSM degree cum laude from CLSU and awarded by Intervet Philippines Incorporated as the most outstanding veterinary student of the Philippines in 2003. He obtained his master's and PhD degrees from the University of the Philippines, Los Baños, and North Dakota State University, USA, respectively. Furthermore, he is a Ford Foundation International Fellow and a Fulbright Fellow during his master's and PhD degrees. Driven by a passion for veterinary medicine and scientific progress, Dr. Celestino continues to contribute significantly to veterinary education, research, and small animal practice. So without further ado, let's give a round of applause to welcome Dr. Elfren Celestino.
Thank you, Dr. Mirasol, for that introduction. Good afternoon to everyone. I would like to take this opportunity to express my sincere gratitude to the Philippine College of Canine and Feline Practitioner for allowing me to present our paper entitled Incidence Risk and Clinical Management of Urethral Obstruction in Male Cats in Selected Veterinary Clinics in the National Capital Region. Incidence risk, for the information of everyone, is the number of new cases for a specified period of time in a population at risk. The population at risk in this study are the male cats. So male cats are more prone to urethral obstruction, you know it very well, compared to its female counterpart. To give you an introduction, urethral obstruction is one of the most commonly handled cases in feline medicine. This accounts for 10% of emergency room cases, and this can be life-threatening if unattended. So this is due to acute kidney failure, or synonymous to what we are discussing today, acute kidney injury. This is due to, the death is due to electrolyte imbalance. Dr. Mary told us that earlier, and acid-base imbalance. So, based on literature and also in my practice, a cat with urethral obstruction for more than 3 days can be life-threatening already. So if you see the cat is already vomiting, exhibiting lethargy, you suspect acute kidney injury. The most common etiology of urethral obstruction is number 1, urethral plugs, 60% of the cases. This varies from one literature to another, so there will be variation. But most commonly, urethral plugs. So you can see this in the practice, just like a white mucus with some like crystals. And this is due to inflammation of the urinary bladder. When the urinary bladder inflamed, there will be a protein leakage, and that protein will combine to the crystals to form the urethral plugs. Urolith, on the other hand, accounts for 10% of the cases. Uroliths are formed from crystalluria that depends on the pH of the urine. For example, struvite. Struvite is formed in an alkaline urine. Basically, the urine of a normal cat and dog also slightly acidic. So once it becomes alkaline, it will produce or it becomes susceptible to struvite. Other crystals like cysteine, oxalate, they are formed from acidic urine. 30% of the cases are idiopathic, so it's unknown. However, there are diseases in cats like feline idiopathic cystitis. This can also contribute to urethral plugs. Now, there is a debate about bacterial infection. So most literature I have read that bacteria is not associated with urethral obstruction. I'm not sure if you will agree with me, because if they do sterile cystosynthesis, they cannot grow bacteria, it's sterile. And the bacterial infection in urethral obstruction is due to catheterization. That's after you do catheterization. And there's also a debate on whether you put the catheter or not. And in my opinion, I will discuss later, if it depends on the discretion of the veterinarian actually, and the condition of the patient. I will discuss later. That picture is typical urolith with hyperechoic shadowing. You know it very well. Now, this is a picture of the cat showing the anatomy of the urethra. So the urethra is long in male cats, and as it enters the penis, it becomes narrow. So therefore, male cats are more prone to urethral obstruction compared to the female counterpart. Predisposing factors for urethral obstruction include frequency and amount of urination. So, a normal cat will urinate 3 to 4 times a day. So if a cat is urinating less than this, you may suspect there's a problem. In terms of the amount of urine, a normal cat will produce 50 ml per kilogram per day. So for example, we have a 5-kilogram cat, you should expect 250. Ang dami, no? Pero the cat's like 3 kilos, like 150 ml. So if it's less than that, you will suspect. And this is also done when you are doing monitoring, when you are having a catheter. Activity level, so a cat with that is less active are more prone to obstruction. So sometimes they enrich the environment so that the cat will play and become more active. The presence of underlying diseases, example, urolith or cystitis, breed. So in terms of breed, Persian cats are notorious to be prone to urethral obstruction. In our study, we found out that domestic short-haired is also included to be predisposed to urethral obstruction. Stress also. Cats that are of greater risk of urethral obstruction are cats between 2 years and 7 years. But this doesn't mean that cat cannot have urethral obstruction when it's less than 2 years or more than 7 years. Greater body weights, I think this is subjective because we have body condition scoring. So those that are obese or body condition score of 9, right? To be considered obese. Yeah. They are more, those that spend more time indoors, those that are fed with large proportion of dry food. In the Philippines, urethral obstruction is, specifically in male cats, is one of the factors contributing urethral obstruction, and the clinical management in the Philippines has not been documented. The objective of our study is to determine the incidence risk, the factors contributing to urethral obstruction in male cats. specifically in the National Capital Region. So this was conducted from January 2023 to March 2020, not March, sorry, this is December. I apologize for that. In selected veterinary clinics in the NCR. So we did collect data to selected veterinary clinics. We prepared communication letter, pre-designed questionnaire, and we include in the questionnaire the age or the breed, body weight, reproductive status, lifestyle, and diet. Socio-demographic profile of the cat. So these factors are analyzed using multivariate regression model using SAS software. So to determine the association of these factors to urethral obstruction. We did also descriptive statistics to determine what therapeutics, what laboratory tests, and management are done to urethral obstruction cases. So this table shows the incidence risk of urethral obstruction in cats in our study. So out of 1,332 male cats, 62 of them have urethral obstruction, either partial or complete. This is about 4.7% incidence risk. If we transcribe or equate these two proportions, this means 1 out of 21 male cats can suffer to urethral obstruction. So this findings is similar to what is found on literature abroad, that the incidence risk of urethral obstruction range from 1.9 to 10%. So in terms of age, junior cats, those that age 7 months to 2 years old, compose of the majority of urethral obstruction cases, followed by adult cats, and as early as 6 months of age, we can see also already an obstruction. So age doesn't matter, parang ganun nga sabi ni Dr. Edgar kanina. Now, in terms of breed, we found out Persian and domestic short-haired are predisposed to urethral obstruction. Those that weighing 3 to 4 kilogram 3 to 4 kilogram have the highest percentage or incidence of urethral obstruction. In terms of reproductive status, sorry about this one. This one moves. So take your look at the neutered. In terms of reproductive status, most of the urethral obstruction cases are neutered cats. In terms of lifestyle, most of them are indoor. And in terms of diet, you can see here that mixed and dry food diet are the one with urethral obstruction cases. And we found no urethral obstruction cases for wet food, if they're fed with wet food. Now, this is the result of multivariate regression model. We can see a tendency. So the p-value is 0.07 for the breed, 0.06 for the reproductive status. We can see that reproductive status and breed tend to be associated with urethral obstruction. Then we do odds ratio estimate for those factors that tend to be associated with urethral obstruction. As you can see here, for example, there is a point estimate. So to interpret this one, a point estimate for odds ratio less than 1 indicates that the condition or event is less likely to occur on the first group, and an odds ratio greater than 1 indicates that the condition or event is more likely to occur in the first group. So for example, the intact versus neutered, the odds ratio estimate is 0.24, meaning intact cat is less likely to have urethral obstruction compared to neutered cat. So this is about 24% less. Now, for the diagnostic methods or laboratory tests performed on presentation to urethral obstruction, you can see here that most veterinary clinic employed complete blood count, blood chemistry. You can also see here that 5 urethral obstruction cases are subjected to SDMA tests. So SDMA test, as mentioned earlier, is a more accurate test to detect early renal disease. Now, the question is, will this replace traditional BUN and creatinine test, serum biochemistry test? So, in my opinion, it should be worked complementarily. Ginawa kay Dr. Cardenio, Reyna. So, yung lateral flow at PCR, dapat mag-complement sila. So, for example, here, there is an elevated SDMA, but the creatinine level is normal. So meaning, there is an early renal disease. So you can suspect that there's already an early renal disease. And there is also a case wherein the creatinine is high. This will give you a false impression that the animal has a kidney disease. But when you use the SDMA, it's normal. So meaning, this can be false positive because there is an elevated creatinine in those patients or animal that have lean body. Ayun. Just one example. In terms of type of crystals, most of the urethral obstruction cases have strobite. So 30.6%. Now, in terms of therapeutics, so pain medication, anti-inflammatories, antibiotics, kidney and liver supplements are commonly prescribed for urethral obstruction cases. And in case of complete obstruction, the management is catheterization. The analgesic given are majority tolfenamic and meloxicam. But as mentioned earlier, these are NSAIDs and has the potential to be not nephrotoxic. So maybe the reason of some of the veterinarian here is they didn't prescribe this one, maybe because they have the patient has an elevated creatinine or BUN levels. The most commonly prescribed antibiotic is cefovecin. So this is a long-acting cephalosporin. I didn't mention the brand, but for the reason for this presentation. And also, I think this cephalosporin is an nephrotoxic drug. So this should be used with caution. Now, the most commonly prescribed supplements are urinary acidifier. So this is maybe because they found that most of the urethral obstruction have strobite. So it is formed in a alkaline environment. So you have to acidify the urine to stop the formation of those strobites. So a lot of commercially available kidney and liver supplements were given. You can see here are the list. And almost all of them were prescribed with special diet. So crystalluria actually can be corrected by renal diets. And this is a table showing that out of 62 urethral obstruction cases, 29 of them were catheterized. This is equivalent to 46.8% of the cases. And urethral obstruction can come back, or it's recurrent. So in our study, 7 out of 62 cases had reobstruction. And in terms of survival is very high, 91.2%. So conclusion, urethral obstruction occurs in 1 out of 21 cats in this study. Domestic short-haired and Persian cats are of increase of urethral obstruction. Intact cats are 24% less likely to develop urethral obstruction compared to neutered cats. Most common laboratory tests for urethral obstruction in male cats include urinalysis, complete blood count, and blood chemistry tests. Now, recommendation for this study. So, to confirm the effect of neutering or association of neutering to urethral obstruction cases, a prospective study should be done. So this is a more controlled environment. For example, two groups of cats divided, and one of them is neutered, one of them are not neutered or intact. They are given the same environment, the same treatment, food, etc., and see which will develop urethral obstruction. So also, studies should be conducted regarding the efficacy of supplement to manage urethral obstruction, since these are routinely prescribed. Now, with regards to the use of antibiotics, so there should be a urine culture and sensitivity test so that we can see if we can give, so that we can give antibiotics, or we can warrant the use of these antibiotics. Now let me present to you one case. This is Fluffy. So 2 years old domestic short-haired cat. The weight is 3.8 kilogram, fed with dry food that lives indoor, and this cat is intact. So Fluffy is presented with an over-distended abdomen that can easily be palpable, as you can see in the picture. So there is also a plug, as you can see there, when the penis is squeezed or massaged. So suggestive that this is a case of urethral plug. However, you can do ultrasonography to confirm that there is no urethral or other underlying condition. Laboratory tests conducted are urinalysis, CBC, blood chemistry, and ultrasonography. So for the urinalysis, we did a microscopic exam of the sediment and found it's true white. In terms of CBC, or complete bound count, there is leukocytosis, granulocytosis, polycythemia, maybe because of dehydration, and there is an elevated AST. However, ALT is not elevated. AST is elevated AST means there is a damage in the liver or muscle and muscle. But as you can see here, ALT is not elevated, meaning this is just muscle damage. However, creatinine and blood urea nitrogen are elevated, meaning there is already a kidney damage. And in urethral obstruction cases, this is acute acute kidney injury. Now, for the clinical management, first, we need to stabilize the patient. So as mentioned by Dr. Mary O, if you do anesthesia immediately, it's like euthanasia to the patient. So stabilize the patient. In urethral obstruction cases, there are hyperkalemia. So calcium gluconate can correct this one, or 0.9% sodium chloride. However, there is also metabolic acidosis. So if you give sodium chloride, it can aggravate acidosis. But if you give lactated ringer, it can correct acidosis. However, there is in the lactated ringer solution, there is potassium. So, but you have to prioritize the potassium, the hyperkalemia, because that one will become deadly when elevated. So, anesthesia, in our practice, if the cat is lethargic, we don't need to do, I'm not sure if ginagawa nyo. So it's actually painful to the animal, but the animal or the cat is already having pain in the bladder. So parang pag linagay nyo yung catheter, parang hindi niya na mararamdaman. So catheterization kung pwede. However, if you cannot do catheterization, who among you do cystocentesis? Because there's a danger of uro-abdomen, right? So case-to-case basis, kung hindi mo talaga siya ma-catheter, just to relieve the pressure in the bladder, we do cystocentesis. And so that you can do hydropropulsion later, or you can pass already the catheter. Now, between X-ray and ultrasound, so there are crystals or stones that are radiolucent, like the urate. So you cannot see it in an ultrasound, in an X-ray, but you can see it in the ultrasound. So you can give false positive, negative result. Now, after catheterization, so we usually do bladder lavage. So we put sterile saline solution just to make sure that the bladder has no crystalluria. So continuous lavage until the urine become clear, or if there is blood, becomes lighten. Now, so management is catheterization. We give antibiotics, IV fluids, urinary acidifier, liver and kidney supplements. So I failed to mention earlier that the creatinine level of this cat is very high, 1,600. So we did ask the client to come back for follow-up so that we can monitor if the creatinine becomes low. So we prescribe enalapril so that there will be an increased blood flow in the kidney, just to so it can help lower the creatinine and the blood urea nitrogen. Now, case 2 is Ash. 1 year, 5 months old, Persian Siamese. The weight is 4 kilograms. The diet is dry, the lifestyle is indoor and neutered. So we did urinalysis, CBC, blood chemistry, and ultrasonography. So there is crystalluria, leukocytosis, granulocytosis, polycythemia, elevated AST. And as you can see here, the creatinine and BUN are normal. However, there is decreased calcium and increased phosphorus and magnesium. The case of ASH this is a recurrent urethral obstruction. And so we did perineal ureterostomy on this cat. And for the medication, the same as the previous case. And this is Ashley after the operation. Or not after, 30 days maybe, or more after the operation. Now, after removal of the urethral obstruction, there is a condition we call post-obstruction diuresis. So, maybe the kidney will produce more urine than usual, and this can lead to dehydration of the cat. So we have to do, this warrants the use to continue IV fluid even after you remove the obstruction. Now, bacterial urinary tract infection can be due to the catheter, so you can also give a prophylactic antibiotic, but it depends on the judgment of the veterinarian. And also, catheterization can lead trauma to the urethra. So I have encountered a case wherein the urethra is traumatized, and after removal of the catheter, a week after, the cat has a very swollen testicles. And upon inspection, that swelling subcutaneously into the skin of the testicle is a urine. So when the cat, and suggestive to urethral tear. Yeah. And other complications is this urethral obstruction can recur. So this is the case of the cat. As you can see here, there is a urethral tear. This is actually the bladder is also distended, and there is stricture, and we cannot pass the catheter. So what we did is we suggest perineal ureterostomy for this cat, because it's very impossible to do urethral catheterization. So take-home message for this. So male Persian and domestic short-haired cats are of increased risk of developing urethral obstruction. So if these cats are, if you have a client that has this breed of cat, suggest other factors that can prevent or manage urethral obstruction, like you encourage them to do walking, or you provide lesser amount of food so that will to control the body weight. Reproductives may have important role in occurrence of urethral obstruction. Manage weight of the cat appropriately, fed wet food diet or prescription diet if they have already case, or they have already if the cats had urethral obstruction. So exercise and perineal ureterostomy is considered to be the last resort. Here are the literatures we have cited in the study, and thank you very much.
Okay, thank you, Doc. Thank you for giving us the opportunity in listening again because I think we have the same time during the PVMA. Okay, from Zoom participant, This is the question. In those cases where re-obstruction occurred, what were the factors for that to happen?
It's already given that rectal obstruction can occur. However, this can be lessened if we follow some strict diet, maybe, or the weight of the animal will be reduced, do exercise, and avoid stress, I think.
Yes, Doc. And just to add up, I think the University of Massachusetts, when MIT, when we send sample, because it's free, stone sample for stone analysis, they were studies that they say it will reoccur in 3 years' time, the stone formation in any animal. My question is, when do you consider doing perineal urethrostomy? Third block, second block, or fourth block? Kapag ilang beses na siyang na-block, magpipiyo ka na.
In my opinion,
Yes, Doc.
because it also depends on the budget of the client. But for as long as we can do catheterization, I think it's a more cheaper option to the client. But if the client, we should explain first, but that will become continuous, and later on it can be life-threatening, and this can lead to chronic kidney injury later. So as much as possible, maybe 3 times, so that if it has the money to proceed with the procedure, 3 times in my case.
Okay. Third strike, doon na perineal urethrostomy. Do you usually prescribe urinary acidifier concurrent with urinary diet like SOCD, or is prescription diet enough?
It depends on the crystal, actually, because if you give acidifier and the crystals found are formed in an acidic environment, you will not give the acidifier, just the prescription diet.
Okay. Any more questions? Dr. Coloyan?
Doc Elpren, my question is, when will you try to give an indwelling catheter, and when you will need to remove it? When?
Yeah, that's a very good question. I failed to mention, sorry, in the presentation. So, I plan to put an indwelling catheter in cases where there is a very enlarged bladder, because even though you remove the obstruction, that bladder will have a bladder atony. It's just like it cannot it cannot go back to its original form, and the animal cannot urinate even there's already a urine, and even though the blockage is still there. And also, if the cat has increased BUN and creatinine, because you should monitor the urine output of that patient, because that cat will be predisposed to polydipsia, post-obstructive polyuria. So, indwelling catheter is inserted also in that case, so to monitor the urine output of the cat, so that at the duration. If you rule out crystalluria, if there's no crystalluria, in my case, I will not put the catheter already. But if there is crystalluria, you have to put it also, because very high chance of recurrence, like 24 hours I have, sir. Yeah, if there's crystalluria.
Okay, Doc. There's a lot of causes of obstruction: crystal, flocculence, mucoid, even blood. Do you recommend flushing?
Retropropulsion.
Yes, flushing, and how often, and if it's okay to add on enrofloxacin on it, or add on ascorbic acid in flushing the urine? The bladder. Yeah. Yeah, Walpole.
Yeah, that is one of the practice I can hear from some of the veterinarian. They put acid, like Doctor, when we were talking yesterday, he will put a combination of 50-50 vinegar and water, but I think we should do some studies on that so that it can have no harmful effect to the urethra. Yeah.
Good afternoon, Doc. I would like to say something about the cause of infection or tear in the ureter. Sometimes, in my practice, we don't intend to force the catheter into the urethra going to the urinary bladder. For the first instance or first trial, if it doesn't pass through because of the obstruction, we put first or inject first the dexamethasone and antibiotic, especially amoxicillin, injectable. After 24 hours, the inflammation is gone, and the second introduction of the catheter, it passes through. And also, with the use of flushing, we inject normal saline in flushing. It does. Then sometimes, if the urinary bladder is so full, I tried to perform cystosynthesis because of the pressure pushing the obstruction outward. It can't, so we have to reduce the pressure first on the urinary bladder.
Yes.
After that, the catheter will pass through without any effort. That's my part.
Yeah, that's a very good.
Additional, with regards to neutered patient, especially the male, if it's neutered, what I have observed is that the penis of the cat is reducing its size. There is an, what do you call that? Stenosis because of no use.
Or like a disuse atrophy, I think.
Atresia. That's my observation.
Yeah.
Okay. Doc, my question is, this is an online question. Is it still possible for the cat that undergone urethrostomy to have blockage reoccurrence? Like given namin po na urinary diet na po yung cat.
Yeah, there is. So maybe that is the idiopathic causes. So I mentioned earlier, it's like 30% have idiopathic cause, and we have to know that one. Why is it still having a blockage?
Yes, Doc. Tama. Also, any more questions from the floor?
Yeah, idiopathic. Actually, I haven't encountered a case like that, just from literature. So maybe there is a more expert on that kind of disease of the animal.
Yeah, I agree. With also with the sterile cystitis, no. Doc.
Yes. Yeah, I think that's a good question, because we have to wait for that cat to develop their external organ before castration. So maybe estrogen, so testosterone has a vital role in the development of the external organ, sexual organ of the cat. So maybe if a study also will be conducted so that we can prove the difference of castration before puberty and after puberty to verify or to know the effect, if it is true or not.
Okay. Any more question? Doc?
Doc, what is your comment regarding the, what you call that, the removed urine sample from the obstructive bladder, wherein under the microscope, it showed plenty of blood with an organism circling around? What could be the probable suspect for this?
Yeah, if it is done in an sterile way, because like maybe there is a E. coli is from the GIT, right? So, and the penis is very near to the anus. So maybe if there's contamination, we have to rule out contamination first. Because also, in some literature, they said E. coli bacteria can also be found in the urine. So if that's the case, if there is, we rule out contamination, there could be an infection into that
Actually,
urine.
there's no contamination.
Okay.
So, since E. coli is a motile organism, could be probably observed, especially in the blood-soaked excretion of the bladder.
Okay. So, it's a, yeah.
Thank you, Doc. Any more question from the floor? Okay.
May I add to that cause? Because during leaking, the patient usually lick his anus, and also at the same time is licking his penis. That's why there's an interchange of microorganisms leading to that infection.
It can be a case of ascending infection.
And with regards to neutering, this is what I have observed. If you neutralize the male, not reaching 6 months, it will not have a desire to mate. As in the dog, if it's not yet reached the age of 6 months, it will not exhibit the sign of sexual intercourse. But after that, reaching at the age of 1 year or 1.5 years, even if you neutralize the dog, you do perform a surgery, removing the testicle, the secondary sexual characteristics is already developed, and in spite of the removal of the testicle, castration, the sexual activity is still, yes, which is nakakahiya sa mga visitor minsan. Nakaupo sila sa sala, no? Then here comes the male. They are showing the signs of desire. That's why I have observed.
I think it's the timing of castration has a vital role. Yeah.
Okay. We'll wrap it up. We'll just check if there's more question online. Hearing none, I think we'll pass. Thank you, Doc.
Thank you so much. We now move on the awarding of certificates and plaques. I would like to ask Doc Randy in front and Doc Paul to help us give the certificate. Is Doc Paul around? Doc Paul? On behalf of the organizing committee, the Philippine College of Canine Practitioners, we sincerely thank all our speakers, our presenters, panelists, our specialty board, and all the participants of these remarkable contributions for the success of this forum. So, Doc Paul, may kausap pa? Philippine College of Canine Practitioners, Certificate of Participation. This certificate is proudly awarded to Dr. Olivia F. Inocencio. In recognition of her active participation as a speaker, picture. Dr. Sheda Aisha D. Hossein. Dr. Reina M. Cardenio. Dr. Manuel P. Granodozen, Jr. Dr. Yol Briner I. Tante. Dr. Jeneline A. Valdez. Dr. Ernesto Coluyan. Dr. Maria Lavinia A. Perez. Dr. Mary O. T. Senieres. Dr. Edgar V. De Jesus Jr. Dr. Harold Bal Hernando. Dr. Joey T. Tariga. Dr. John Dexter E. Presto. And Dr. Romilito M. Santos. May I request the presence of Dr. Valerio? Si Doc... And Dr. Elfren Celestino. May I ask the presence of Dr. Valerio to help us give the certificate plaque.
Okay. This trophy is given to VetMate Pharma Corps in recognition of your unwavering support toward the Philippine College of Canine Practitioner, given on the 16 May at Penglay Restaurant, Quezon City. Signed, Dr. Jeffrey Mar B. Carrillo. Also, same plaque trophy is given to Dr. Dennis Bernabe in recognition of your unwavering support to the Philippine College of Canine Practitioner.
Let's give them a hand of applause. Thank you so much, VetMate and Doc Dennis Bernabe.
Okay, we'll turn over to Doc Mary Ann.
2 days. Okay, now, once again, I am Dr. Mary Ann Navales Mirasol. Thank you for allowing me to guide you through this meaningful day, and may we continue to lead with knowledge, compassion, and dedication to our calling as veterinarians. Good evening, everyone, and see you at our next event.